Hello, everyone. We're just seeing a few more people jump into the Zoom webinar, so it's lovely to see all of you coming in. So good morning, good afternoon, and good evening to all who are joining us for the Global Health Workforce Network Youth Hub's 2022 online conference, Youth and Planetary Health, Sustainable Collaboration for the Future. My name is Catherine, and I am beyond excited to welcome you all on behalf of the conference coordination team. As we have seen, our changing global climate has induced adverse impacts in human health, including the growing threat of novel zoonotic infectious diseases and persisting levels of micronutrient malnourishment. So over these next 2 days, our conference will gather high-level speakers and distinguished youth leaders to discuss the growing role of youth in planetary health. Sessions will focus on youth engagement in planetary health governance, its integration in health and care worker education, and its connection with digital health, food security, and climate action. The Youth Hub serves to storytell these experiences that cross sectoral, cultural, and geographical lines. And it is not only to highlight the issues that matter most to youth, but to give testament to the tenacity, earnestness, and the moral authority with which youth engage. So the Youth Hub serves to amplify these voices and add weight behind collaborative youth action that protects the hope of greater global health security and that of universal health coverage. And so to open today's proceedings for the conference, I would like to invite the Director General of the WHO, Dr. Tedros Adhanom Ghebreyesus, to give a few remarks via a recorded video message.
Every year, more than 13 million people die due to avoidable environmental causes. The climate crisis is the single biggest health threat facing humanity. As young health leaders, you have a crucial role to play in addressing this threat, along with the many health challenges it brings. Young people are among the lowest contributors to climate and environmental degradation, and yet they will bear much of the burden, including the many negative impacts on health. Young people also make up more than 1/3 of the health workforce. So building climate resilient and environmentally sustainable health systems must include investment in education, training, and tools to meet these challenges. The health of humans and our planet are intimately linked. Your engagement, energy, and leadership are essential for protecting both and building a healthier, safer, fairer future for all of us. I thank you.
So thank you to Dr. Tedros for his words of encouragement to youth and also for highlighting the importance of planetary health engagement. And so now I would like to welcome Dr. Ayat Abu Agla from the Health Workforce Department of the WHO to give a keynote speech. Dr. Ayat, the floor is yours.
Thank you very much, and good morning, good afternoon, and good evening to all those joining us here today. It's indeed a pleasure to be with you on this important day and this important conference. While we be through the course of the 2 days discussing youth and planetary health and looking to a sustainable collaboration for the future. My name is Ayat Abu Agla from the Health Workforce Department at the WHO in Geneva, joining you on behalf of Mr. Jim Campbell, our director, who sends his best wishes and kind regards. Next slide, please. So, indeed, reiterating the words of the DG, the climate crisis is indeed the single biggest health threat facing humanity. Air pollution kills 13 people every minute due to lung cancer, heart disease, and stroke. 9 out of 10 people breathe polluted air due to burning fossil fuels. 3.6 people lack safe toilet globally, and 2 billion people lack safe drinking water globally too, with 829,000 deaths from diarrheal diseases every year by polluted air, water, poor sanitation, and tobacco that kills 8 million people every year. 600 million trees are chopped to make 6 trillion cigarettes every year. So with that, indeed, the World Health Day theme this year for 2022 was Our Planet, Our Health, working together, advocating and campaigning for a clearer, better and healthier future to all. Next slide, please. Now, from my revising and looking into the big stats that we just saw on the huge mortality and morbidity effects on health, we want to set a glance on addressing climate change within the health system. And indeed, it has increasing effects people's health and well-being, both directly through extreme climate events and indirectly by the threatening the capacity of health systems to protect health of their populations. The negative effects are particularly visible when it comes to healthcare facilities, as they are often not built to cope with increasing climate-related risks, such as climate events, including floods, storms, and droughts, and hence the floods and droughts that we see around the globe in these specific days. Especially in developing countries, they're particularly vulnerable as they often lack a proper infrastructure and a sufficient health workforce and suffer from inadequate water and sanitation services and energy supply. And as you can see here within the WHO, a number of guidelines, checklists have been developed together to ensure and to guide against climate resilience and environmentally sustainable healthcare and facilities. And indeed, one of the fundamental requirements and mitigation methods is to ensure that we have an adequate health workforce in number and in skills with decent working conditions, empowered and informed indeed to respond to these environmental challenges. Next slide, please. So young people, you're the future and you're the present. Youth represent the largest generation of young people in history, accounting for 1.2 billion people. Young people make up more than 1/3 of the health workforce, where based on our recent National Health Workforce Accounts data, there are around 17.29 doctors per 10,000 population worldwide. They represent around 1 in every 4 doctors and 1 in every 3 nursing and midwifery personnel. But as we can see, drastic disparities across these different WHO regions and settings with the highest disease, where we can show that the highest disease burden have the lowest density of health workers, as does the African region with only 13.3 doctors per 10,000 population, in comparison to the European region with the highest density of doctors of 120 per 10,000, where young people represent and the youth represent the majority of the world now, yet young people are the lowest contributors to climate change and environmental degradation and bear much of the burden and negative impacts on health. And hence you can see here the WHO, where we acknowledge the critical role that you play in these unprecedented challenges and that the world is facing. And indeed that you should be the active participants in shaping the lives and directing our future at the forefront of change and innovation, and have the spirit to make this happen. We recognize and involve youth partners and change makers in our work, and are committed to engaging in youth in many different ways, as this Global Health Workforce Network Youth Hub, as our WHO newly formed Youth Council, which brings together also different networks from health and non-health backgrounds from all over the world to provide advice to the DG on global health, on health and development issues. Next slide, please. So when looking into building planetary health competencies for the global health workforce, the theory that human well-being and continuity of existence inextricably linked to a flourishing and sustainable planet can no longer be ignored. Health workers are indeed the central towards stewarding the earth and its resources. However, the concept of planetary health is yet to be properly integrated into medical and health curricula globally. We recognize that indeed pre-service and in-service education and training needs to be instilled planetary health competency. It's complex undertaking requiring multi-stakeholder efforts and investments at various levels of health services and across health education sectors. But by addressing planetary health will require transformative education brought about by institutional and instructional reforms to repurpose the training, as well as policy approaches that will ensure that through education and training, which is competency-based, extending beyond biomedical boundaries to adequately include recognition of the impact of social inequities on the patterning of disease through jobs and careers within health and other sectors that are purpose designed, fitting the role and the competencies of the health workers and catering to the corresponding level of services, delivery of practice to enable the youth, to enable young career professionals, to enable you, the future, to respond to these social determinants of health, to advance health equity and environmental sustainability and climate justice. Next slide, please. So with this and through the course of these 2 days, so we'll be hearing, as Catherine kindly mentioned, from different stakeholders, policymakers, implementers in the field. And towards the end of the forum, we'll also be hearing from our different global health workforce network hubs, health labor market, the data, the gender, the educational hub, community health workers, and seeing how they collectively and we collectively contribute and collate towards a better and healthier future. Now I'll leave you with these key takeaway messages. Let's engage and empower youth as we are with you here today as active partners for building climate resilience and sustainable health. We call to include you in all aspects of climate and health, in advocacy, in policy, planning, and decision-making through our different platforms, including this, within your local communities, within your national countries, and within your regional sectors, and invest in youth leadership and education and training, and indeed, call to integrate core climate change competencies into scopes of practice and all other related aspects of health workforce and development. And with this, I'd like to thank you all and wish you indeed a very joyful, fruitful, and productive conference. Thank you. Over.
And thank you, Dr. Ayat, for your powerful words on youth as agents for building meaningful advancements in planetary health. And it's incredible to see how the WHO is supporting all of this. So thank you for all of your work from all of us. I would now like to hand over to Dr. Maria Neira, who is the Director of Environment, Climate Change and Health at the WHO. She will give us a brief presentation. So Maria, the floor is yours now.
Thank you very much. For some reasons, I cannot put my camera. I think the host is not allowing me. So if you want to allow me, I will be happy to be on camera with you. The message I'm receiving is that the host will stop it. Here I am. Fantastic. Very nice to see you. And honestly, I mean, being with the youth is so, it gives me a lot of energy. So I'm extremely happy for this opportunity to share with you. Thanks very much for inviting me. It's a huge responsibility as well to talk to you because you always need to say something at least stimulating or something that will force you to think or to be motivated. And it's difficult to find the right message for that. But thank you so much for the responsibility and for the opportunity. You heard from Dr. Ayat the terrible figures about access to safe water, the terrible figures about tobacco, about air pollution, about the fact that people doesn't have toilets, about how climate change is affecting our health and our health systems. And what I will propose you today is let's think on a master plan all together, and particularly you, and I really feel sorry to pass you this responsibility, but this is why you are youth movement. That's why you are young people, and I'm afraid this is the wall you need to fight for it, and the wall that we are giving to you, not perfect at all, but this is the one that you need to deal with, and hopefully the one that you will be transforming. That's why let's try to transform those terrible figures into something much better. Wherever you are, let me just to share with you some messages. Wherever you are, first, do not accept by anyone in the health system telling you, keep on your business as a medical doctor, keep on your hospitals, on the health of your patients, on the curative services, talking about energy sources of air pollution or climate change is not your business. Never accept that. It is your business. It is our business. There is no more business than that, because if we don't stabilize, if we don't address the root causes of our health, we will see our hospitals full with patients with chronic respiratory diseases, with problems related to the diseases that climate change conditions will exacerbate and create for us. So this is the first message for all of us, not only for the youth working on health, but for all of us. Never think that this is not your business, that somebody else will sort it out, the issues related to access to energy, or how to look at the transport system in that city. This is our business, because the way a country, a government will invest or take action on what the policy will be for them on transport, on sources of energy, that will condition enormously our health, the health of our people. So first thing, we need to put our influence, or trying to influence, in all the policies that will have an impact on the health of the people. And today, those policies are very much related to climate change and how we tackle the causes of climate change. So be empowered, be convinced that you have a role, and don't accept anyone putting you out with the excuse that you need to concentrate on the curative, on the hospitals, on providing care, which is definitely a fantastic mission for all of us working on health, but is as well fundamental that we tackle the causes and we make sure that our people will not be sick. So this is the first thing. Second, be very, very, very ambitious. You know, in terms of health, there is never an ambition big enough. You need to keep your expectations very high. You need to dream about having healthy people. Why not? Addressing the social determinants, the environmental determinants, making sure that we will do something about this huge problem of non-communicable diseases, chronic diseases, which are so much related to the fact that we are creating a society that puts all the conditions for those non-communicable diseases to develop. Third, your voices are so fundamental. Fortunately, I see that in the last months and even recent years, the voice of the youth is more and more included in dialogues, in panels, not in negotiations, certainly not on negotiations, but at least on events or where the issues of climate change are discussed. Make sure that you use all of those opportunities to raise your voice, but to propose something, to force your governments or your politicians or those who have the capacity to do it, to take some commitments. It's not just inviting you to the panels. Sometimes they invite you to the panels and then somehow it's covered. No, use that to make sure that there will be a kind of commitment. Okay, I participate on this panel. I state how much we are concerned about the issue of climate change affecting our health. And I want you at that panel to help me on this commitment, and this commitment. I think we need to always kind of challenge a little bit those politicians that invite you to the panels, into the presentations and the participation, to commit on something, to give you some feedback on whether or not they are serious with that commitment, and to take some responsibility on this invitation to you to participate and to have you on a program that it would be very nice to have a youth participation, but it has to be more than that. It has to be, they need to feel the pressure from you. I'm sorry, I'm putting a lot of pressure on you now on the request, but I think you have such an incredible role that we cannot miss it. The other thing I would like to share with you is that clearly we need to lead by example. And when I was even a young student at the Faculty of Medicine, I still remember very well doctors and nurses and all the health professionals smoking even inside the hospitals, or of course outside the main door of the hospital, the main entrance. Today, of course, this is absolutely unacceptable. Things, thanks God, changed a lot. But now we need to do something similar in terms of our way to commute, the way we recycle, the way we use the energy, how conscious we are about waste management and things like that. So I think we need to give a good example, and people will be looking at us because we still have a credibility. We still have these white coats. They represent for the citizens something credible. So we will be scrutinized and monitor in the good sense, of course, and that's why we need to give a good example individually. So we need to take the bus, we need to use our bicycles if you can do it. We need to make sure that nobody will see us with plastic bottles and then throwing it away, but we need to give the good example. But at the same time, as the health system, we need to make sure that we will reduce our own carbon footprint. This represents, as you know, between 5 and 7%, and is particularly for the medium, low, and high economy countries. Of course, other countries, they are not even contributing at all to the greenhouse gases emissions. But for those that are contributing, we need to lead by example and reduce the contribution to the carbon footprint of our own health system. And I think is a motivation, is something that will give a good example, and is something that will contribute to reinforce our credibility when we then prescribe a more sustainable and when we tackle the causes of climate change. This is something that I'm sure that you need to be engaged. I'm sure that you know the initiative of WHO, the Attach, launch at the COP26. You are perfectly aware of that. And we need to now mobilize the community to join that. As I say, it's very rewarding for people working at the hospital level, and I'm sure that will generate a lot of movement, and joining forces is the best way to address it. The other messages that we like to share with you in terms of transformation. As you know, we need to transform, and again, this is a big task and a big challenge, but we need to transform the way we use energy, the way we generate energy in our society. We need to be behind pushing this acceleration of the transition to healthy, clean, renewable sources of energy. This will be such an incredible positive outcome for our health if we stop to combust the fossil fuels, if we stop to burn fossil fuels. The first benefit will be the reduction of air pollution that, as you know, it kills 7 million every year. This is absolutely unacceptable. That's why nobody can tell us that this is not our business. 7 million deaths. is our business, definitely. And tackling the causes of air pollution by changing and accelerating this transition to healthy, renewable sources of energy is fundamental. And we need to argue there. We need to provide all the scientific evidence we have, and we need to accelerate. And you, youth, can be the energy that push for this energy transition. I'm sure that you are the good energy that we need for that, and to change it to a good energy, our society. The second thing is that we need to do the transition to more sustainable food systems. Again, we can generate so many health benefits if we go for healthier diets on a sustainable food production, consumption, and waste management. And the third one is how we transform our cities, our urban plannings. And again, we need you in all of that. That's why, and I finish here, I have several prescriptions for you all together. So I will include myself as well. Let's prescribe the following. Wherever you are on a small village, or you are at home, or you are on a little community, or you are on a very isolated rural area, or you are a minister of health one of these days, wherever you are, please use your influence and your space, and do it by prescribing to mayors. If you have opportunity to talk to mayors, the mayors needs to be the ones looking at sustainable transport, providing, reducing the causes of air pollution, be the one behind and then disturbing them on the positive way, but putting pressure on all of that. So prescribe to the mayors, prescribe to the head of your hospital, wherever it's a small hospital or a big one, or a small healthcare facility in the most isolated area. Try to reduce your carbon footprint. That will generate economy for the healthcare facility, reduction of the carbon footprint, rewarding for the staff, and in a more beneficial for the health of the people that will use that healthcare facility. Prescribe to your heads of educations or universities of masters. Make sure that, again, you put pressure on them to incorporate recommendations related to climate change and health. Of course, at global level, we need to do that on a more, at the government level, trying to do it more systematically, but your role is fundamental as well. And by joining forces, I think we can create this transformative, positive movement that we all needed so much in these critical, politically very strange times. The voice of the youth, the voice and the action of the youth will be absolutely fundamental. And I have no doubt that the transformation resulting for that will be very positive. Thank you very much, and very happy to be with you today.
Thank you, Dr. Maria, for your words on encouraging youth. They're incredibly meaningful, and especially your words on to tell us to be more ambitious and to challenge the business as usual on climate change and also health issues that matter most dearly to us. Your energy and your story are incredibly inspiring. So we really thank you from the bottom of our hearts on sharing both your drive and also your hope of what youth can achieve together. So thank you again. And so this concludes the opening ceremony for this conference. And I would now like to hand over to Adriana for the next session, Bridging the Global Gap, Advancing One Health Through Governance and Advocacy.
Thank you very much, Catherine, for the introduction. And I really enjoyed the opening session. And like you mentioned, the energy that was given by Dr. Maria and also Dr. Aya, that was truly amazing. Now we are going to go to our session on governance. So my name is Adriana Miranda. I'm part of the organizing committee and also a medical student. I will be moderating this session. So the session is based on our experience with the recent global outbreaks such as SARS, H5N1, and the COVID-19 pandemic, which have shed light on the importance of the human-animal-environment interface emphasized by One Health and Planetary Health concepts. It becomes clear that there is the need to integrate the concepts across governance domains, from government activities, policies, to organizational structures. In this session, we will learn more about planetary health governance from global, regional, and national perspective. How do we ensure sustainable adoption of planetary health governance? How can countries globally learn from each other? Most importantly, what is the role of youth in unraveling these challenges? Our discussion will answer these burning questions. So before we go to the next part, which is introducing our speakers, I would also like to mention that our session will consist of 60 minutes of panel discussion, followed with a 30 minutes of interactive group discussion with all the participants, which will be done in a separate breakout room meeting link. So we will be sharing the meeting link in the chat box by the end of the discussion. Now, with us now, we already have our esteemed panelists who are experts in One Health and planetary health governance. Without further ado, I will introduce the panelists. So firstly, we have Dr. Frank Berthy, who is a One Health practitioner at the World Bank. He works on public health issues across the agriculture, environment, water, and public health sectors. Dr. Frank provides advice and technical assistance to $1.5 billion portfolio of investments, reducing risk at the human-animal ecosystem interfaces in various countries and regions. He was a lead author of the bank's One Health operational framework, published in 2018, and contributed to a number of other World Bank's global analytical pieces on health security, food safety, and antimicrobial resistance. A native of France, Dr. Frank has a doctorate in veterinary medicine, a PhD in molecular biology, and a Pasteur Institute diploma in bacteriology. Welcome, Dr. Frank, and thank you for joining us.
Thank you very much. I think, like Maria, I cannot start my video, but I'm pleased to join you. Thank you, Ariana.
Thank you. I think our tech will work on the video issue. Once again, thank you for joining us. Next up, we have Dr. Yewande Alimi, who is the Antimicrobial Resistance and One Health Program Coordinator at the Africa Centers for Disease Control and Prevention, and the co-lead for the Africa Union Task Force on AMR. Drawing on a range of experience that includes veterinary medicine, public health policy, and research, Dr. Alimi currently leads the implementation of the Africa Union Framework for AMR Control and the Africa CDC One Health Framework for the National Public Health Institutes in Africa Union member states. She also coordinates the activities of the Africa Union Coordination Group on Zoonosis. Welcome, Dr. Yewande.
Well, thank you and good afternoon from Addis Ababa. And thank you so much for having me today as a part of the panel. Thank you.
Thank you very much. And our next panelist is Dr. Nadia. So Dr. Siti Nadia Tarmizi is the Secretary of the Directorate General of Public Health at the Indonesian Ministry of Health. Trained as a medical doctor and epidemiologist, her career at the Indonesian MOH spans over 2 decades. Prior to holding her current position, she served as Director of Prevention and Control of Direct Communicable Diseases from 2020 to 2022, and the Director for Prevention and Control of Vector-Borne Diseases and Zoonosis from 2018 to 2020. As part of the Indonesian government response to the pandemic, she also serves as a spokesperson for the country's national COVID-19 vaccination program. In the G20 presidency of Indonesia, an intergovernmental government forum comprising the largest economies globally, she serves as the G20 spokesperson for health. Welcome, Dr. Nadia. Thank you for joining us.
Thank you, Adriana. Good afternoon, good morning, everyone. It's a very my pleasure to join this panel this afternoon. Thank you, Adriana.
Thank you. And lastly, we have our youth speaker who is joining from the other side of the world. So it must be very early in her place. So we have Tara Shid, who is dual MPH, who is a climate change fellow with the Association of Schools of Public Health in the European region, working and advocating for climate health competencies in public health curriculum. She identifies as a young public health professional working to strengthen health systems with a vision that everything and everywhere is public health. She holds a Bachelor of Health Sciences from Western University and a dual Masters of Public Health from Europub Health Plus in Governance and Health Economics. In the upcoming fall 2022, Tara will be an incoming PhD candidate for the Department of Geography at the University of Waterloo in Canada. Hi, Tara. Thank you for joining us.
Morning, everyone. I'm really excited to be here.
Thank you. Now that we have all the panelists with Dr. Frank and Tara, especially joining from very early in their world, in their part of the world, without further ado, I would like to start the panel. So once again, thank you for all the panelists for joining us. Now, I would like to start the discussion with a question about your experience with planetary health governance and advocacy. Our experience with the ongoing pandemic and the previous outbreaks that was mentioned has shown that the impacts of One Health and planetary health issues are not limited to health systems, but also socio-economic sectors. Climate change and antimicrobial resistance are also becoming the top health threats in the upcoming years. Based on your experience, how can adopting One Health and planetary health governance transform the way we deal with health and diseases? How effective is this approach in handling and preventing such crises that we face to reoccur? Perhaps we can start with Dr. Frank first.
Okay, thanks very much, Adriana. I think I would start by saying that maybe we don't want to be too much preoccupied by the words that we use. I see the juggling between planetary health and One Health, and there's also eco health, and I think we have to be fairly relaxed about that. Those words do not necessarily mean the same thing, but I think they come from the same roots, and eventually they go to the same place, and so it's probably very open. I think that fundamentally this is the approach that will drive transformation, and I'm saying this because by thinking in terms of, I will use One Health, by thinking in terms of One Health, I mean, you open your eyes on the connection between people, between the animals and the ecosystems they share, and sharing is probably a critical word there. And you open your eyes also on the drivers of what is happening to us, this accelerating pace of outbreaks, and the fact that most of them are coming from animals. And at the end of the day, when we look at all these drivers, we see that it's essentially around the farms where we have our animals, around the forests where wild animals would live, and also the cities where most of the population now is gathering. So it's really, in terms of drivers, farms, forests, and cities are something very, very important, and of course climate change and increasingly inequities, violence, and conflicts. And so when you look at this constellation of drivers, you rapidly want to shift to prevention. So instead of waiting, prepare to respond or respond, you want really to change the world we live in and the way humans are running their activities, so that we can move to prevention. So I think it's profoundly transformative.
Thank you very much for your answer. I think it's very important that you highlight the importance of prevention and how One Health framework focuses on prevention. Now, Dr. Iwande, perhaps you have something to add and share about your experience?
Thank you so much, Adriana, and definitely agree with Frank. There is this need to make our messaging quite simple. The whole concept of this is really to adopt a more holistic means engaging all relevant sectors. For the longest time, I mean, One Health has been primarily focused on 3 key sectors, but more and more we are starting to see that there is benefit in engaging other key stakeholders beyond national government agencies, thinking about research, thinking about private public partnerships, thinking about the community engagement, and really primarily this is where youth really come into play. So in our experience across the continent of Africa, I mean, we over the past few years, I use COVID as an example because I feel it's quite relatable to many of us. We understand the concept of One Health when you use more practical or relatable examples. So on the continent, we are starting to see more strategic collaboration, like I mentioned, not just from human, animal, and environmental sectors, but we're starting to see, for example, the ministries of finance thinking about private sector, most remarkable, of course, civil society engagement, and of course, the remarkable things that the younger generation, African generation, has really done when it comes to championing messages around a multi-sectorial approach for addressing such issues. I mean, in Africa, now we're seeing more practical examples. Our national governments are now sharing resources across sectors using COVID-19, for example. In the past, I mean, human health would strictly use their laboratories for human health related issues, and veterinary sectors would do vice versa. But now, I mean, at the onset of the pandemic, because of the scarce resources in our region, in the continent, we started to see more sectors collaborating, which is really what One Health aims to achieve. Shared resources to improve early warning system, improve surveillance, as well as diagnostic and laboratory networks. So really, we on the continent, we're really seeing improved multi-sectorial coordination. We're even actually seeing political investment in regionalism and trans-regionalism. Think Africa, Asia, sharing resources and best practices. So really, one of the key lessons that has come out from our experience in handling issues such as COVID-19 is that need for One Health approach. Over to you, Adriana.
Thank you very much. I think you raised a lot of important points here, which will be mentioned and discussed in the next part of the panel. So you mentioned about community engagement, multi-sectoral collaboration. So thank you very much. So Dr. Nadia, the floor is yours now.
Yeah, thank you, Adrian. So I think first, by definition, is One Health is like a unifying approach, yeah, that aiming to have a sustainability, balancing, and optimize health of people, animals, and ecosystems. As we are aware, most of the pandemics or any disease that make such as a potential pandemic, it's we know like 70% up to 80% is come from zoonotic disease, which mean that there is a transmission between the animal disease to the humans. And if we see, well, it's not only talking about the health of the peoples and animals and ecosystem itself, but One Health will be including about how the multi-sectors and multidisciplines are playing, including the environment, the animal, and the human itself. And then we have to talk about another thing you mentioned, you only mentioned about the community or the society. So these 3 big things, if we talk about One Health, not only about talking about health in among the animal, human, and ecosystem, but how the intervention and the collaborator between the multi-sector, multidiscipline, and the society is one part of how we are. If we want to talk about our experience in the pandemic COVID-19, in the COVID-19, which means that one of we should be prepared for the next pandemic. The reason COVID-19 pandemic itself has been identified a loopholes, yeah, in our current global health system, which mean including in Indonesia national health system. It's I think COVID-19 has make many health system recognize that the current system is not enough for pandemic preparedness in the future. And one of course, that we are learning is that we are going to have like a national health system transformation. Of course, not only for prepare the pandemic in the future, but including the how we can make stronger health system, which include that One Health implementation that we encourage at the global, regional, and national have a very strong collaboration. And one of the concrete example within the G20 Indonesia presidency, we are conducting one of the side event regarding One Health in G20 Health Working Group. And it's not only about how to strengthening the One Health policy brief, but including the third health working group, G20, with the theme of the antimicrobial resistance. As the result, there will be like G20 call for action for AMR as one of the outcome of document. So over to you, Adriana.
Thank you very much for sharing your experience. Thank you for also pointing out about the importance of improving the national health system, moving the paradigm from not One Health approach to more One Health and multisectoral approach, and also Indonesia's experience with the G20. And as mentioned by Dr. Yewande, regional approach and international approach even is also important in One Health and Planetary Health approach. So now we have Tara. Tara, if you may also share about your experience in Planetary Health education and how important it is, it will be very great. Thank you. Over to you.
Yeah, no, I echo what everyone has been saying as in the panel. I think what my role is here is that, you know, we're seeing in the workforce that we need to know the concepts of One Health. We need to have planetary health governance. Public health workforce and health workforce in general, the role of what health is doing now in the profession, it's changing so much. We're expected to be able to work in so many different disciplines. And I kind of see like health workers in a way as connectors to, you know, be able to work with people from geography, from environment, from health, to be able to transform, you know, the health system to address these issues. And COVID was such a great example of, you know, how much health is kind of across all disciplines. But I find that we're not prepared as young professionals. And so I work with the Association Schools of Public Health in the European region. And what we did was that we did a survey looking at exactly what is the climate change environmental health competency framework in our education system right now. And we found 64% had a little bit of curriculum teaching us One Health concepts, planetary health, but they're also kind of a bit ad hoc. They were kind of just added in, and we weren't being fully prepared to be a workforce in the transformative, sustainable climate health system that we're becoming. And so to me, that's a very big issue, because how do we adopt One Health at the governance level if we as a workforce, the new coming in, we're not fully prepared? You know, my vision of public health is that everything and everywhere is public health. We're not saying that maybe the whole responsibility of addressing all of these solutions are going to come from the health workforce, but we do have a proactive responsibility to play. And so it's really important that, you know, we're being trained in this area. And so from our experience, what we've been doing is that we've been trying to accelerate integrating climate education first at our training level, at our education, at the institutions, because at the moment, you know, it's lacking, and we need to be, if we want to be effective in our role, we need these skills. And so for me, I think that the public health response really includes not just, addressing what everyone's saying at the services level, being able to deal with climate hazards or, diagnose health status, mobilizing partnerships, but from the fundamentals, really training from the very beginning. And I think that's where kind of youth have a big role to play. So I'll take it back to you.
Thank you very much. Um, so the issue that you're raising is very related to a question that I would like to ask Dr. Frank Bertie. So you mentioned a lot about capacity and training, and I think this is related to the World Bank One Health framework that is authored by Dr. Frank Bertie, which mentioned that there are 5 domains crucial for the One Health operationalization. So the stakeholders, financial and personal resources, information, technical infrastructure, and governance. So you mentioned the need for personnel to have more and better training. And another issue that I think should also be raised and be the focus of everyone is that even with the current condition of many of the resources having little to no training, we are also facing issues that countries all over the globe are having different capacity. So it is known that countries globally have different capacities, technical capacity, personal capacity, and also infrastructure. And so I would like to ask Dr. Frank, based on your experience, how can countries, both the countries that is perhaps considered as a richer country and countries with more limited capacity, adopt One Health governance with sustainability in mind?
Thanks, and it's a bit of a difficult question that you're asking now, but this is an important one because this is really hitting the ground and One Health in action. I would say that this is also an important question because a lot of people think we need more money. We need more money for this. We need more money, and in fact, there may be a need for some money, but money will not solve everything. And I think that the critical point is really governance there. How people will work, the ones with the others. I very much enjoy when Tara says that everything is public health, and so you really have to bring those different sectors. I would say that different countries will have different models because of their institutions, because of their culture as well, and so we need to respect this. And what also is important is to recognize some catalytic events, and sometimes it's unfortunately an outbreak that becomes a catalytic event. I see what is happening in West Africa after the Ebola outbreak has been really changing the approach, the attitudes, and certainly now we see in countries more integration of the public health systems with the animal health systems and so forth. So I think we need also to recognize those moments and seize them and put in place very deeply rooted governance. Another example I would like to bring is Vietnam, and how this country has responded to the avian flu crisis in the 2000s, and since then becomes really a champion of cross-sectoriality, and you would say One Health. Thank you.
Thank you very much. Thank you very much. It's a very enlightening answer. And I would like to particularly point out the part where you mentioned that different countries have different culture that needs to be respected. And I would like to have a follow-up question on that, but to Dr. Yewande. So Dr. Yewande, the Africa CDC aims to empower its member states and achieve the Agenda 2063, the Africa we want, by utilizing a One Health approach. At the same time, it is known that there is no one size fits all, like implied by Dr. Frank, for building One Health capacity. So based on your experience, how can these governance approaches be localized in accordance with the needs and capacity of each country?
Thanks very much, and really well said by Frank. There is no one size fits all to this, and there are certain cultural and national contexts that must be taken into consideration and to establish such a diverse multi-sectoral governance structure. As you're quite aware, in the past 2 decades or so, the challenge really with operationalizing One Health is really the struggle to gain a firm institutional foothold. Means that One Health could be championed by the ministries of agriculture, for example, or the Ministry of Health, but they continue to exist in silos. So there's never been a sort of more intertwined approach to addressing shared public health threats, such as zoonotic diseases, AMR, food safety at all levels. One of the things that we are documenting across the continent is indeed many of our African Union member states have documented remarkable progress in actually institutionalizing One Health mechanisms or governance structures, as you might flag it. For example, we have seen very formal and fully operational mechanisms in some countries, whereas in other countries, it's more like a thematic working group. For example, they have a working group on antimicrobial resistance, on food safety, using a One Health approach. And other countries definitely have some informal mechanisms that have different key stakeholders, partner organizations, academia, and research organizations. But primarily, it's one thing that we can note across all countries on the continent is for a governance structure to really perform its objectives, it needs to be legally backed up. There needs to be some political commitment by national governments to actually institutionalize One Health. So one of the things that we encourage our countries, understanding that there are different governance structure at national and subnational level. Think about the different governance structures, federal government versus unitary government. It's quite diverse across the 55 countries. So one of the things that we are championing as Africa CDC and the Africa Union is countries need to look inward to understand and identify enablers and barriers for actually setting up multi-sectorial coordinating mechanisms. And really one of the things we are encouraging all sectors is we must lead through a better structure for coordinating and collaborating. Think about issues that need a One Health approach. How can we address them collectively and not wait till, for example, thinking about rabies as an example, not leaving it to the veterinary sector or the ministries of agriculture to report a spillover or an outbreak in human population before engaging in a collaborative mechanism to eradicate rabies. Next is really communication. As much as we, like Frank said, we say things like investment, we need more funding for One Health. There are really basic things such as communication. How do we really identify key messaging on One Health or planetary issues that can go at national, subnational, as well as community level? And finally, it's really around how can we have more national political commitment as well as domestic financing for such mechanisms to actually operationalize all of the objectives they would like to attain. So this is really something that we are really trying to work on at a continental level to really advocate for more countries to leverage on shared resources, for example, laboratory networks across all sectors. But most importantly, how can we then also as Africa Union leverage on our convening power as well as our political power to nudge our 55 member states to really adopt and embrace a fully operational One Health mechanism. Lastly, just to highlight a few of what Africa Union is really doing. I mean, we have showcased really high-level continental approaches, like the recently in 2020, the heads of state made a political declaration for antimicrobial resistance, and that is the first of its kind that has come out from the continent. And member states are now benefiting because there is this stronger political power to drive interventions, domestic financing, as well as support operationalization of One Health. So over to you, Adriana.
Thank you very much for the very comprehensive answer, Dr. Yewande. Now, I would like to firstly discuss more about one of the points that you mentioned to Dr. Nadia. That is the need to look inwards to each country to identify barriers and enablers for operationalizing One Health. So I think one of the very unique thing of Indonesia's health system is that one of the backbones of its primary healthcare are community health workers or health caterers. So they are not doctors or professionally trained healthcare workers, but like grandmas and villagers, something like that. And a similar program on veterinary health has also been created by the Indonesian Ministry of Agriculture. And so how important is community empowerment in this context through caterers in Indonesia's One Health approach? And what can other countries learn from it?
Thank you, Adriana. So I think in terms of One Health implementation itself in Indonesia, before COVID-19 pandemic, in fact, is Indonesia one of the lead country for zoonotic disease action package. That this is the initiative of Global Health Security Agenda. So as we know that there is like international health regulation, and then there another initiative, what we call it One Health, after we are facing the swine flu. And then after that, we have noticed there is a need to, again, increase our capacity in terms of the pandemic response. That's why later, after joint external evaluation that of international health regulation and WHO evaluation, that globally, there is an initiative, what we call it the Global Health Security Agenda, which we have like 13 action packets. And Indonesia, one of the lead for the zoonotic action packets. And this zoonotic disease action packets, in fact, is a One Health implementation of strategy. A lot of things already done by us, how to integrate the effort from the human side, animal side, and environment side, including we have like collaborate training module, what we have at the ground level for the health staff in either who manage the human health, animal health, and wild health too. And then we have like integrated surveillance that connected these three surveillance, as we aware that if we want to detect some changing before it goes to the human, we need to have advanced surveillance at the wild animal, and then of course in the animal itself. And if we talk about, you mentioned one of the unique health system in Indonesia is the community health workers or health carer. We agree this is a very important thing, and it has been a very essential component in our primary healthcare services. And in the most cases, particularly if we talk about related to zoonotic, like I mentioned, the public health workers that include human, animal, environment interventions, it should be conduct assessment on the data collection and up to the monitoring and evaluation together as one team. So this is of course not easier, because we have like in Indonesia for the human we have like post health for human, and then for animal we have like post health for animal. And we have a different health staff in these two institutions. And again, if we talk about how the implementation of this One Health approach, that we need to have and work together as a team, starting for our mission from the assessment, data collection, and monitoring. And ideally, what the effort that we have, it should be gone up to the grassroots, which means that we should have a joint health cadre, which include the human animal cadre, to work collaboratively. However, again, we still have two cadres, not one cadre, who manage these two issues. So we still have two cadres currently that we are working for, one for the human health sector and the other for the animal health sector. Although in one time they are working together. If there is some issue regarding such as a zoonotic disease. Of course, we have many of the health implementation at the rural area, which again, how we involve the society and the community, including the religious leaders. So I think if we talk about One Health, these three components, wild animals, and then veterinarian, and then again, human, it should be working together. If we talk about doctors, a veterinarian, there should be a same curricula that towards to the One Health implementation. So it make this One Health strategy can be something that really working at the grassroots level, including at the cadre level. Over to you, Adriana.
Thank you, Doctor. I think you mentioned some important points, starting from collaboration to also education, which I believe is where Tara is working. And I think we will get over to ask Tara more about it. But first, we will go to Dr. Yewande. It's also about collaboration. But before we go into the intersectoral collaboration that Dr. Nadia mentioned, we will first take a zoom out from that and focus more on the international interstate collaboration. I think that was also mentioned by Dr. Yewande in the previous answer. So you mentioned that there is high-level continental forum that was held by the Africa CDC, and also several approaches focusing on that. And so my question would be, one of the main goals of the Africa CDC is to strengthen the surveillance and information sharing between member states on One Health. And what are the challenges of these regional information sharing despite the high-level forums that have been held, for example? And how does national governance and policy decisions affect this goal? Over to you, Doctor.
Thanks a lot. A very interesting question, I must say. So I will try to make this as simple as possible, because when you start to think about issues around information or data sharing across all countries globally, it remains a challenge. That's something we must be quite cognizant of. As much as we make the concept of One Health quite simplistic, there are still several complex issues across different sectors. So maybe just looking at the continent, we, in terms of the work we're doing around improving information sharing, as well as surveillance system, is really the challenges for standards of surveillance, for example. I would use, once again, something I'm hoping that a few people are familiar with in terms of diseases. How rabies is being documented in the agriculture sector is different when you think about the IDSR, for example, for the human health sector. So every now and then, when we say we want to have more interoperable systems, there is the challenge of what are the standards. There is also the challenge around how interoperable are these systems. We must also not forget that when you bring different sectors together, there's also that issue of sectors are financed slightly different from another. For example, as we may all know, the human health sector is way more advanced in laboratory or diagnostic testing, as well as surveillance system, as well as investments are coming in, which is primarily driven because the mortality, morbidity, thinking about economic losses. But it's important that we are able to bring other sectors, such as the environmental health sector, as well as the ministries of agriculture, up to speed in terms of the standards for information collection and analysis. In Africa, one of the things we also see, for example, is our data is not always readily accessible. We're still collecting antimicrobial resistance data, for example, paper-based data. So it's impossible to really translate that data into information that can drive policy change or investment or can make a strong investment case for One Health. And think about things like there's just not enough laboratories or resources in Africa. And that's really the backbone of any surveillance system, any information sharing system. So one of the key things that across the continent we're trying to champion for our countries is really to lead a process of digitalization, a digital health strategy, whereby we can foster and harmonize the digitalization of health information across the continent. Africa CDC is also working on what we call the health information exchange policy. Primarily what this aims to do is improve that information and data sharing across regions. Think about across regions like East Africa regions and the countries within, but not just across regions, across also we sharing as a continent to the global health space, and also to leverage on how this can really drive policies and investments to improve health systems. So one of the things we are really encouraging our countries to do is embrace other means of information collection and sharing. Think about community-based surveillance systems or event-based surveillance. As the previous speakers highlighted, the use of community health workers, for example, is improving our informal way of collecting information and sharing across sectors. Think about wastewater or wildlife surveillance or vector surveillance. How can we really incorporate this into a more holistic surveillance system for the continent? So I think these are really crucial issues, is how we can really translate that information to make a strong case. And one of the things we notice is policymakers just need to understand the why. Why are we doing what we need to do? So it's really up to us right now to incorporate that into the work we do around information sharing and making it quite understandable for policymakers and the general public. Over to you, Andrea.
Thank you very much, Dr. Yewande. You mentioned about digitalization for data sharing. I'm very excited that you mentioned that, because we will also be having a session later on digitalization and big data. So hopefully it will complement your answer. And you also mentioned the need and the challenges, that is intersectoral collaboration and the need for holistic surveillance. Now I would like to also ask Dr. Nadia, who is from the national government, what do you think about this intersectoral collaboration? And because in the strategic plan of the Indonesian Ministry of Health, a legislation product on climate change action plan is planned in collaboration with several government bodies, such as the Ministry of Internal Affairs and the Ministry of Environment. I think Dr. Yewande has mentioned the importance of this intersectoral collaboration, and I think Dr. Frank also mentioned it in the beginning. But what do you think about it, and what are the current challenges that is being faced by the Ministry of Health?
Yeah, so if we talk about the climate change action itself, we have like a national coordinating body under our National Coordinating Bureau that connect all the activities and the coordination between ministries and between other sectoral body. So with this, we have like a national action plan. I think it's like a 22 until 2024 about how we are responding into the climate change. As we know that the Ministry of Environment and Forestry as the national focal point for the United Nations Framework Convention on Climate Change. They has the authority to initiate the regulation and the policy. And then they have to formulate the national plans for controlling climate change, the impact, and coordinate the implementation of the mitigation, and how to adapt the adaptation by the sectors related to climate change impacts. We know that if we talk about the approach to mobilize the multiple sectors, disciplines, and communities at the varying levels of the society, it means that we are working together to have foster well-being and the tackle of other threats to the health and the ecosystem. And then again, we have like a collective need, yeah, for clean water, energy, air, safe, and other like a food that will be on action on the how our activities regarding the climate change, and how again later we are contributing to the sustainable development. So with this our national action plan for the climate change, it will be some activities that we are put in our strategic plan of the Ministry of Health. So because of the need, like I mentioned about have the collective need for the energy, air, and everything, which referring to the intervention and the climate change, again, of course, in the strategic of the Ministry of Health Indonesia, we should include any activities that related to this action. In terms of the planning of controlling the impact of the climate change, like I mentioned, Ministry of Environment is responsible for preparing the climate change adaptation and action plans. Again, of course, will be discussed between the ministry, and then the adaptation of plan become a reference for the sector to prepare an adaptation plan, including in our sector, in the health sector. So in this case, the Ministry of Health prepare a climate change strategy, activities, and adaptation plan in the health sector. And again, to ensure the implementation of the adaptation of the action plan itself in health sector in each region, the plan was integrated in the regional planning as required. And again, if we see here, the role of the Ministry of Internal Affairs that have the authority to formulate the regulation at the regional, for example, at the province and the district level, including how to guide to commit on the financial and other regulatory system. So this is the way how we make intersector collaboration. And again, the challenging is with so many involvement of the other ministry and so many function that need to be between the ministry. Of course, it's not something easy to say that, yes, this is an adaptation plan, you adopt this and then you implement this, because you need someone working up to the ground level to implement this strategic plan. But again, like mentioned by Wendy about how integrate the surveillance is something that is easy to say, because we have a different system, and then we need to integrate and to coordinate. And that should be happen at all levels. Over to you, Adriana.
Thank you very much for your answer. I think you mentioned that intersectoral collaboration is very needed, if I may sum up your answer. But at the same time, it leads to quite huge challenges because it requires a lot of sectors, a lot of people. And follow up to that question, but to Dr. Frank Verti, I also noticed while reading the World Bank One Health framework that there is also another factors that needs to be considered and acknowledged in applying the One Health framework. And that is, for example, get gender-specific risk and the presence of vulnerable population like migrants. So my question would be, how will including these dimensions into consideration transform One Health approach in health systems? And considering the huge challenges in applying intersectoral solutions, if there is a need to prioritize, for example, 3 factors from these dimensions, what would that be? Thank you. Over to you, Doctor.
Thanks a lot, and thanks for this fascinating panel. I mean, it's a very rich discussion, an exchange of views and experience. So, I mean, certainly the gender dimension is an important one. We've been talking about gender for many years, but there is still so much to do. And by the way, I'm happy to be on this panel with the 4 ladies. This is great. So yeah, no, clearly gender. The other one is vulnerability, and sometimes yes, women are part of that. Children, displaced people, and the number of people in situations of vulnerability is increasing. Unfortunately, this is increasing, so we need to pay attention. I think that one thing that was produced by this One Health high-level panel established by the quadripartite organizations, the WHO, FAO, OIE, and UNEP, is a definition of One Health. Which was quite interesting, and one element that they bring is working at all levels of society, and I think this all level of society is extremely important. So paying attention to maybe non-conventional actors we don't necessarily think about, but they can make a huge difference. Thanks.
Thank you very much, Doctor. Now we will be going to Tara. I think there are a lot of questions here that is more suitable for you because you are the youth representative. I also have a similar question for you. I think I will start firstly with my own question. So you advocated for climate health competencies and public health curricula. What are the experiences and challenges you face as you advocate for planetary health as youth? And I think there is also a question here from Shahdan Yasser, who, which is very much similar to my question. I think you can also include that in your answer. So how actions can be taken to include One Health in medical education curricula and perhaps health education overall, not just medicine? And based on your experience, how to effectively advocate to institutions and also ministries so they can listen and adopt our proposed actions. Over to you, Tara.
Yeah, I mean, it's a loaded question. It's a continued battle, I would say, like where our journey is not over yet at ASFR. The moment we kind of brought in the climate health agenda, so many people kind of asked us like, why us? And I think Dr. Yawande also mentioned, like, is One Health, is it the industry of agriculture? Is it, the health agencies? Like, who's responsible? And people are scared to take that responsibility. But for public health, we kind of framed it in, when you think about social determinants of health, public determinants of health, how can you not think about One Health and planetary health? It is very aligned. But I think particularly for public health, the reason why we have a bit more challenges in our curriculum is that the public health workforce in general is already something that's very difficult to define. The roles very changing. And I think, something like this youth hub here, we encompass public health across the discipline from dentistry to medicine, but people have an issue with that. Like for some reason, terminology is always something that I face. I don't know why, but within institutions, using the word One Health, planetary health, eco health, that's always been a barrier for us to push the curriculum because they all have different frameworks, but all in all, the foundations and the goal is the same. And so I think we need to change that mindset. And myself, I'm now in a geography department, but every day I'm asked, why are you in geography? And then when I was trying to join the Public Health Society yesterday, they're like, but you're in geography. And I'm like, but I'm public health by training. And so, being patient with those conversations, taking the time to kind of explain your mindset, I think that's really important to be able to, face as a youth, because a lot of people, they don't think about it. They don't connect the dots until you have that conversation. And you have to think about, one of the most important competencies of any health professional or any professional in general is always communication, being able to, share the different perspectives and having patience to do that. But also with curriculum and One Health, something that we've always been also facing right now as a young generation is competencies are kind of, training guidelines of what we need, the skill sets that we need. And in every discipline, it's changing. And now we're in a digital era. Our competencies, what the skill sets that we had graduating 10 years ago, now they're changing every year. We're expected to learn so many skills. We're expected to do everything. And so it's exhausting. And, with the climate disasters, with so many things that are rapidly changing in our environment, how do we capture everything, and how do we create a framework that can be used throughout, time frames? It's a lot of resources. It's exhausting. But, from ASFR's perspective, we recognize that not everybody has to be an expert in it, but we argue that everyone needs to at least understand the basics to communicate knowledgeably and form partnerships, alliances in multidisciplinary settings with experts in these areas. But also with implementation, it is a challenge. In public health in European region, we found the right platform. We were able to utilize something called the EU Health Policy Platform, and that's an interactive tool that was created by the government there to be able to have conversations at high strategic level. It is very important to get that leadership buy-in. Once you have that, with any institution, whether it was medical school, getting that CEO involved, having them sign a statement, using that to your advantage from a youth perspective can actually go a long way. And that's why we have strategic meetings like COP27. We have all of these big meetings that everybody's always like, why are we spending so much money to congregate? But it's that motivational power, that time to kind of, get people refreshed and they buy in. It's really important from the leadership level, but from our end, it's the youth that kind of convince them, and it takes time. And schools will complain. I think Frank also mentioned, everyone always says is money, money, money. That happened in our survey too. Everyone's like, well, I mean, we could, implement it, but it takes money, it takes time, it takes resources. But I think if you frame it in a way where you think about, don't reinvent the wheel, think about what's already out there. There's so many great resources from World Bank, from WHO, from different schools that are implementing climate health curriculum. With medical curriculum, there's so many great examples of what they're doing at the University of Toronto in Canada. Right now, they're doing like a grade report where they're actually evaluating different medical curriculum. And I think these are really important, opportunities for us to tackle, because why continue to reinvent something when something already exists? And I think we have to kind of think about that mindset. And then also, I think one of the biggest challenges I also want to raise is, from a youth perspective, mental health is really important to be conscious of. When you think about the future and then you hear all the news, there's a lot of negativity about what we're facing. We have to kind of also think about the positive of it. And I think having that balance is going to really help us as youth really continue with the agenda. So I hope that answers some of the questions, and I'll leave it back to the other panels.
Thank you very much. I think it's very helpful for us as youth. I like that you mentioned the need to expand our mindset, start a conversation, and that youth has the power to convince a lot of stakeholders, but that it will need time. And so that's why expanding our mindset is very important. And I think it also quite answer a question by Zahra from Iraq about how can students apply the One Health concept. So now, before we go to the interactive group discussion, so there are still some questions here, but I believe that it would be better if we can answer it directly in the interactive group discussion. So I would like to close the panel with asking all the panelists here on what youth can do. I believe that you have mentioned from the beginning that youth have unique advantages in advocating for planetary health and One Health. But what exactly can we do to embark in the journey of planetary health and One Health governance and advocacy? Perhaps in 1 to 2 sentences before we go to the interactive group discussion. So firstly, you can go with Dr. Frank.
Thanks. I think the first thing to do is maybe to start applying the main principles, and these are to me the system thinking, the transdisciplinarity, the work across sectors and collaboration. The collective learning is another important principle, and really starting being inclusive. So start with the principles.
Thank you. And now Dr. Yawande.
Thanks. I think young people and youths can really play a key role in raising awareness and increasing understanding of the principles of One Health. You are all closer to the community. One of the things that we've noticed is how innovative things social mobilization strategies, things social media. For the longest time, health-related issues were really technical, but every now and then I see TikTok videos, I see Twitter feeds or threads, and very simplistic messaging that can actually drive behavior change. So I think the youth can really drive this change by helping raise awareness and increasing the understanding of the principles of One Health. Thank you.
Thank you. Dr. Nadia?
Yeah, I think in my perspective, youth is a very potential force, yeah. And but again, we think that youth need to be capacitated starting either from formal or informal education, yeah, about the climate change, the sustainable of lifestyle, including the One Health approach. And of course, they have to be equipped too regarding the information, how the implementation, and then how the mitigation, and how the adaptation of all those activities. A partnership between government and the community groups and youth organization is something that need to be created in terms of building the capacity of the youth again to prepare them as the future leaders in terms of climate resilience or even in One Health resilience. And like Yawani mentioned about youth, they have very special in terms of the technology information. And this is, of course, driving a new world in the future and have a very big importance. So if they are involved starting the beginning, their voice could be provided for us, the current, especially like for me from the government side, the important recommendation for designing and implementing of the One Health program.
Thank you, Dr. Nadia. And lastly, Tara?
Just continue to be energetic and resilient, I would say. But also one thing I do want to really mention is continue that two-way communication. As youth, sometimes we think our way is always the right way because we're the new future generation, but we have to be mindful that intergenerational learning is so important to be able to really move things forward. So I think, being humble and continue fighting the fight.
Thank you very much. So if I may sum up, I think we have three main collaborations that we need to consider: intersectoral, multidisciplinary, and also, as Tara mentioned, intergenerational. It's very important to acknowledge that there is need to have this youth and the professionals, the discussion with youth and professionals in order to advance planetary health governance and advocacy. Now, without further ado, I think we can continue to the interactive group discussion. So it will be done in a separate Zoom meeting. our committee will send the link in the chat box. I believe it should be now. Yeah, you can directly go to the Zoom link, and it will be divided into 4 breakout rooms. So each panelist will be in one breakout room. If you have any questions or concerns about planetary health in your community, you can directly ask them there. So I will also be going around in the breakout room. So, and see you there.
Health and care workers. They protect us when we need it most. When our world shuts down, they go to work. They fight for the lives of our loved ones and comfort them when we can't. Day after day, often without proper protective equipment. Despite fear and fatigue, and against overwhelming odds. They never asked to be heroes, but the efforts we applaud are heroic. Health and care workers have died by the thousands protecting us from COVID-19. So applause without action just isn't good enough anymore. Now, it's our turn to protect them. Too many are underpaid and overworked, without the resources to do their jobs safely. Too many face stress, trauma, and burnout without adequate mental health support. Most health and care workers are women, but few are in positions of leadership. All of this needs to change. Now, more than ever, we need to invest in skills, education, and decent jobs, in safe working conditions, and in policies that retain health workers, protect their rights, and support gender equality. This investment can heal our societies and rebuild our economies. But it's an investment that requires all of us, together, across sectors, professions, and politics. The time to act is now. Invest in health systems. But most of all, invest in the people who are the world's health and care workers.
très bien. Mais si vous touchez, vous allez sentir que c'est difficile.
What does health mean to you? For many people, it is the foundation to do the things in life they love, to enjoy the company of others, to work, to play, to learn, to laugh. Health is life. So many people have lost their health in the past year, but they have lost so much more: their jobs, their ability to see their families, to travel, to live life. And more than 2.7 million of our sisters and brothers have lost their lives, and we have lost them. The hard truth is that some of those people died simply because they could not get the care they needed because of where they live or how much they earn. Inequality is not a new problem, but COVID-19 has brought it into sharp focus. The pandemic has pushed an estimated 120 million people into extreme poverty. It has significantly increased gender inequalities, with more women than men leaving the labor force. And as we speak, rich countries are vaccinating their populations while the world's poor watch and wait. Health inequalities are not just unfair, they make the world less safe and less sustainable. So, as they build back from COVID-19, it's vital for all governments to invest in better health services and remove the barriers that prevent so many people from using them, so more people have the chance to live healthy lives. This World Health Day, we're calling on you to use your voice and your vote for a fairer, healthier world.
One year ago, world leaders launched a global solution to rapidly end the pandemic and equip countries to fight this devastating virus. The ACT Accelerator has secured more than 60 million COVID-19 tests, over $500 million worth of equipment to keep health workers safe, and nearly 3 million doses of the proven COVID-19 treatment, dexamethasone. COVAX has delivered more than 40 million vaccines to over 100 countries and economies, and ACT Accelerator-supported research continues to find the next generation of tools. But the pandemic isn't over. Societies and economies are still suffering. Our safety and security is still at risk. And history is still in the making. It's time to recommit to act together. Let's take research, production, and distribution up a gear to keep everyone, everywhere, safe from COVID-19.
Health workers. They're more powerful than you think. They're on the ground, on call, and on hand, behind curtains and inside labs, from the very start to the very end, preventing illness, defeating disease, and saving lives. Every second is spent fighting the unpredictable and defending against the unimaginable, wherever they are, from dawn till dawn. But their power doesn't stop there. They get people back on their feet and back to work. They keep businesses succeeding and economies growing. The health sector is the fastest growing source of jobs and will keep the world moving towards the Sustainable Development Goals. But to unlock their true power, we must act now. As populations grow and change, the world is facing a shortfall of 18 million health workers by 2030. In March 2016, the United Nations Secretary General appointed the High-Level Commission on Health Employment and Economic Growth to create a plan. We need to invest in education and jobs to tackle countries' changing needs. We need political support and bold policies, with cooperation nationally and internationally. And we need to see health workers no longer as a cost, but as an investment in a healthier, fairer, and more prosperous future. It's time to transform the global health workforce by making greater investments to stimulate job creation, addressing gender inequality and maximizing the participation of women in healthcare, expanding and improving education and lifelong training by focusing on skills, pushing health services towards achieving universal health coverage by focusing on people, not diseases, integrating new technologies into the education and practice of health workers, equipping health workers to respond effectively to emergencies and ensuring their safety, raising adequate funding from multiple sources to build the health workforce, cooperating across countries and sectors to ensure the global supply of health workers grows sustainably, guaranteeing that when health workers migrate, it benefits the countries they come from and the ones they go to, and that their rights are protected. And collecting better data, measuring results, and making everybody accountable for action. Together, we can unleash the power of health workers. It's an opportunity we can't afford to miss.
In the darkness, I thought I would never see light again.
My heart stopped. A lifetime of risks that could have been avoided.
In my time, I have seen too much sadness. My mother, my brother, my son, one by one they fell sick, and they were all gone. But I am here. I have survived. I'm here to give people the best care that I can.
Today I get a second chance. Today is the day my life begins.
I will be there for this child and care for her as she grows.
I will do all within my powers to help my little girl make healthy choices.
I will join the fight. I will spread the word, making sure we are prepared and strong. I can see things starting to change. There are still many challenges, but I know I'm making a difference.
I will teach my daughter to treasure life. And I will be there.
Today, I have hope. There will be light again.
I am 1 in a billion.
I am 1 in a billion.
I am 1 in a billion. Imagine a billion more.
Health workers. They're more powerful than you think. They're on the ground, on call, and on hand, behind curtains and inside labs, from the very start to the very end, preventing illness, defeating disease, and saving lives. Every second is spent fighting the unpredictable and defending against the unimaginable, wherever they are, from dawn till dawn. But their power doesn't stop there. They get people back on their feet and back to work. They keep businesses succeeding and economies growing. The health sector is the fastest growing source of jobs and will keep the world moving towards the Sustainable Development Goals. But to unlock their true power, we must act now. As populations grow and change, the world is facing a shortfall of 18 million health workers by 2030. In March 2016, the United Nations Secretary General appointed the High-Level Commission on Health Employment and Economic Growth to create a plan. We need to invest in education and jobs to tackle countries' changing needs. We need political support and bold policies, with cooperation nationally and internationally. And we need to see health workers no longer as a cost, but as an investment in a healthier, fairer, and more prosperous future. It's time to transform the global health workforce by making greater investments to stimulate job creation, addressing gender inequality and maximizing the participation of women in healthcare, expanding and improving education and lifelong training by focusing on skills, pushing health services towards achieving universal health coverage by focusing on people, not diseases, integrating new technologies into the education and practice of health workers, equipping health workers to respond effectively to emergencies and ensuring their safety, raising adequate funding from multiple sources to build the health workforce, cooperating across countries and sectors to ensure the global supply of health workers grows sustainably, guaranteeing that when health workers migrate, it benefits the countries they come from and the ones they go to, and that their rights are protected. And collecting better data, measuring results, and making everybody accountable for action. Together, we can unleash the power of health workers. It's an opportunity we can't afford to miss.
We are at a crossroads. The fight against non-communicable diseases is one of the greatest health challenges we face today, forcing us to make critical choices. Do we take the road to healthier future by protecting people from tobacco and other health-threatening products, improving detection and screening for conditions like cancer, heart disease, and other NCDs, providing healthcare for all, and ensuring people are well enough to work and support their families? Or do we continue down the same uneven path, where too many people needlessly suffer from NCDs, where 15 million men and women aged 30 to 70 die each year from a heart attack, stroke, cancer, diabetes, or asthma. Most in poor, vulnerable countries, and where countries use valuable resources yet miss opportunities for sustainable development. We are here because we all agree we can stay on that path. We must take the same road together to beat avoidable NCDs. Next year, we will meet at the UN General Assembly high-level meeting on NCDs. This meeting will generate momentum towards achieving the Sustainable Development Goal target of reducing premature deaths from NCDs by 1/3 by 2030. But to make progress, political choices must be taken on a dramatically different scale. We must implement life-saving NCD best buys, increase financing for NCD action for critical needs, like affordable insulin for diabetics, increase taxes on tobacco and other harmful products, stand up to industry pressure, promote physical activity through media campaigns, and better design cities. The Montevideo Roadmap identifies the many challenges the world faces to meeting NCD's targets. It offers solutions to overcome these barriers and promote healthy futures for all. It urges greater coherence between health and other public policies, including trade, environment, and education. It places greater emphasis on the role of NGOs, the private sector, philanthropies, and academia. And it shows that action on NCDs is essential for sustainable development in all countries, and their capacity to make bold political choices for health in the face of commercial interests. To accelerate action to save lives and strengthen our societies, and beat NCDs once and for all.
Wherever you live, your health is impacted by the environment. Around the world, more than 50 million people die every year from disease, and nearly 1/4 of those deaths are directly caused by environmental factors. Can you imagine? That's 1,400 deaths every hour of every day from an unhealthy environment. The hardest hit are those in low and middle income countries, especially in Africa, Southeast Asia, and the Western Pacific, and the young and old are most severely affected. More than half the world live in urban areas and can face heavy traffic, air pollution, poor housing, and limited access to clean water and sanitation. Many work in the informal sector under dangerous, dirty, and demeaning conditions. We all face the impact of chemicals and poisons, radiation, and poor farming practices. And climate change means a very uncertain future. So now we are at a crossroads. Things can continue getting worse, or we can work together to improve our world. Simple measures can be taken immediately to protect our health and the environment. We can reduce our consumption and clean our air by using sustainable fuels and walking or cycling more. We can safely store toxic substances in our homes and workplaces. We can protect our water resources by disposing of waste appropriately and introduce clean energy technologies. We can bring multiple government sectors together to ensure all policies actively support health. Let us all work together to improve our health and well-being.
This is Amala. She was born only a few hours ago and has a serious blood infection called septicemia. You would think that antibiotics would work for her infection, but we are finding more and more cases where antibiotics can't kill some bacteria. Antibiotics cure infections, but for years we have taken too many of them, and often for the flu or a common cold for which they do not work. This has made many bacteria resistant, which means that antibiotics will no longer work. Unfortunately, the overuse and misuse of antibiotics are making bacteria grow stronger and resistant to antibiotics, and there are few antibiotics being developed. What can you do? Always seek the advice of a healthcare professional before taking antibiotics. Only take antibiotics when you have a prescription and do not self-medicate. Also, wash your hands and practice good hygiene at home and in hospitals to prevent bacterial infections in the first place. Thankfully, Amala didn't have a resistant bacterial infection, and the antibiotics prescribed by the doctor worked, and she recovered from an infection that could have killed her. We must act together to make sure that our antibiotics remain effective for when you and your children need them. Antibiotics are a precious lifesaver, so let's handle them with care.
The word pandemic comes from, two words, pan, demos. Demos means the people and pan means everyone. Pandemos means, in effect, a pandemic is affecting everybody on the planet. But we can end the pandemic as a tragedy by stopping the deaths, by stopping the hospitalizations, and we have the power to do that. Vaccines give us the power to do that. The problem is, those vaccines are not in the right places and they're not going into the right people. 85% of all the vaccines are going into high-income countries. Half the world's population effectively does not.
So hello again, everyone, especially for those who just came back from the Bridging the Global Gap, Advancing Planetary Health through Governance and Advocacy breakout rooms. Now we will directly go to our next session, which is on our introduction on the GHWN Youth Hub. And I believe this is a very interesting session for everyone, because personally, I got a lot of questions on what is GHWN Youth Hub, how to be part of it, and what do we exactly do. And the session is specifically meant to answer those questions that have been on your mind. And so before we go to that, however, we will firstly introduce our speakers. So we'll firstly start with Paul. So Mr. Paul Daryl O. Meneses is a fourth-year pharmacy student from the Philippines, currently a student advocate and a youth volunteer for various youth and pharmacy organizations within the local, national, and international fields, advocating for youth global health governance. Currently as the outgoing chairperson of outgoing chairperson of external relations from the International Pharmaceutical Students Federation, or IPSF, for the 2021 to 2022 mandate. Paul mainly ensured that the active participation and meaningful representation of the Federation through its external partners, ranging from students and youth organizations to professional federations, including networks and alliances, bringing IPSF's vision and priorities while managing the affairs of IPSF and advancing its goals altogether. Paul will continuously represent more than 500,000 pharmacy and pharmaceutical science students, including recent graduates, as an incoming advisory board member for the 2022 to 2023 mandate. Welcome, Paul.
Hi, Adriana. Can you hear me? Just confirm.
Yes.
Awesome. That's great.
Yeah. I hope you're well.
Yes. Thank you. Thank you so much. I hope everyone's well as well. Everyone's well too. So let me kindly share my screen. Kindly confirm if you can see my screen.
Yes, but firstly we will start with we will introduce Samin and another speaker first, and then we can directly go to the presentation. Thank you very much. So we also have Samin. So Samin is he has been involved with the research working group since 2020, leading the investment case research working group from last year. He has also been working as a research investigator and stakeholder engagement champion for an IHR Risk Barrier Initiative at Child Health Research Foundation at Bangladesh. A dual MPH graduate from the University of Sheffield, UK, and EHESP France with an Erasmus Fellowship. He has been instrumental in developing evidences in rational utilization of resources aimed at strengthening health system and primary care infrastructure. Well versed in quantitative methodologies, he has conducted analysis of large population-based studies during his internship as the METIS, EHESP France. He has served in supporting immunization program implementation and capacity building at the WHO Bangladesh Country Office, a pharmacy graduate with the prestigious Vice Chancellor's Medal from BRAC University. He has been involved in evidence-based advocacy at International Pharmaceutical Students Federation, serving as a policy coordinator from 2015 to 2016, and a member of the inaugural policy committee from the 2013 to 2014. Hi, Samin.
Hi, all.
Okay, and lastly, I will also be speaking on behalf of the organizing committee about the hackathon. Now, without further ado, I think we can go directly to the presentation, firstly from Paul. So, Paul, the floor is yours.
Thank you so much, Adriana. So, let me just kindly share my screen. Just to confirm, can you see my screen?
Yes, we can see it first.
Awesome. Thank you. Thank you so much. So hello, good morning, good afternoon, and also good evening to everyone from where you are currently participating right now for the online conference of the Youth Hub. I'm Mr. Paul Daryl Omeneses, the outgoing chairperson of the IPSF, or the International Pharmaceutical Student Federation, and of course, a current steering committee member of the WHO's Youth Hub. So before anything else, should anyone be unfamiliar with the WHO Youth Hub, or the Youth Hub is actually, it's an intersectoral, interprofessional community of practice. So this is hosted by the Global Health Workforce Network, or what we call internally as the GHWN Youth Hub, which is hosted by the Health Workforce Department of the WHO, or the World Health Organization. So the main focus of the hub is within the youth employment in health and also with the social care as well. And it also aims to engage and include the youth inclusive policy, as well as to strengthen the global capacity to implement the transnational human resources for health, or the HRH agenda. So what is actually the relation between the agenda for the Agenda 2030 to the Sustainable Development Goals, or the United Nations SDGs? So there is actually no universal health care, or UHC, without a well-trained health workforce. Let's keep that in mind, because the health and the social workforce comprise almost half of the investment required to actually achieve the health-related sustainable development goals, or the SDGs, especially with the sustainable development goal number 3, which is actually to ensure healthy lives and also promote the well-being of all ages. So now, what are actually the strategic objectives of the global strategy on the human resources for health of the Workforce 2030? Number 1, it's actually to optimize the existing workforce in pursuit of the SDGs and the UHC. So this, for example, can include education, employment, and also with the retention within the work. So within that, we should actually optimize the performance, the quality, and also the impact of the health workforce itself through evidence-informed policies as well, also on the human resources side for health. Number 2, anticipate the alignment and investment in the future health workforce requirements, and also plan the necessary change. So these can include fit for purpose, needs-based workforce. So this means that we should actually align investments in human resources for health within the current, within like right now, and also within the future needs of these health workforce on the population and the health system itself. Taking into account, for example, the labor market dynamics, the education policies, and also to address the shortage and also improve the distribution of health workforce within the countries and within the local communities. Number 3, actually to strengthen the individual and institutional capacity to manage the human resources for health policy, planning, and implementation. So these can actually within be the areas of migration, For example, there can be health workers that migrates from one country to another or from one profession to another, and also with the regulation that it maintains. So within this objective, we should actually build the capacity of the institution at subnational, national, regional, and also with the global level. So it encompasses all of the levels within the globe as well, and also to promote the effective policy stewardship, the leadership, and also with the governance of action on the human resources for health. And lastly, within the objective of this is to strengthen data, evidence, and knowledge, because I think that would be the most important thing as well. That, for example, we push forward for a more cost-effective policies. This includes within the decisions, like for example, the National Health Workforce Account. So we should be strengthening data on the human resources for health for monitoring and accountability as well. So the next one would be the network's objective. So what would be the network objectives of the Youth Hub that we seek to improve and achieve and also explore? So number one, to inform the high-level political engagement. That's really important, where we try to provide intersectoral and multilateral policy dialogue. So this not only includes within the youth, but also within the ones in the actual position. So for example, the ones in government. So they can actually be in support of the implementation of the WHO global strategy on on the human resources for health at the global, regional, and also with the country levels. Second, to actually provide a forum in relation to the implementation of the WHO global strategy. So, for example, not only within the health sector, but also within the other sector that does not include with health. So there would be multi-sector, multi-stakeholders agenda, sharing the best practices that we have from, for example, from one profession to another. And lastly, to foster the global monitoring and mutual accountability of the international human resources for health, which includes the goals, the strategies, the goals, the targets, and also how we will commit to these goals as well. Then we will effectively link the United Nations system, like for example, the Sustainable Development Goals, and also with the monitoring of the universal health care. So the GHWN Youth Hub, or the structure of the WHO Youth Hub, in the presented slide, everyone would be able to see the structure incorporating the WHO Human Resources for Health Network and also with the spoke model. So on the top, you will see the Strategic Advisory Committee down to the main WHO core team, which receives various informations and initiatives when within the intersectoral hubs, such as from the following. So you would be able to see it would be basing from community-based health workers to data and evidence, education, health labor markets, human health resources for leadership, gender equity, and also within the youth itself. So in this current slide, you will be able to see the Youth Hub Steering Committee, which in behind of the Youth Hub, and also with the amazing online conference that behind this is an amazing team of individuals from different international healthcare organizations within the WHO Youth Hub Steering Committee. So these mainly comprises of international students and also young professionals, healthcare organizations. So for example, there is within the organizations of IPSF, IFMSA, IADS, within the Global Association of Student and Novice Nurses, including chiropractic students, also with the young professionals of the Junior Doctors Network for World Medical Association, and also with FIP, YPG, and also with the with the World Organizations of Family Doctors. So it really comprises of different organizations of different professions, which is actually promoting the intersectoral and sectoral collaboration between these organizations and these professions. So each year mandate, the members change, and where each founding organization of the Youth Hubs provide their representative for the Youth Hub's work. Also, the Youth Hub is also in direct contact and relations with the WHO's Health Workforce Department, who constantly supports the Youth Hub activity, such as within the conference, within the webinar as well, and also most of the initiatives and all of the initiatives of the Youth Hub with Mr. Paul Martsen and also with Dr. Ayat Abu Abla. So now the Youth Hub builds on the momentum of the inaugural Youth Forum on the Human Resources for Health when it was hosted on the Fourth Global Forum. So this was actually in Dublin, Ireland in 2017, where it was mainly organized by the youth who brought together young, amazing young leaders from all over the world. So with that amazing presence and feat in mind, so in Dublin, a new call for action was made to initiate the Youth Hub within this as a commitment of the youth to achieve the agenda for better health outcomes in support of universal health coverage. After that forum, then the steering committee was built on and was made to to develop a 2 years work plan. So here on the current slide, you will be able to see a general overview of the youth hub structure. So where we sit as an independent hub for within the youth, within the WHO 7 thematic hubs that was explained earlier, and there its work and initiatives are coordinated by the steering committee. So throughout the 3 pillars of, for example, within the research for working group number 1, capacity building for working group number 2, and also aligning the advocacy efforts for working group number 3. So the Youth Hub within these working groups actually will drive the human resources for health agenda on the national, regional, and global level. So it's also good to note that for interested individuals that the Youth Hub also has open membership on a timely basis as well. So we will be sharing the link to our dear participants, and also within the open membership link that will be navigated to the WHO's website for the Youth Hub. So like any other WHWN Youth Hub thematic hubs, the Youth Hub is actually established by the WHO on a temporary basis as an advisory technical working group reporting to the WHO. So the WHO within the steering committee will be responsible for setting the priorities, the deliverables of the Youth Hub. For example, this can be projects, this can be webinars, and also in conjunction with the WHO as well. So within this, it will serve as an interprofessional forum to actually promote the youth engagement in relevant policy dialogues across the sectors nationally, regionally, and globally. So the hub will be working directly towards these deliverables using the working groups that I mentioned earlier, and that will lead to the members and to the members reporting to the steering committee to the WHO. So what within the Youth Hub, what we did in 2021 and 2022. So in the 5th of May 2021, during the surge of the COVID-19 pandemic, there was a joint webinar held by the WHO Workforce Development Department and also with the WHWN Youth Hub, introducing the Year of the Health and Care Workers. Also, lastly, last year as well, the Youth Hub also organized so far the biggest online conference, where we first started with more than 1,100 participants and also several expert speakers during the 2-day online conference. So the 2021 online conference had a central theme on building a resilient and adaptable youth health workforce. And some of our speakers as well might be listening to our webinar today. And definitely a lot of you has also participated in the conference last year. So this year's virtual conference is within the Youth Hub's main conference event for 2022, where we aim to explore the role of the youth health workforce on finding solutions to key planetary health issues. So within this online conference, it also to engage interprofessional and intersectoral cooperation to discuss and create solutions for problem identified for the youth. So here on this slide, you will be able to see a brief timeline of what we did for our call to action. So this was a year, it was a year-round works from May 2021 up to May 2022. So the online conference again had targeted sessions on various topics. And during this various session of the online conference last year, our team actually captured inputs where it was really a lot of inputs, really valuable inputs, and also questions, comments from our attendees that attended the online conference. So based on those inputs, the initial draft for the call to action was created that we echo the voice of 1,000 plus youth who attended the conference. And you can see it. You can see that it took a year to finalize these documents with multiple rounds of open and also closed consultation as well. And also, we did also a Youth Day webinar as well. And then also the finalized document was endorsed by international partner organization at which released and shared to the world. So here you would be able to see the call for action of the WHWN Youth Hub, where it was co-signed by international student and young professional organizations, such as again by IPSF and all IFMSA, IADS, and also with the organization as well, and also professional organizations by WMA, and also with Governing Health Futures 2030, and also supported and provided by the FIP and ICN. So you can actually scan the QR code or the quick response code to access the call for action. We do kindly ask you to share it and use it for good purposes. Now, how can the youth individual and a webinar attendee yourself use the call for action by the Youth Hub? So number one, to create meaningful youth engagement with other intersectoral youth organizations and individuals. You can also lobby for potential discussion with policy makers within your countries or within your region, and also use the CFA as a basis for youth-led entrepreneurial activities and collaboration with other external partners. So there's also that we can also promote advocacy for evidence-based health workforce education and training, advocacy for health student and workers right across the different institutes, such as within your university or colleges. And also finally, you can also use the call for action as a tool for your community. You can be able to customize it. You can be able to contextualize it, anything for the benefit of your community. So what can you expect from us, the steering committee members, in the next upcoming months and year for the 2023? So within this, we will be launching the Youth Hub Advocacy Toolkit. So we have been working extensively, and it will be able to help youth individuals and organizations, including those young professionals as well, to advocate for youth inclusiveness in the health workforce. Also, with the preparation of the 5th Global Forum on Human Resources for Health. So with the pandemic calming down, we will be continuing an awaited forum for everyone after the last Global Forum in 2017. Now that we will be resuming soon. And also with the development of the Youth Hub strategic plan for 2013. So a strategic plan for the 2013 will also be drafted and developed for continuing and extending the projects and initiatives that we plan to cover, and many more working groups, hopefully for the Youth Hub. So the advocacy working group. So within this, one deeper context of the Youth Hub. So our main focus within the WHO's concept of advocacy, it means the combination of individuals and also social action designed to gain political commitment, policy support, social acceptance, and system support for a particular health goal or program. So our main goal within the advocacy working group is to be an international interprofessional team driving the human resources for health agenda for youth response policy and practice. So the background. So again, there is no universal healthcare without a well-trained health workforce. So within this, the future workforce will deliver the UHC and achieve the UN SDGs within a young workforce that will be within this, and youth employment hopefully will be eradicated as a global challenge, and we will be growing with provided education, training, and employment of health and social workers as future workers of the world. Yeah, also with in 2020, the advocacy team also co-created the Youth and Decent Work in Health and Social Sector and Evidence Synthesis. So this paper explored the evidence-based context and reality of the decent work of youth in the health and social care sector. So thank you very much. I would now like to pass the floor to Adriana for Shirley to continue on the advocacy toolkit of the advocacy working group. Thank you. Adriana or Shirley? Thank you.
Thank you very much, Paul. So Shirley will be continuing the presentation, but firstly, I will introduce Shirley a bit first. So Shirley is also one of the members of the GHWN Youth Hub. So she is a part of the steering committee and is currently working in the International Pharmaceutical Federation as data and intelligence specialist. So Shirley, the floor is yours.
Thank you very much, Adriana, and thank you so much, Paul, for setting the introduction. I'm actually not part of the speaker today, but I'm kind of like emergent speaker because actually the lead of the advocacy working group, he couldn't join because, you know, a healthcare worker, he needs to face patient and he needs to serve the community. So we need to somehow be flexible. So that is why I'm currently presenting on behalf of the advocacy working group, particularly the one who developed the advocacy toolkit. So in this presentation today, what I will discuss is these 4 points. Basically, why is it needed, which is actually somehow Paul already mentioned a little bit earlier, and what is the purpose, how it looks like, and what would be the next step for the advocacy working group. So if we can go to the next slide, Paul, thank you so much. So why is this toolkit actually, I apologize again for the, I thought that it's actually, I apologize for the misspell. It is supposed to be toolkit, not toolking. So apologize for that. So yeah, what is the reason actually we developed this toolkit earlier? So it's basically, we know that talking about youth, how we can involve youth more, the importance of meaningful of youth engagement, the importance of health and care worker, which is Paul already said earlier as well. That is why we know that we need to develop something for the youth to help them to advocate for their role. So that is why we developed this toolkit, because we are the future. And we actually, if some of you already attended the previous session, which is very, very interesting as well, where they mention about the importance of the youth, the importance of having youth as part of the policy decision making in any section, not only about the planetary health, but also with the other section as well. So that is why we initially developed this toolkit 3 years ago. So if we can go to the next slide, Paul, I will make this a little bit quicker. So what is actually the purpose of this toolkit? So we hope with this toolkit, this will help anyone, particularly youth, to build their capacity and to build their advocacy skills, because we have a lot of examples in this toolkit. We would like also to empower youth, and this is something that we also mentioned in the earlier session about youth empowerment and how it is important. And we hope with this toolkit, this also can help youth to be more empowered and to advocate better in their role in the policy decision making agenda. And another purpose is basically to advocate for global workforce transformation. And we also talk about this in the earlier section about transformation. So everything that we think about that 3 years ago is actually still happening until this time. So that is why this toolkit actually was developed 3 years ago. So if we can go to the next slide. This is how it looks like in general. So I will only share a little bit a snapshot about that, because when it is launched, you will be able to read it and you will be able to hopefully implement that as well. So basically in this toolkit, we will describe the steps of the advocacy process. There are 8 steps that we will describe, which you can see in the circle here. And we also provided examples. And let me perhaps give you some example about the step itself. So the first thing of the step is basically to define the process. To define the problem. So what we mean by defining the problem is basically we need to make sure that our advocacy effort is has a specific objective. So that's actually what we mean by define the problem in here. What exactly we would like to change? What is the aim of the advocacy that we would like to do? In this case, in the toolkit, we also highlight how to identify the problem by using a problem tree example, and that's something that you all can explore when the toolkit is launched. After we define the problem, the next step will be we need to identify the stakeholder. Identifying the stakeholder is important. And if, for example, listening to the previous section, which is Tara mentioned about leadership buy-in is very important. And this is where we really need to identify the stakeholder of our advocacy process. And we need to also think about who are the stakeholder which have like the high interest and which have the someone that we need to engage. So in the toolkit, we also provide example about the stakeholder analysis, and that can help in analyzing how we define the stakeholder, how we identify them, and how we can engage with them. And the third steps will be to identify the available resources that we have. This will help us to be more effective and efficient when we do the advocacy. And the next step is to formulate the argument and the message. And this is basically what exactly the message that we want to convey. It needs to be clear, it needs to be concise, and it needs to be compelling as well, and also consistent. And in the toolkit, we will provide example on how to develop that message. So this will be very helpful for all who read the toolkit. After we identify, we formulate the argument and the message, then we need to deliver that. And how we deliver that? In the toolkit, we actually identify some example on the situation where we should deliver the message. So this hopefully also can be useful. And then we need to also consider the windows of opportunity. So we need to consider the situation on when we will say, when we will do the advocacy as well. And the next step is to build partnership along the way, and this is also important. And in this toolkit, we actually provide some challenges on how to build partnership and how we can overcome the situation if there is something that we don't want to happen. So in the toolkit, we provide many examples about that. And last but not least, every activity that we will do, we need to do a monitoring and evaluation progress. And in the toolkit, we provide some example of the tools. So if we can go to the next, which is basically my last slide, which is what would be the next step of this working group. So it is basically, we are hoping that we can launch the toolkit as soon as possible, so it can be useful for all of you here. When it is launched, we will let you know. And hopefully you can look at it, implement, and it will help you all to improve your advocacy skills. And we always welcome any improvement, any feedback. So feel free to let us know if there is anything that we can improve for the toolkit. And also the last thing is about the future project that we are planning to do. It's about the collaboration, and that's something that we will do, and we will inform you all when it is ready. Thank you very much, Adriana, and I will give the floor back to you. No, thank you.
Thank you very much, Shirley, for the very comprehensive presentation. Next up, we have Samin. Samin, the floor is yours.
Thank you, Adriana. Very warm welcome to the session. Can we move to the next slide? We will use this outline to guide the utilization and the need of research in evidence generation, advocating for the youth inclusiveness and the health workforce agenda in addressing sustainable development and the planetary health needs. Next slide, please. As we already understood that the world is currently undergoing a demographic transition, resulting in longer life expectancy. This is mainly due to the results of concerted efforts of improving disease surveillance, access to diagnostic capacity and healthcare, and as well as the successful implementation of effective mass preventive and prophylactic strategies. However, there is much needed to be done, especially in the context of developing healthcare settings. And these changing demographics also offer a very dynamic healthcare service delivery environment for meeting these multidimensional population health needs. However, on the contrary, as we understand this unplanned urbanization and rapid industrialization going on for decades, engendering the excessive damage to the ecosocial environment. This source of damage actually fuels the drastic health consequences offered by the rapid change in climate and environment in recent times. From the climate and health, we understand that has been rise of many vector-borne infectious disease and reduced quality of life in the recent decades. In the landscape where there was no such events in the previous decade. And in regards to that, what we understand, the decreased quality of life and the rise of non-communicable disease actually results in high utilization of healthcare services, where optimization and screening has been the most important part of any NCD response. However, this climate change can also result in terms of rise of extreme health events, and this extreme health event results in reduced in terms of higher utilization of healthcare services, and that is actually engendering more wastage on healthcare infrastructure. Therefore, what we understand that the disease response model that has been harbored by the public health infrastructure for decades alone will be difficult to manage the dynamics offered by climate change and health. This will often result in ineffective response even after utilizing considerable health resources. Therefore, the global community will require a concerted effort for facing this planetary health need through combining both the disease-based response approach and the integrated health service delivery model. This is expected to contribute to construct a resilient healthcare system which facilitates availability, accessibility of a skilled healthcare workforce. Next slide, please. We understand that the need of adequately trained healthcare workforce is a must for addressing this health need for the ailing planet and drastic consequences offered by climate change. However, the world is currently suffering from an 18 million shortage of healthcare workers, even with the current accelerated efforts driven by the target 3.8 on universal health coverage, as well as 3.C on the supporting healthcare workforce in developing countries. The shortage of the healthcare workforce will remain at large of another 18.1 million workers. During the ongoing demographic and epidemiological transition, there is a natural opportunity for more youth inclusion in the coming decade. However, this is hardly not enough in meeting this shortage of healthcare workers. Therefore, efforts will be required in advocating youth inclusiveness, addressing system gaps and the policy barriers in health workforce agenda, responding to the health needs in this dynamic world. Next slide, please. We understand that health workforce actually in their earlier career stages faces the most challenges than any other stages of their career. They are mostly clouded with the decision of settling into their careers and the stability and the career choices. The challenges actually initiate from the policymaker side because there is instance of inadequate planning, patronization and development of healthcare workers, which often gets non-prioritized when there is other projects coming up with limited budgets, especially in the context of developing countries. And this sorts of lack of such investment not only create a very inequitable distribution of healthcare workforce, it also adapts to the healthcare settings with an inappropriate skill mix and competencies. Furthermore, what we understand that this skill mix imbalance actually results in performing multiple responsibilities with inhuman working conditions for the delivery of healthcare services and actually acts barrier to interprofessional collaboration. Therefore, this lack of investment often results in the attrition and migration of healthcare workers, as we have seen from the OECD documents, over 20% of foreign-born doctors and as well as 7% of the healthcare workers leaving their posts and from the healthcare workforce as well. Next slide, please. So therefore, we require advocacy and also the required generation of evidences to understand these source of workforce gaps, the policy system barriers, and the healthcare needs of the coming decade. So what we need is actual knowledge brokerage to sustain the generation of relevant evidences for policy development and such investment decision persuasion. In this regard, this kind of rationale actually formed a very pivotal role in the foundation of the research working group in 2020, serving as a convening space for evidence generation aimed at initiating policy dialogue for rights and advocacy. The research working group is actually a multidisciplinary team with varied expertise in different disciplines of the health and social care sector, as well as other relevant sectors such as health economics and universal health coverages. What we understand that this evidence generation from the research working group is focused on the developing of various strategic planning for creating a sustained collaboration and partnership across stakeholder ecosystem. This should be achieved through a deeper understanding on the insight and the context on the barriers of health workforce in the healthcare system. Next slide, please. As of present, the research working group is actually working in multiple areas of youth inclusiveness related issues in the health and social care sector. Primarily, the working areas are focused on two major sectors, which is the investment case development, and that is focused on the strategic areas of global investment of youth inclusiveness in the human resource for health, agenda, and the other is focused on the impact of education and licensing of early career professionals involved in the healthcare sector. The investment case working group is actually focused its work understanding of the gaps and barriers faced by the students and early career professionals of the health workforce ecosystem from a financial and socio-economic contextual point of view. We are also exploring the availability of data and information aimed at developing an investment case agenda and scopes for capacity building for addressing through rational utilization of limited available resources. On the other hand, the education working group is focused on the policy analysis and impacts on education delivery and subsequent registration for early career professionals. Next slide, please. How we fulfill this kind of objective? What sorts of information we actually analyze? The working group actually fulfills this sorts of insights from analyzing peer-reviewed journals and government reports and policy brief from the international organizations like World Health Organization, World Bank, OECDs, and other NGOs. We also utilize other sources like updates from relevant websites, press releases, and newspapers to actually understand the changes in the gaps and system barriers in the student and early career professionals in this kind of dynamic health environment. Next slide, please. So what sorts of activity we actually do? This journey of evidence generation is actually spreads across the entirety of research continuum. So we regularly conduct background literature reviews on various issues, which is pertinent to the student and early career professionals. We have already conducted a series of country-based case analysis on the societal context and financial landscape of student and early career professionals. We also do routine analysis, secondary data, and critical review on the available evidence across these countries. We also involve understanding the impact of this kind of contextual and societal challenge in regards to social inequities in economic conditions like tuition, available income, and interprofessional differences in the healthcare working ecosystem and the working condition, and how it exacerbated during the COVID-19 pandemic following the disruption of routine activities. Additionally, we are also conducting scoping review on landscape mapping on the barrier and challenges faced by the youth involvement in the healthcare workforce. This includes aspects on educational opportunities, licensing examinations, differences in terms of financial barriers, and its impact actually on skill mix balances on career choices and attrition across the continuum of socioeconomic development. So what we do after analyzing this source of data, we utilize these evidences in terms of developing strategical recommendations for the avenues of advocacy on right and youth inclusiveness in the agenda. Furthermore, we use this source of strategical recommendation for developing investment case and addressing the SDGs on health workforce, and as well as we also do impact mapping on the appropriate skill mix and capacity building opportunities. And then we employ this kind of identified key insight for the knowledge brokerage during policy discussion and wider dissemination among stakeholders, partners, and policymakers in the global health workforce infrastructure. Next slide. So from our existing and the completed work, many of the recommendations that we have came across is actually the paucity and the availability of data on the various contextual landscape of the youth professionals in the health and social care sector. Include the overlay on the differences of financial aspects, educational infrastructure at the national level. Furthermore, we also recommend and highly recommend for various investment decision making on health and care, social care workforce on the various topics, which is like the financial incentivization on health education, offering of decent pay according to the work, understanding their workload, and also initiative to addressing them in a very equitable manner, and also formulating opportunities for career growth and development at the early stages where it is highly needed. Additionally, we also feel the need of availability of a skilled and fit for purpose healthcare workforce, and their integration must happen through the formulation of multidisciplinary team and the integration of the care workers in delivery of healthcare services in responsive to the population health needs. We also identified the formulation of future evidences in order to understand the qualitative insight for the socioeconomic inequities exist in the healthcare sector during the formulation of opportunities and in the health workforce agenda. Next slide, please. So the future direction is, as we already discussed about the launch of an advocacy toolkit is coming up So what we want to highlight is understand and align this interest of the key finding that we obtained from the of our research activities in regards to design the advocacy strategies. And also we are trying to build the evidence generation from the ongoing activities to the evidence base of the youth inclusively health workforce agenda, and developing just scoping strategies for addressing these barriers with regards to development of qualitative insight and the strategical development for fit for purpose youth inclusion, addressing the financial and socio-equity barriers. And we will utilize this the strategies we have already developed and the advocacy strategies in regards to the findings we have already understood in the fifth global HRH forum that is coming up next year. Next slide, please. So what we understand, the challenges are actually diverse in terms of understanding the effectiveness of any sort of investment that is given in the health and care worker development. However, this also multiple factors like handling monitoring responsibilities, and on the other hand, like inadequate investment in staff are actually leading to loss in productivity and increasing potential of burnout that actually needs serious consideration at the policy level. So therefore, there is high time for integration of the equity aspects as well as the formulation of multidisciplinary workforce throughout the globe in response to the population need. It is essential for the student and workforce in the new normal and addressing planetary health needs. Next slide. Thank you all.
Thank you, Samir, for the presentation. So lastly, before we go to the Q&A, although I think some of the questions have already been answered by being typed, but I think it would be better if we can also address it live. So before we go to the Q&A session, though, I will present a bit about the hackathon, which is a part of our conference this year. So our hackathon is named YHack22, as in youth hack. And as like our conference theme, we focus on youth and planetary health, sustainable collaboration for the future. Next slide, please. So this is actually not the first time our youth hub held a hackathon. We have previously held a hackathon back in 2019, but yeah, and so we're continuing this hackathon this year with the theme on planetary health. The aim of our hackathon is to foster interprofessional and multisectoral collaboration. I think this was particularly highlighted in the last session about the importance of collaboration, not only between professions, but also multisectorals and also between countries, because and this is a part of our hackathon because we also foster global collaboration with participants from 27 countries. With these collaborations, we hope that we can help youth innovate youth-led solutions in planetary health. Our idea is that the solution would be for youth, from youth, and hopefully it will lead to the improvement of planetary health globally. Slide, please. And we have 3 streams. So actually the hackathon is already ongoing. And the themes have already been formed, but this is like some sort of general ideas on how is our hackathon at the moment. So we have 3 streams. One is on climate change resilience in health systems. And the stream 2 is on bridging the gap of planetary health integration into global health systems, which is one of the main themes of the previous session. And also a thread 3 is on improving planetary health education for healthcare workers. So all these streams will be explored and introduced during the whole session and the conference. So if you are a part of the hackathon, please stay tuned and watch our conference because you will learn more directly from the experts, and hopefully it can help you innovate, brainstorm about what solutions can you bring to the table to improve planetary health and, for example, climate change resilience, education, and also integration to health systems. Next slide, please. And these are our timelines. So as mentioned, the team formation is already done. Next up will be team ideation. Next slide, please. Okay, so the team ideation will start from tomorrow, hopefully after the conference is over. So it will be tomorrow in the afternoon of Greenwich Mean Time. So team ideation will happen for 2 days. So for hackathon participants, you can start seeing and be more mindful of the problems you see within your surroundings and what you can do to improve the situation. And we will also provide you with experts and mentors from different sectors: technology, healthcare, and business, and also youth. So interestingly, some of our mentors are youth who are also experts in business and digital health. So we hope that you can relate to the mentors and you can learn more from them, be a team that have robust solution and collaborate with people from all over the globe. And after you meet the mentor, there will be rigorous mentorship for 2 days. After that, there will be planning where you can design, test, and iterate your solution. So for example, you can do market research at this point. And lastly, you will do pitching. So the pitching will be in the form of submission. We will give the link in the platform that we're using for the hackathon, that is Slack. The deadline would be 17th September at 11:59 p.m. GMT. Slide, please. And here are the judging criteria. I don't think I need to really go to the detail for this, but because it's in the concept note, just bear in mind that we are also considering the contribution of the solutions to UHC, SDGs, and the global strategy on HRH from the WHO. Slide, please. And here are the judges and mentors. So as I mentioned, they're experts in their fields: tech, business, and healthcare. And if you are a part of our hackathon, if you're our participants, you can directly learn from them. So use this opportunity to embark on your innovation journey. And in addition to this, we will also give you the tools of innovation through our sessions in the upcoming days. So there will be a session on entrepreneurship and system thinking, which will be very helpful as well for the hackathon. We also will have digital health sessions right after this, and there will be education and research session tomorrow. Slide, please. And yeah, so that's all about the hackathon. But just before I end this and go directly to the Q&A session, I would like to mention that if you would like to get more information on GHWN Youth Hub, you can go to our social media. On Instagram, it's at GHWN Youth Hub, and on Facebook, it's GHWN Youth Hub, but with spaces. You can get information from those social media. Like if you want to stay updated with our information, you can follow us, and yeah, perhaps also turn on the notifications, because we will be sharing our opportunities through our social media platforms. Slide, please. And lastly, in our social media, we're also trying to engage with youth directly. So if you can see here, this is a project of our conference. We are interviewing youth. So here we are interviewing a young veterinarian from Nigeria named Dr. Bolande Akanke. So this is a very interesting interview, and who knows, maybe the next interviewee will be you. So follow us and collaborate with us, and we can wait to have you at our team. So I think that is all for the presentation. I now, you can contact us here. You can scan this QR code, but now I would like to go to the Q&A a bit just before we close the session at exactly 11 for a break for 30 minutes. So perhaps for Samin, Paul, and Shirley, can you also open your camera? Okay, so thank you very much. I think we have some questions already, although it's already been answered, some of it, but I think some important questions would be, are there specific qualifications to join the Youth Hub? For example, is there any age limit? So perhaps Paul or Shirley can answer this question. Perhaps Shirley can answer then.
I'm happy to answer that. Thanks, Adriana. There is no requirement. What you need to do is just go to the form and then enter your detail. I will perhaps, actually in the handbook of online conference, we do have a barcode. So feel free to scan that barcode and then fill out the detail. For the age category, it's quite difficult to say youth actually, but we usually have like below 35. If you are below 35 years, you can enter, you can submit your submit in the form, and then you can join the youth hub. So that's for the general youth hub. But for the working group, we have certain criteria and qualification depends on the working group. And I hope that answer your questions.
Thank you, Shirley. So we have a question which I think is related to your answer about the specifications needed to join a certain working group. So this is a question from Ahmed. So firstly, I think this one is already answered. Can one join membership if he or she is not a member for any medical association or group? I think the answer is yes, right? It's okay.
Yeah, it's fine. But it is absolutely fine. Yeah.
But the next question would be, can people with full public health and less clinical experience join the membership? And I would like to also extend the question on, for example, if you would like to join the advocacy or the research working group, but we don't have much experience in it, would it be fine? Perhaps we can start with Samin first.
I think like this is a journey to actually learn about various research activities, as well as there is much experience of good academic writing, or say for example much interest in analyzing or like critically reviewing the existing literature. I think there is a good opportunity for inclusion research working group, because like for everyone there is a skill we always try to include, and this is one of the opportunities we always try to involve membership as. But definitely in terms of the call that is being handed out for the research working group, there are some certain skills we are definitely trying to get a hang on.
Thank you. Yeah, I think this would be a very great learning opportunity. So Shirley, would you like to add to that?
I think actually Samin already mentioned some of them. So it really depends on the working group. If, for example, it is the advocacy working group and the deliverables is to develop a toolkit, meaning that we need someone who has experience already. But yeah, this will I don't want to discourage anyone who would like to join. Please just do if there is any call for that for any specific working group, we do see the diversity. So it doesn't need to be as I would say we perhaps prefer someone who has experience, but still we always encourage any diversity across the team members. So anyone can join for the youth hub, and anyone can also apply for any working group that we have. So yeah, I hope that answer question, Adriana.
Yes,
Thank you.
Very clear. Thank you, Samin and Shirley, and of course also to Paul. I think because it's already 11 GMT, it's time for break time to everyone. So thank you once again for this very comprehensive explanation on Youth Hub. And I think there are already a lot of people who are interested in joining the hub. So yeah, I'm very excited on the way forward for the Youth Hub. I believe with more members, it will be even more fruitful with more impactful projects. So once again, thank you for your work, and thank you for answering all our questions. See you.
Thank you, Adriana, for wonderful moderation. Thank you, everyone. Thank you, Samin and Paul.
Thank you, Adriana, and everyone.
And thank you, Mohammed, for the tech support. Thank you, everyone. Have a good break.
Yes, of course. Thank you very much also to Mohammed for the tech support. Okay, so now we can go directly to the break. It will be for 30 minutes. So we will be back for another session. It is a very interesting session, so please be sure to join us then. It will be about youth role and climate change and how we can help within our capacity as youth. So stay tuned and see you soon.
Health and care workers. They protect us when we need it most. When our world shuts down, they go to work. They fight for the lives of our loved ones and comfort them when we can't. Day after day, often without proper protective equipment. Despite fear and fatigue, and against overwhelming odds. They never asked to be heroes, but the efforts we applaud are heroic. Health and care workers have died by the thousands protecting us from COVID-19, so applause without action just isn't good enough anymore. Now, it's our turn to protect them. Too many are underpaid and overworked, without the resources to do their jobs safely. Too many face stress, trauma, and burnout without adequate mental health support. Most health and care workers are women, but few are in positions of leadership. All of this needs to change. Now, more than ever, we need to invest in skills, education, and decent jobs, in safe working conditions, and in policies that retain health workers, protect their rights, and support gender equality. This investment can heal our societies and rebuild our economies. But it's an investment that requires all of us, together, across sectors, professions, and politics. The time to act is now. Invest in health systems. But most of all, invest in the people who are the world's health and care workers.
What does health mean to you? For many people, it is the foundation to do the things in life they love, to enjoy the company of others, to work, to play, to learn, to laugh. Health is life. So many people have lost their health in the past year, but they have lost so much more: their jobs, their ability to see their families, to travel, to live life. And more than 2.7 million of our sisters and brothers have lost their lives, and we have lost them. The hard truth is that some of those people died simply because they could not get the care they needed because of where they live or how much they earn. Inequality is not a new problem, but COVID-19 has brought it into sharp focus. The pandemic has pushed an estimated 120 million people into extreme poverty. It has significantly increased gender inequalities, with more women than men leaving the labor force. And as we speak, rich countries are vaccinating their populations while the world's poor watch and wait. Health inequalities are not just unfair, they make the world less safe and less sustainable. So, as they build back from COVID-19, it's vital for all governments to invest in better health services and remove the barriers that prevent so many people from using them, so more people have the chance to live healthy lives. This World Health Day, we're calling on you to use your voice and your vote for a fairer, healthier world.
One year ago,
Health and care workers. They protect us when we need it most. When our world shuts down, they go to work. They fight for the lives of our loved ones and comfort them when we can't. Day after day, often without proper protective equipment. Despite fear and fatigue, and against overwhelming odds. They never asked to be heroes, but the efforts we applaud are heroic. Health and care workers have died by the thousands protecting us from COVID-19, so applause without action just isn't good enough anymore. Now, it's our turn to protect them. Too many are underpaid and overworked, without the resources to do their jobs safely. Too many face stress, trauma, and burnout without adequate mental health support. Most health and care workers are women, but few are in positions of leadership. All of this needs to change. Now, more than ever, we need to invest in skills, education, and decent jobs, in safe working conditions, and in policies that retain health workers, protect their rights, and support gender equality. This investment can heal our societies and rebuild our economies. But it's an investment that requires all of us, together, across sectors, professions, and politics. The time to act is now. Invest in health systems. But most of all, invest in the people who are the world's health and care workers.
vois pas très bien. Mais si vous touchez, vous allez sentir que c'est difficile.
What does health mean to you? For many people, it is the foundation to do the things in life they love, to enjoy the company of others, to work, to play, to learn, to laugh. Health is life. So many people have lost their health in the past year, but they have lost so much more: their jobs, their ability to see their families, to travel, to live life. And more than 2.7 million of our sisters and brothers have lost their lives, and we have lost them. The hard truth is that some of those people died simply because they could not get the care they needed because of where they live or how much they earn. Inequality is not a new problem, but COVID-19 has brought it into sharp focus. The pandemic has pushed an estimated 120 million people into extreme poverty. It has significantly increased gender inequalities, with more women than men leaving the labor force. And as we speak, rich countries are vaccinating their populations while the world's poor watch and wait. Health inequalities are not just unfair, they make the world less safe and less sustainable. So, as they build back from COVID-19, it's vital for all governments to invest in better health services and remove the barriers that prevent so many people from using them, so more people have the chance to live healthy lives. This World Health Day, we're calling on you to use your voice and your vote for a fairer, healthier world.
One year ago, world leaders launched a global solution to rapidly end the pandemic and equip countries to fight this devastating virus. The ACT Accelerator has secured more than 60 million COVID-19 tests, over $500 million worth of equipment to keep health workers safe, and nearly 3 million doses of the proven COVID-19 treatment, dexamethasone. COVAX has delivered more than 40 million vaccines to over 100 countries and economies, and ACT Accelerator-supported research continues to find the next generation of tools. But the pandemic isn't over. Societies and economies are still suffering. Our safety and security is still at risk. And history is still in the making. It's time to recommit to act together. Let's take research, production, and distribution up a gear to keep everyone, everywhere, safe from COVID-19.
Health workers. They're more powerful than you think. They're on the ground, on call and on hand, behind curtains and inside labs, from the very start to the very end, preventing illness, defeating disease, and saving lives. Every second is spent fighting the unpredictable and defending against the unimaginable, wherever they are, from dawn till dawn. But their power doesn't stop there. They get people back on their feet and back to work. They keep businesses succeeding and economies growing. The health sector is the fastest growing source of jobs and will keep the world moving towards the Sustainable Development Goals. But to unlock their true power, we must act now. As populations grow and change, the world is facing a shortfall of 18 million health workers by 2030. In March 2016, the United Nations Secretary General appointed the High-Level Commission on Health Employment and Economic Growth to create a plan. We need to invest in education and jobs to tackle countries' changing needs. We need political support and bold policies, with cooperation nationally and internationally. And we need to see health workers no longer as a cost, but as an investment in a healthier, fairer, and more prosperous future. It's time to transform the global health workforce by making greater investments to stimulate job creation, addressing gender inequality and maximizing the participation of women in healthcare, expanding and improving education and lifelong training by focusing on skills, pushing health services towards achieving universal health coverage by focusing on people, not diseases, integrating new technologies into the education and practice of health workers, equipping health workers to respond effectively to emergencies and ensuring their safety, raising adequate funding from multiple sources to build the health workforce, cooperating across countries and sectors to ensure the global supply of health workers grows sustainably, guaranteeing that when health workers migrate, it benefits the countries they come from and the ones they go to, and that their rights are protected. And collecting better data, measuring results, and making everybody accountable for action. Together, we can unleash the power of health workers. It's an opportunity we can't afford to miss.
In the darkness, I thought I would never see light again.
My heart stopped. A lifetime of risks that could have been avoided.
In my time, I have seen too much sadness. My mother, my brother, my son, one by one they fell sick, and they were all gone. But I am here. I have survived. I'm here to give people the best care that I can.
Today I get a second chance. Today is the day my life begins.
I will be there for this child and care for her as she grows.
I will do all within my powers to help my little girl make healthy choices.
I will join the fight. I will spread the word, making sure we are prepared and strong. I can see things starting to change. There are still many challenges, but I know I'm making a difference.
I will teach my daughter to treasure life, and I will be there.
Today, I have hope. There will be light again.
I am 1 in a billion.
I am 1 in a billion.
I am 1 in a billion. Imagine a billion more.
Health workers. They're more powerful than you think. They're on the ground, on call, and on hand, behind curtains and inside labs, from the very start to the very end, preventing illness, defeating disease, and saving lives. Every second is spent fighting the unpredictable and defending against the unimaginable, wherever they are, from dawn till dawn. But their power doesn't stop there. They get people back on their feet and back to work. They keep businesses succeeding and economies growing. The health sector is the fastest growing source of jobs and will keep the world moving towards the Sustainable Development Goals. But to unlock their true power, we must act now. As populations grow and change, the world is facing a shortfall of 18 million health workers by 2030. In March 2016, the United Nations Secretary General appointed the High-Level Commission on Health Employment and Economic Growth to create a plan. We need to invest in education and jobs to tackle countries' changing needs. We need political support and bold policies, with cooperation nationally and internationally. And we need to see health workers no longer as a cost, but as an investment in a healthier, fairer, and more prosperous future. It's time to transform the global health workforce by making greater investments to stimulate job creation, addressing gender inequality and maximizing the participation of women in healthcare, expanding and improving education and lifelong training by focusing on skills, pushing health services towards achieving universal health coverage by focusing on people, not diseases, integrating new technologies into the education and practice of health workers, equipping health workers to respond effectively to emergencies and ensuring their safety, raising adequate funding from multiple sources to build the health workforce, cooperating across countries and sectors to ensure the global supply of health workers grows sustainably, guaranteeing that when health workers migrate, it benefits the countries they come from and the ones they go to, and that their rights are protected. And collecting better data, measuring results, and making everybody accountable for action. Together, we can unleash the power of health workers. It's an opportunity we can't afford to miss.
Hi, everyone.
Hi everyone, welcome back. I hope you had a great lunch break. So my name is Rama Tapulabi, and I'm one of the member of the conference organizing team, and I'll be moderating this session. As we may all know, climate change is one of the most pressing global issues of our time, and if left unchecked, it will pose an unprecedented threat to human civilization and the ecosystem of this planet. So in this session, we'll be learning more about climate change and its impacts. And most importantly, we'll be learning the steps we are going to take as youths in combating this challenge. This session consists of 40 minutes of speaker's presentation and 15 minutes of question and answer. So at the end of this, the speaker presentation, you can always ask your question by either raising your finger virtually, that's using the emoji, or typing your question in the Q&A. Thank you. So, ladies and gentlemen, I am happy to introduce our speaker, Fitria. Fitria is a doctor of medicine and environmental youth activist, working since 2015. She's a senior academic fellowship program 2021 in East West Center. She established Challenge Sehago Indonesia chapter Pontianak, which aims to educate people to stop littering and empower youth to take action for a better environment. Besides that, she has spoken at many high-level policy consultation forums, representing youth locally and regionally. Now she's an intern at Manisha Foundation as Corporate Accountability and Climate Justice Assistant. She's also leading a project named Asia's Pacific project that promotes SDG 12 to 15 and provides an online platform for youth in Asia Pacific to interact and engage in environmental issues. So welcome, Fitria.
Thank you, Rahmat. Hello, everyone. Okay, maybe I can start to share my screen. Is it allowed to share screen? So yeah, I would like to greet everyone first. Hello, everyone. Once again, my name is Fitria. I'm from Indonesia, and currently I just graduated as a medical doctor from West Borneo in Pontianak City, and I've been involved in the environmental issues since 2015. So it's almost seven and 8 years for now that I've been involved in the environmental issues and also the youth development. So today, as Ahmad said, that I will be having a session talking about, basically talking about the youth and their role around the environmental issues, which in this session, we are talking more maybe that related to the health sector. And I hope that you are able to see my screen now. So if there's some trouble on my screen, please let me know.
Now we can see it clearly.
Okay, thank you so much. So I'll start from now, and yeah, welcome to the session. So basically, this is just like a discussion session for everyone that wants to raise an issue, concern. Just feel free to use the chat box or the Q&A section that you can find below the Zoom itself. And yeah, we are going to talk about a little bit in youth role promoting the healthier environment. And okay, why should we talk about the healthy environments? Because during my tenure as the climate activist, and also, like I said, become someone that having a medical background. At the first, I saw that the climate and then the health issues are independent. So it's like, oh, it is different issues. All I see that, okay, when we are having the activities to sample, like promoting the sustainable lifestyle or green lifestyle, anything, and then clean up, beach clean up or anything. So it's like, okay, we do that. But when we talk about the health, it will be more like, okay, how we prevent the non-communicable disease, how we reduce the malaria, how we A, B, C, and to Z. It's like more clinical. But currently, as the global warming, or we can know that the climate change brings so many devastating disaster, natural related disaster. So the concern of the health and also the concern of the climate now being more into the how can I can say like they work together in the main way. But basically, because during my experiences in between the health and also the environment issues, okay, slowly I saw that the environment and also the health is really closely related to each other, and I think they aren't separate for each other, because a little change in the climate, a little change in our environment, it will affect the people's health. It will affect the quality of the life for the people. So example like when we say, okay, this zoonosis disease already everywhere because the climate changes brings more the virus or the bacteria prefer to have mutations that they can transmit not only from the for the animal to animal, but also from animal to human. And not only because of okay how the mutation on or anything, but maybe because the host itself already decrease the number, because example like human tend to eat wildlife animals, which is not supposed to do that, and it increased the chance for the zoonosis itself to happen. So basically the biodiversity degradation is also leading to some kind of that event. And yeah, when we're talking about the healthy environment and we compare to the pre-industrial level where we talk about the ppm, and we can see that in the pre-industrial level the amount of carbon dioxide is not as much as today, 413, and also many more. It will be like half than 200, and that's the pre-industrial level before the steam machine is founded. And now we are going to the more and more for the carbon dioxide that released into the atmosphere. And yeah, this healthy environment not only affecting like, okay, how can we save the river, not throwing the litter into the river, so or reducing the pollution to the water. Not only stop until that, but it will be a very comprehensive approach, because um, as I mentioned before, okay, when we are talking about the greenhouse gases, it's not only about the carbon dioxide, but it's all will be involved like nitro, the methane, the NO, nitrous oxide, and so on. But also we will be talking about the particulate matter or PM. As we know that WHO already released that we are currently in some country, especially in Indonesia. So in Jakarta, I can take example. They've been like we have so bad the air quality, because the air quality itself not only in the carbon dioxide measure, but also in the particulate matter, which in this particulate matter that can be divided into more smaller part, 10, 2.5, and the smallest one 2.5, and this will lead the increase of respiratory disease such as pneumonia, and then maybe the cancer, the lung cancer. So yeah, this healthy environment is very complex. If we want to mention it, I think like okay, it will not be enough 40 minutes. But yeah, for long of the time since around 1972, the term of clean, healthy, and sustainable environment is already there. Like, but until now, it's just like 2nd of August 2022, the United Nations General Assembly just announced that they are recognizing the right for the clean, healthy, and sustainable environment. So it's like 5 decades in the fight. So yeah, with the 161 votes in favor and 8 abstentions, the UN General Assembly adopted a historic resolution on Thursday, around 28 July. So there are 161 votes for that, and declaring the access to clean, healthy, and sustainable environment as as the part of basic universal human rights. And also it also called on countries companies and international organizations to scale up efforts to turn that into the reality. So yeah, these 5 decades of the fight, it started from 1972, where the United Nations Conference on the Environment in Stockholm, which ended in its historic declaration, was the first one to place environmental issues at the forefront of international concerns and marked the start of dialogue between industrialized and developing countries on the link between economic growth, the pollution of the air, water, and the ocean, and the well-being of the people around the world. And then United Nations member states back then declared that people have a fundamental right to an environment of a quality that permits a life of dignity and well-being. Is calling for concrete action and the recognition of this right. And this resolution notes that the right to clean, healthy, and sustainable environment is related to other rights and existing international law, and affirms that its promotion requires the full implementation of the multilateral environmental agreements under the principles of international environmental law. So yeah, this right for clean, healthy, and sustainable environment already recognized globally now as the human rights, basically as the part of universal human rights. And yeah, but it is still not legally binding. So we need to ensure that every country, every government needs to really put consideration into putting the this right of the people, which is the clean, healthy, and sustainable environment, in the part of their national adaptation plans, or even in their mitigation or adaptation efforts in each country. So something like that. So this is very comprehensive things that when we are talking about the healthy environment, so it will be closely related to the rights for the people to enjoy the healthy environment itself. So that's the basic or the highlight of the history for why is the healthy environment. And next slide is about young people now. And now young people, we are as the part of most affected group by the climate crisis. And of course, I put some examples here, like the eco-anxiety. So basically, there are some surveys that taken how the young people perception for the climate crisis. And this survey shows that okay, there are a lot of young people that are being anxiety for their future because they are afraid for the climate crisis impacts that will affect their themselves, their future generations, and their future generations. And yeah, of course, talking about this, not only about the mental health that will be affected, but also the current situation, as we know that maybe we can send our prayers to our fellow in Pakistan that have been impacted by heavy flood a few weeks ago, and then they are still suffering now. And there are a lot of news that I read in the online news site that okay, heat wave is everywhere, and also the drought. And it is in the other part of region there are heavy rains in Thailand, like threatening with the heavy rains and flood risk. So this is the example how the devastating of the natural related disaster can bring the quality of people into a down, or into like into the down level that maybe we're not expecting that to happen, but it can be happen. And here in my city, we are annually experiencing the forest fire, which leads a lot of smokes. So this also increased the number of people that affected with the upper respiratory tract infections and pneumonia. This affect people that comes from the young age and also the older age. And yeah, like I said, and I mentioned in the slide, young people are the most affected group by the climate crisis because first they are still young, and somehow we are like we will taking the positions for our current leader in the future, and then we are going to have family, we're going to have dreams or any plans that we want to do in our life, but sometimes, okay, maybe the climate is not really friendly now, disaster everywhere, and then it brings threat to the human being. So this is very important to us underline that these young people and climate is intergenerational injustice, because we are young people, especially, yeah, we are one of the group that burden that they have the burden a lot than the people cause it. But when we talk about how this climate injustice happened, okay, young people, women, the elder people, indigenous youth will be the group of marginalized and vulnerable people in there. So yeah, any increase that will be happening. So we are all currently in 1.2 degrees Celsius, and we are still, yeah, running up to the stairs to reach 1.5. And yeah, the IPCC already mentioned that we need to take a massive and fast response to prevent that we exceeding 1.5 degrees Celsius. But for the current IPCC report for the assessment, the sixth assessment, it already mentioned that we are probably exceeding the 1.5 degrees Celsius in around 1 decade. So that's why, like, this should be something that we need to take into consideration, especially for the government. Like the IPCC report mentioned and suggests that every actor should take part into a massive and fast action to reduce their carbon emissions. And yeah, this is the current situation, but let's be optimistic that we can push and fight for this together. And okay, how to do that? Building the coalition, it will be one of the best way that we're doing now, because young people with their voices, and according to the statistic, we are composing around 30 until 40% of the global population. So we have that power to at least like they build the movement and building the coalitions that we want to um, take action into the climate and also the environmental and as well as the health issues. And yeah, you need to work collectively, because like I mentioned, sometimes, okay, we are we want to work in the field, so at the grassroots level, it's okay. And if you want to work on the more advocacy or policy making approach, that will be good too. Both ways are good, and nothing's that lasts, because the youth that works collectively, basically they complete each other. So there will be some of it that working on the upstream level, which is in the government, in the policy, in the negotiations. But there are a lot of youths also working on the grassroots that empower the people, doing the workshop and doing approachment one-to-one with the people. So this will be very important to make the movement in the both way, upstream and downstream. And then yeah, we recognize that the health and environment are strong connected for each other. So for the coalition, of course, with the big coalition, we can bring the issue of environmental health to the people. And of course, because we want to build the coalition, we need to ensure the inclusivity between the members, between the movement itself, between the partnership. Because like I mentioned, we are tackling about the climate change. We are tackling about the right. We are fighting for the right for clean, healthy, and sustainable environment. And there are a lot of people out there that needs our help to achieve the right for the clean, healthy, and sustainable environment, for the especially like for the marginalized youth that live in the rural areas, for the indigenous youth that suffered because they lost their forest, or for the people with the poor conditions. So this inclusivity is really needed, because sometimes when we talk about the climate justice to fight for the right for clean, healthy, and sustainable environment. So climate justice also talking about the social justice, where we want to make the justice all of the all of layer of people, without, yeah, to make it not, there is no border between us. So we want to provide it equally to everyone, and of course participate in any level and that available, that will be very helpful too, because sometimes in the government there will be opportunity for us to be engaged for the youth, and also in the regional, if you are on the EU, so the EU Commissions, the Commonwealth will be one of place that you can take place to raising the voice for local communities. If you are from the Asia, especially Southeast Asian, we have ASEAN communities that you can take place and step in as the youth representative from your country. So participate in any level will be really helpful for you to amplify the voice and also to expand and extending the invitation to build the coalition itself. And yeah, but how can we do that? What we are going to, what we need to do? So there might be many things that we need to decide, right? When we want to help build the movement. Along my experience, okay, I started from the grassroots communities, which okay, we are keep in touch with the people, with the children, with the youth people, especially to join the movement to do the climate action with us. And yeah, but like I said, this climate approach, this environmental health approach needs to be done by two roles, like upstream role and downstream roles, like I mentioned. So it will be best for us to not only work with the people in the grassroots, but also pushing the government to be involved. At least, okay, can help to make our work easier by again releasing or any policy or law that support the something it's like the plastic ban or the plastic the paid plastic. So that will be helpful to help the grassroots activities and the aims, because we are talking about the degrees, the temperature of the climate itself. So of course we want to reduce the greenhouse emissions, and we want to press the temperature not exceeding 1.5 degrees Celsius, and by reducing the GHG emissions. And I think I'm going to talk about some approach later on, but let's see. Yeah, and now one of the strategy that implemented. So every country that involved in the meeting, so we are going to have the next meeting COP27 in Egypt soon. So the national adaptation plan is actually one of the, I can say that it's one of the good commitment that been taken into the COP in 2015, right? And it will be helpful for us to monitoring the commitment for the government to reduce the GHG. And yeah, this net zero emission is one of the approach for the government. So net zero emission is basically like the equal of the emitted. It will be the emitted GHG, the greenhouse gas, is equal as the its balance as the removal. So it's like if you give 50 and then you take 50, so there will be zero. So that's what all the government trying to do now, including Indonesia. So, but I'm not sure if in another country, because the net zero emission will be similar with the net carbon emissions too, which we sometimes call it carbon neutrality. So there are a lot of terms here, so don't be confused. Okay, but yeah, just make in mind that net zero emission, net carbon emission have the principle like what you give is equal with what you take. So they need to be, so the greenhouse gas need to be removed, so it will be like zero. There is no amount of greenhouse gases that emitted. And yeah, we can see in the right section here there are several names of countries that contribute most to the global carbon CO2 emissions. You can access the data in the world data here. It's really helpful for us because it's very comprehensive data. Not only for the contributed most global to carbon CO2 emissions. This data is taken from the evaluation from the pre-industrial revolution until the post-industrial revolution until now, which we can see one of the biggest region that can that emitted the carbon oxide is the EU. So yeah, something like that. And then this will be very important because net zero emissions not only how we are talking about the energy, how we are talking about the reforestation, but how we talk about that merge it with the health sector. So yeah, so how to make that, and that's why before I jump into the discussion with the net zero emission in health sector, I need to introduce you with the climate resilient health system that introduced by the WHO. So this is the working definition by the WHO of a climate resilient health system. And yeah, I think again I need to say that this is very important to be adopted by all of the government. Because like I said, when we are talking about the climate and the health, maybe most of the people will think, oh, that's the independent issues. I mean, like when you're going to the hospital, there are how many people that we're talking about the climate and also the impact to the health. You can count it, right? And yeah, this will be very important to bring the awareness for the climate resilient health system, because it's not only how the hospital itself reduce the GHG, the greenhouse gas emissions, but also how to make the doctors, the nurses, and all of the people inside the hospital aware about this this climate crisis impacts to the health. So I forgot how many points for the framework there. I think it's around 7, so you can try to access the handbook there. It's really interesting to read that because, okay, like I said, oh, so there are a lot of approach that we can do to create climate resilient health system. And one of them, okay, the climate financing. Then we can work with educating the doctor also. We can work with bring the awareness with the nurses also. So something like that. Despite reforming the system and also the technology in the hospital itself. And yeah, this will be very very interesting to talk when we say that, okay, what health sector is one of the polluted sector that contribute in the greenhouse gas emissions, and we need to recognize that. And yeah, why so the health sector will be one of the part in the net zero or in the in the net zero emissions, because like I said, the health sector is one of the polluted sector that contribute to the emissions a lot in the world. So it will be very important to incorporate the approach to reduce the gas emissions and also raising the awareness for the health work, the healthcare providers to like doctors, pharmacists, so on. So because like we are now coalition building is not only about uniforming the movement, but how to create it more universal. But there are a lot of various people with the various background in there, so we can tackling many things at the same time. So that's what we are calling to have the inclusivity and also okay how to make it more universal to everyone. And this is the climate resilient health system. So I hope that I saw that British the British already, the England already put the climate resilient health system in their NHS and insurance in the NHS approach. So if you are trying to type in the Google NHS and net zero emission, so there will be a handbook that really comprehensive to mention how they want to reform their healthcare to be more climate friendly. And that's amazing. Like, can we just try to copy or duplicate that effort too? So still waiting for the global government to implement the same thing too. But yeah, back to the basic rights that we have: the safe, clean, healthy, and sustainable environment. It should be, I mean, like I said, one of the human rights part. So I think the government should guarantee that. But once again, it's not legally binding. So it's like whether the government wants to take it into the consideration or not, it's depend on them. So it's not legally binding. And yeah, I think the fight for the climate justice activists is still there to make it how to make the resolution is legally binding to all of the country. Okay, so yeah, I think we are going to the end of this slide. And yeah, creating a healthy planet is a collective world. So for you, if you wondering how to start your movement, you can join the Planetary Health movement. Because if you don't know how or where to start, you can try to find your local community first, and then try to gain more first knowledge, initial knowledge about the climate activism, and then meanwhile you can try to gain knowledge from your colleague in this networking, especially if you're coming to this webinar. So that will be helpful for you. And then you can start by yourself implementing sustainable lifestyle. So it's like if you love to try more plant-based diet, and yeah, just try to do anything that reduce your carbon footprint, that will be helpful too. And use your power or use your privilege, if you have that, to push the government and stakeholder accountability, because of what youth as one of the affected group in the world for the climate crisis. Also, they are the group of people that contribute less to the climate change. And who are the parties that contribute a lot of in the climate change? You can see in my screen on the last on the last point there. So that's why we need to take action to push their accountability, because because you know what, like, okay, I can take one case example, the renewable energy project. Okay, that will be sounds great, right? Oh, renewable energy project implemented by this government, but in the end of the time, it only like how to say that, it only affected the people around that, the local people. Also, they're criminalized the local people who don't want to leave their land to give to the government to give to build the renewable plants, or basically the renewable plant energy is not really work well, so they leaked and polluted the environment and also affecting the people health. So something like that, that's where we need to push the accountability for the stakeholders, government, or anyone that taking big responsibility and taking as a main roles for emitting the carbon dioxide or the greenhouse gas emissions. And yeah, this is the examples of good practice. You can see here the Health in Harmony NGO and also Alam Sehat Lestari. And I mentioned the Health in Harmony NGO. This is very good example for you if you want to explore more about the planetary health, both of them actually. So this is the NGO that focusing on the health and also the environmental issues. So you can try to check their social media. This is very interesting to see how they are worth promoting sustainable and clean and also safe environment. And for the next one, the Alam Sehat Lestari, or we call it Yayasan Asli. This is very interesting again, because basically this is a medical clinic that they also doing conservation. So mostly like all of the doctors, all of the health workers there needs to implement the green lifestyle, needs to implement the sustainable lifestyle when they hired there. And it's basically like almost in the forest, near to the forest in the deep West Borneo. So you can try to look their social media and see how amazing their work, like tackling the health issues and also doing the conservations and educating the people and empowering also the local people to talk about the climate and also the health issues. And yeah, this is amazing, and this is the good practice and examples if you want to explore more. So I think yeah, that's all from me. Thank you so much. And if you have anything to discuss or any concerns you want to share, just feel free to do that. And I would like to give the floor back to Rahma.
Wow. Thank you so much, Fitria. That was a wonderful presentation. Like you're really triggered or like spurs to take action in combating this challenge, climate change. So I think we have a question from one person. Let's see for you. Okay, so the question goes as, what would be the best way to spark interest among youths to look after the environment?
Okay, so shall I answer it now?
Yes, yes.
Thank you. So thank you so much for the question. Yeah, basically, I'm like, we will never be able to force people to join us or to, in general, we cannot force people to like what we like, right? But what the best way we can do, just being the role model. And this is one of the youth role also, because they are an agent of change in their society. So becoming the agent of change um, will be like implemented in the way like you will be becoming the role model also. And when you're becoming the role model, people get inspired. So you're like automatically make they come to you. They join you or make they duplicate your work. So that will be very important. That sometimes it's very hard for us to keep the commitment or maybe like to be consistent. But that's understandable. But as long as you're still aware that okay, this is my responsibility to take care for the environment, to take care for the planet, and I'm aware that if I don't take any part for the planet, for the climate change, so I need to be ready with the consequences that someday or one day in the future, later on, this climate crisis will impact my health, my well-being, and my mental health, or something like that. But other than that, it will be very okay or very good for you to keep campaigning, keep educating the people that are nearby around you, so they will be knowing at least, okay, you are doing A, B, C, D. You are doing that. You are doing this, and like I mentioned, it needs process and consistency and commitment may be one of the challenge. But yeah, as long as you have this strong motivation, I think that will be not matter. And the best way to spark, yeah, I think by giving example from yourself and just being consistent to educate people to, okay, like I cannot force you like guys, and then hey, this is what I'm doing and this is why I'm doing this, so people will know. Because sometimes when they don't know what we are doing, they just like, oh, just doing A, B, C, D. But when we explain why we do this, oh, she is doing A, B, C, D because of this, something like that. So sometimes we need to give them understanding, so they can have a good comprehensive knowledge to, okay, to decide whether it's right or not. But other than that, maybe your actions, your organizations, your movement can make people interested to join you. Because in my experience, sometimes we don't need to look people. We don't need to do open recruitment. They just come from themselves because they are seeing that, oh, your project is very interesting. May I join you? So something like that. So yeah, just try to give example and be consistent to educate people, and then yeah, just keep educating and doing what you are doing now. I believe that we are doing great, or any way that we can, but it's just the matter of how how strong that our motivations want to make people come into the topic that we want to discuss or that we want to campaign later, so they can join our movement. Yeah, that's still a big challenge for me too. Sometimes that, yeah, that's my trick. If I want to make people come with me or make people how to do same thing like I do, so I need to give them example, not forcing them, and then I explain why I do this. And yeah, that's sometimes really helpful for us to encourage them or like inspire them to join the movement. I hope this helpful, and this really I hope this can be understood by the asker. Thank you.
Yeah, thank you so much for that response. Like, I agree with you totally, because most times when we are trying to to promote or to take action towards climate change, especially in the rural areas. Most people are always like, they don't understand why we are doing it. And that is why we have to keep on enlightening more people by taking action, by not just like trying to fold our hands and just watch. Why? Because we feel like the world person among the rest of people who are not taking action. So you just have to like be that change maker, be the groundbreaker, be the advocate for change. And before we know it, we are going to inspire other people to take action as well. So yeah, thank you so much for that response. So we
get
have
the point.
yeah. So we have a question from Adrena. She said, what skill set do we need as youths to do intersectoral collaboration in advocating for climate change and health? Can you share your experience on it? I think that's a great question as well.
Yes, so what you said, intersectoral collaboration in advocating for climate change and health. Basically, when in my experience, so I've been involved in climate activism at the international level since 2019, and it's really rare for the youth activists that come from medical background, especially. And yeah, because this, like I said, sometimes when people doing the climate change and the climate change issues activism, and also sometimes for the people that are working on health activism issues, so it will be like independent. So most people don't really know, okay, how to explain this relation, because yeah, like we can recognize sometimes to explain some of the things that related to the health, and also especially the health, it will be quite tricky because we need to use the general terms, we need to explain in a very slow way, and also yeah, as general as possible. And maybe that's one of the things. But for me, because I'm focusing on the climate justice currently for my work, also because I'm interning in Malaysia Foundation that working as the corporate accountability and climate justice assistant. So talking about the climate justice, it will be talk about the drive for a clean, healthy, safe, and sustainable environment, which is related to the healthy environment, right? So of course, how to advocate that, we can explain that, okay, if the climate crisis still happening like this, so there are a lot of marginalized and vulnerable people that will be affected, which they contribute less to the climate crisis itself. And these are not only deteriorating their economy or their life condition, but also their health, right? And that's where I take the part. So okay, maybe let's say that in general, negotiating advocacy thing, it will be very important to be in there for us. But when we explain that, it will be very tricky. Like I said, there are some terms that we need to explain a little bit. Okay, there will be a chance for increasing the mortality. Some people don't know what is mortality, so that's a challenge sometimes. And this is how to explain to the people that don't have any medical background, and that's what I'm doing. And yeah, emphasizing in the right for clean, healthy, and sustainable environment is one of the main agenda for now, as I'm supporting for the resolution itself that to be implemented, but it's not still legally binding. So yeah, I hope this will be helpful, because like I said, it's really tricky to explain some of the terms or some of the details, because when we are explaining, okay, how actually this zoonosis is happening, doctor, can you help me to explain that in the easy way? Okay, the zoonosis happen because when you eat the wild animal or the animal that are supposed to be eaten by the human or not in the livestock, so there will be probability the bacteria or the virus mutate, because the host is disappear, or because the interaction between the human and also that wild animals is getting close, so that can jump, so just something like that. But when we talk with the expert, with the fellow doctors or anything. Of course, it won't be like that. So it's very tricky, but yeah, I hope that this can answer your questions.
Yes, yes, yes. You did justice to the question. Thank you so much, Fitria. So Edwina also have another question. She said, I think a lot of fields in planetary health and climate change may have unique terminology in their field. How important is learning to understand other fields and what can be done to do as youths? Okay.
Okay, sorry. Okay, I think this related to my first answer because
Yeah.
For me, for me personally, it's very confusing to learn about what is this net zero emission, what is carbon tax, what is anything that related to the climate change terminology so far. But yeah, that's the part of learning, right? Because that's part of my responsibility too, because I'm a youth advocate, so I need to know about it. But yeah, but sometimes it's really fine for us to learn as much as possible, but as the best for I think as long as it's the best for you. So like I said, I'm really confused how to understand more in the climate financing, because it's really, it's talk about the economic. Meanwhile, I have a medical background, but at least I know the highlight, I know the overview, I know the basic things that, okay, the climate financing. So basically, the climate financing including, okay, giving the funding to the NGO, grassroots communities, or allocating for the carbon for the carbon emissions actions, something like that, or doing the carbon tax. So I just try to highlight that in the general words that I can say, or I can conclude. And talking about net zero emissions, carbon neutrality, and what else? Carbon net carbon emissions. So those are like, actually, if you find in the glossarium of the United Nations, it will be like slightly different, but yeah, but the principle is the same. Like what you give it is equal with what you take. So something like that. So yeah, it will be very important. I can try to emphasize it will be very important, because, like I said, when we're doing the net zero emissions, it's not only about how we implement it in energy sector, which, okay, solar panel will be there, hydropower will be here or anywhere, but how this will be incorporated in the economic sector, in the health sector, in the transportation sector, in the agriculture sector, that will be very comprehensive and complex. But to learn about those terms, it takes time. I know, but don't worry. If you have confusion, or if you have any doubts, you can try to clarify with the people that you think you have many experiences on that on that section. So you can try to clarify your, okay, I'm confused about this. Is this true? So try to do that. So that's what I'm doing. So yeah, trying to study another thing beside the medical. Sometimes it's really exciting, but sometimes really confusing, because it's not related to your field, and there are a lot of terms that you don't understand. Like now I'm working with the NGO that based with the law, and also talking about the environmental law. Okay, talking about the legally binding human rights due diligence, and what else? Something that related to the constituency. So it's really confused me, but by the time I learned a lot about that. So I hope this is answering the questions. Thank you.
Yeah, thank you so much. That's answered this question. I was just thinking, when you're just looking, like, maybe possibly there could be like a link that like in form of dictionary that's basically explain how these terminologies. Is there something like that,
Yeah, I think I shared it in my slide about the website. Let me check. Yeah. Let me share it again. Yeah, basically, the IPCC have, Okay, I hope this. Okay, so basically IPCC has their website for the words glossary. So it's an example. I cite this. I citate this from the IPCC www.ipcc.ch. So the glossary. So you can try to find it in Google. And I think the sentences, the concept is really easy to understand for you to check. Let me try to copy and paste again. Yeah, I hope this is answering the question, Ahmad. But I don't know if my slide will be distributed in the public or not.
Yes, sure. It does answer the question. Thank you so much. So I think we have more questions from Andrena. She said, based on your experience, how different is the understanding and interest of climate change and health between youth from the global north and the global south? If there is a gap, is there any action taken to lessen the gap? For example, the Yongo.
Okay. Yeah, so we're talking about the different understanding of the how to say that for the youth in the global north and the global south. So according to my observation, because how to say that, I mean, like people in the global south tend to have more tropical or subtropical seasons, right? Where we experiencing 4 seasons. Sorry, we are experiencing 2 seasons rather than people. Most of the people in the global north that only 2 seasons, 4 seasons. Sorry, it's like messing up. So that's maybe what are the gaps, like, okay, how the real experience or how this kind of differences of the season can affect the people. Because example, like, okay, maybe in the global north they are not experiencing massive flood because heavy rainfall during the rainy season that can happen maybe 2 until 3 months in here. But it will be different because they have a 4 season. And in here, people in the global south and we are in the global south, maybe we're not really understanding how to experience the heavy snowstorm that can happen. But yeah, most of the time, what we are trying to take the red line, to draw the red line for all of us. Okay, this impact of the climate change is climate change is happening in a various way that we experiencing right now. Example, like, okay, maybe in now people in the UK is already suffering with the heat wave. Meanwhile, people in Pakistan, which is very it is very different situations. In Pakistan, it's flooded, and in UK heat wave. So, but both of the situation provoked by the climate change. So that's what we are trying to get for the red line. And for the experiencing, I mean, like for the experiencing in Yongo, we try to involve as many as youth, especially from the global south, to be, I mean, like to be there for the meetings, to be there with the policy making that we are doing now, or with the handbook that we are drafting now. So we are taking the participation for the youth as many as possible without limiting it. But we are seeking more with the global south youth that experiencing maybe the real climate disaster that happening in the city to be counted on, how to say that, on the place where we can try to highlight them, or we can try to help them at least. So yeah, so I have a friend from Pakistan now. So because of due to the flood right now, so he's working mostly with the people to help gathering the donations, especially still working with the grassroots. But there are a lot of people that helping him, and also me as his friend also. So I can try to look out, okay, what are the possibility alternative, or what are the possible funding that we can do to help him. So basically we are trying to work on that hand by hand. So talking about gap, I think on the experience gap that happens, but for the knowledge, I think knowledge can build. So the knowledge also flexible, so it can be developed. But as long as we are committing in the climate actions and also the health sector. So I'm currently in the in the Yongo Health Working Group. So in there, we are not only talking about how to bring the awareness with the health in the climate crisis, but also how to empower the youth. So heading to the COP27, so of course we are having so many things that we need to find more youth to be involved in the movement. So this is what we are doing. So I hope this answer for the question. Thank you.
Yes, yes, thank you so much. That answers the question. So thank you so much for taking the time to share your experience and also your work with us. It has been very enriching. Like I got a lot, like I got this, well, I say this motivation, to keep working towards climate change, because this is something that it's our problem, and we all have to like come together to solve the problem. So it's going to be like a collective effort, not just one man's job to do. So we keep on doing it till we get there. So thank you so much for sharing and also inspiring us to take action. Yeah.
Thank you so much, Rahmat. Yeah. Happy to be inspired again.
Yeah. And I believe everyone on this call also like they have been inspired to take action. Yeah.
Hope so.
Yeah. So I think we have 2 minutes left. So if you have any question, you can say ask your question. So either by raising your hand virtually or writing your question in the Q&A box. Okay. I think okay, so guys, so you're invited to the next session, which is the digital health devices and apps for One Health. So we have shared the link to the session. So you join us. So that will be starting immediately after this session. Yeah. Thank you so much, everyone, for joining this session. We hope to see you in the next session.
Thank you so much. Thank you so much, Rahmat, and everyone.
Yeah, thank you so much, Fitriya. Yeah, thank you so much.
Bye-bye.
Bye. Bye, everyone.
Hi, everyone. So thank you very much, Rahmat and Fitriya, for the very amazing session. We'll now be going on to the next session, which is a conference session. So if you are interested in applications and devices on digital health and how it is applied to planetary health, please stay in this webinar link. Otherwise, if you are interested to instead learn more about big data, artificial intelligence, please join the link that has been given in the chat box by our committee member. So yeah, I think I will just resend it. In the meantime, I am back now as the host and moderator for the session that is focusing on apps and devices for One Health. So I will now start, and hopefully you guys are still interested to learn more about planetary health, because we know, I think it is mentioned by Dr. Fitriya and also our speakers from the session on governance and advocacy, that this is a very huge field that requires a lot of multi-sector collaboration, and one of which is technology. And we know, based on our experience from the pandemic, that digital health is revolutionizing health systems across the world, because it enables seamless and real-time systemic integration. Now, this session, as I have mentioned, will focus on apps and devices. I believe that people here must have tried digital apps or devices at least once, particularly after the pandemic with the emergence of telemedicine. And this session will further dive into that with particular focus on how it can also be used for planetary health. And as defined in the previous sessions, planetary health is the human, animal, and environmental interface and collaboration to achieve better healthcare for every being in the world. And so in this session, we will not only learn about how it is used for humans, but also how it transforms veterinary medicine, environmental medicine, etc. Now, without further ado, once again, I'm Adriana, a medical student from Indonesia, who will be moderating today's session. We will continue to the session, which will consist firstly of 45 minutes of panel discussion, followed with 15 minutes of Q&A. And we have two panelists for now. I would like to introduce them. It's really an honor to have these experts with us right now. Actually, we should have one more panelist, but unfortunately, she couldn't make it because of medical issues. And we will be sharing her materials and links provided by her by the end of the conference. So now, without further ado, I will continue to presenting the bio for our first speaker, who is Dr. Onyema Ajuibor. So Dr. Onyema Ajuibor is a technical officer in the Health Workforce Department at the World Health Organization in Geneva. With a combined background spanning more than a decade in clinical medicine and public health, Dr. Onyema currently undertakes the development of policies, norms, and standards to inform investment in health workforce, education, employment, and retention towards the achievement of universal health coverage and the sustainable development goals in countries. So, welcome, Dr.
Thank you very much, Adriana. I don't know, colleagues, if you can hear me. I think the host has disabled the video function, so I cannot share a video of myself yet. But thank you very much for the warm welcome, and I'm looking forward to sharing a few words and learning from you all, as well as my co-panelists. Thank you very much.
Thank you very much, Dr. Onyema. We're working on the tech issue on that, but once again, welcome. And yeah, now we can see you, so it's quite nice. So I know it is holiday there, and we are very honored to have you in spite of it. So thank you very much for your time, and I truly hope that this will be a very fruitful discussion for our participants. I believe that it will be one. So next up, we have Dr. Ronald Moura Castillo, who is the charge de mission in the World Animal Health Information and Analysis Department of the World Organization for Animal Health, or WOA, formerly founded as OIE. It is located in Paris. So while studying to become a veterinarian, he worked for giants of the technology industry. He later specialized in epidemiology and preventive medicine. In Costa Rica, he worked as a responsible of the National Veterinary Services Laboratories and epidemiologist before moving to Paris in 2017, when he began his contribution to the WOA in the arena of disease notification and data analysis. So welcome, Dr. Ronald.
Thank you, Adriana. I'm happy to be here with you. Thank you, everyone, for organizing this interesting event. And I want to thank especially my friend and colleague, Doda Nawola, which is part of the organizing committee, for this invitation, for referring me to join you guys today. I'm really happy to share with you today some of my views, the views of the organization, our organization, and especially to learn from you all.
Thank you, Dr. Ronald. And of course, thank you also to Dauda. So he was the one who recommended you to me and to all the organizing committee. And once again, I believe that this discussion would be very fruitful. So in case any of you attended last year's conference, I think Dr. Onyema was also in the conference. So maybe you see that he is a familiar face. And now we are moving directly to the panel discussion, which focuses on planetary health. Oh, but for that, I think I would like to still introduce one other panelist that couldn't make it due to technical issue. Her name is Dr. Elena Petelos. She is the Vice President for Health Technology Assessment at the European Public Health Association. So while she can't make it now, once again, as I've told before, we'll be sharing her much idea conference. We'll contact directly to question as the list. I would like to ask and open this panel by asking about your experience with digital health applications and devices. How can it transform life? So, IQVIA Institute for Human Data Science, there are currently 350,000 digital health applications geared for humans. On the other hand, we know that the potential of digital health applications is not limited to human health, but also for animal and environmental health. So based on your experience, how can these applications transform planetary health and One Health landscape in the community? Perhaps we can start with Dr.
Thank you, Adriana. I think I just wanted to check before beginning. It seemed like the network was scrambling a little bit. Was that from your end or from my end?
Oh, I think this is perhaps on my end. I will.
Okay, it may be from
Yes.
mine. So I just to make sure that I heard your question properly, and also that when I'm speaking, that participants can hear me, because it's possible that it's also from my end. I mean, these are some of the challenges we deal with when we talk about a digital, right? So, okay, I think I got a grasp of what you were trying to ask, and I will go ahead to try and answer your question. So Planetary Health and One Health, this is, I mean, these are, I listened in a bit to some of the earlier sessions, and I heard a lot about, you know, multisectorality, and that term kept coming over and over again. And digital health applications for Planetary Health and One Health, you're basically going to cut across a number of layers of health service delivery, sectors of society, and different disciplines of health workers, not just health workers in themselves. Because when you look at the definition of planetary health, you're talking about the impact of human activity across political, social, economic areas of our lives, and the impact that these have on the planet and how it sustains us as humans. And when you add the One Health discourse, where you have the human, animal, and the plant layer, you are looking at a really a complex ecosystem. And what you have at the moment, using very lay descriptions, is a multiplicity of digital health applications and programs at the various layers that are interacting to result in the end goal of providing health. And for it to be impactful at the community level, I think of, this was very helpful to think about when I was thinking of the session was if you think about the health in all policies approach that is commonly used in the social determinants of health discourse, and then you think of the health in all technologies approach, I think that this is a better way to think about digital tools for planetary health and One Health. So not just to think of digital health applications, but to think about how technology cuts across, or how, what is the impact of technology on health, irrespective of whether it is a health application or it is your cleaning device for your car, or something that monitors the, I don't know, oil levels and sea and drilling and so on. So this is a way to think about that. And it brings us also down to, you know, how we, how these also affect us. So if we look at, for instance, the floods that happened in Pakistan, we are now at a level of development where weather systems can be tracked and predicted, and you can actually estimate the volume of rainfall. And we start to ask some critical questions. Why, and well, it's also a bit difficult because a third of the country was covered. But you start to make those critical linkages. Where were the early warning advance systems? How were people coordinated in terms of the evacuation and all those principles? The floods also affected animals as well. We've seen pictures that are not nice to the eyes, and you can see that digital does have a role to play. I'll end by saying Europe experienced here in Switzerland and in Geneva, for those people who are listening, we had a severe heat wave about 3 weeks ago, and I remember on my phone receiving a notification to say, oh, you know, it's going to be really hot today, make sure you put on some sunscreen and all that. And I think of this as, you know, one way where we are seeing interactions between how technology cuts across our lives and what that can mean at community or personal level. And this obviously may be different in areas where there is no access to such technology. And society and policymakers and youth who are here today need to continue to draw the ring and the interlinkages and make sure that the systems are connected. I'll stop here. Thank you.
Thank you very much. I really like the example that you mentioned about how a notification on heat wave is also one of the examples of digital health applications usage for planetary health. I think it's very interesting because, well, at least for me, I didn't really think about it. I didn't think that a heat wave notification on my phone is also associated with planetary health. While at the same time, if I get that notification, I will surely put on my sunscreen. So yeah, I think digital health applications and tools in planetary health is closer than we think. So thank you for that. Dr. Ronald, do you have any experience to share and anything to add?
Well, thank you for the chance and for the question. So yeah, all of these applications or initiatives to target and specific problems of modern society overall are amazing. We're living amazing times. Before, we just didn't have these tools. We had envisioned as humanity a better living, and this is it. We have it now. We're living an era of technology that allows allows us to do many things, which is good, is great. But I loved especially the fact that by having this short intervention, we can also trigger some challenges, because there are many still. So I just have a very quick presentation to share, just 3 slides. And the idea behind sharing this information is pretty much, can you see the slides now? I just want to make sure.
Yes.
Okay, good. So it's just to provide an example of what we can do, what my organization is doing, and what we all can do. So yeah, applications for planetary health in our side is for animal health, of course. But I think we quickly learned recently with the COVID pandemic that we just, and this is very human, we tend to separate things. We love separating things, categorizing things, and putting things in boxes. This is a very human default activity to do when you start dealing with a problem. And I think COVID reminds us very, very strongly that there's no such a thing in nature. Nature is chaotic, and this is the way things are. So animal health is part of human health. Environmental health is part of human health. And we just cannot unlink these natural links, although we tend to specialize, and this is good because we need the specialization. But we need to see the whole situation as different elements being part of the same structure. So I work for the World Organization for Animal Health. To date, it's been recently renamed to WOA, although the former name remains as OIE, which in French means International Office for Epizootie, which is the former word for pandemic in animals. So the organization exists since 1924. So it's one of the oldest existing organizations still running, international organizations that deal with global health. So what we do pretty much is we group members. We have 188 members now, and the idea is for them to share the information on diseases affecting animals. So we separated diseases when diseases affecting terrestrial and aquatic animals. And all of this is for these diseases, we create a plethora of content, not only regulations like norms to regulate the trait in the species affected by these diseases, but also we put available on a modern platform that I'm just about to present, a comprehensive view of the presence of diseases in the world. And this is information. And here, although we don't have an actual device to deal with, we have information. Information is way, way, way more powerful than a device. If you know what's going around you, if you know what's going with a business partner, that will allow you to do many different things. Like our colleague just mentioned, if you know it's going to be hot, well, you can prevent many things from happening. So this is in very few words what the organization does and who we are. Our headquarters are based in Paris and have been since 1924. And this is just a screenshot to display one of the engines of our main application. It's called World Animal Health Information System, WISE. And WISE is a database which pretty much portrays the status of these diseases in the world. These diseases affecting dozens of domestic species and hundreds of wildlife species, and over almost 130 diseases are represented in this platform, which is used by countries to notify information that after a deep analysis is published. So this version of WAHIS is an improved version of what we had before. And a very natural question: why should I know about WAHIS? Well, WAHIS, the new version, is targeted not only vets, because it's easy, and you will understand what I'm saying. It's easy to speak to your own. Your own will always understand your words. You will understand what yours will have to say about a common subject. But it's harder to speak to other people, you know? It's harder to speak to journalists, to students, to just, you know, social society, everyone interested in subjects, the subjects you deal with. It would be nice to involve people, society as a whole. Well, they can get involved if we speak jargon, you know, and this is very common. We tend to forget very often that we're not speaking at the same level to everyone. This particular meeting is an example. We all know what we're talking about, but we come from very different sectors. So speaking about specific terms could mislead, in fact, people. So WAHIS, I invite you to take a look. It's wa.wahis.org, and this platform is very friendly. You will have the option to display maps and graphs of different kinds, and you can actually check the disease status of your own country, and then see what's going on in your country. You know, some of these diseases are zoonotic, so I think that concerns all of us. And I guess concerning mobile applications, we do have the challenge to develop what we will call the WAHIS Alert app. Now, this app, as many apps for smartphones, is not intended to replicate all of the features that a desktop application is capable of. The idea here is just for users to receive alerts on their phones. And especially, the good thing is that you can customize many things. So if you're in Asia, you're not interested perhaps in diseases occurring in America, so you don't really have to target this particular continent. So all this type of customizations will allow for a more targeted alert system that will allow users to have access to all this information in a matter of seconds. Now, all this information may seem trivial to some people, but if you think about it, there's a lot of information here that is very powerful in terms of disease spread, how the disease is behaving, just like we used to follow the COVID pandemic, which we don't do that often now, but we probably should. Just like as we did with the pandemic, well, we can see that with animal diseases too. So the WAHIS Alert app will allow us to bring to the smartphone context information provided, officially notified by countries, which will be dramatic in terms of for the process of decision making. So this is what I want to introduce as an example of what we're doing and what I believe will make a difference in terms of this notification for animal health. Thank you. This is my intervention for this particular question, Adriana.
Thank you very much, Dr. Ronald. So I think that WAHIS is very interesting. I have a short question on it. So who is the main target user for WAHIS Plus?
So it's a great question. We sat down and analyzed all of the information, and we asked ourselves, who would care? Who would care, really? Like, we know the vets will care, of course, this is their business, but we know governments will care. We know there's people looking for to expand commercial activities, and the agribusiness is huge. It represents an enormous portion of international trade. When you sit down to have a meal at a restaurant, you don't really think of where this food is coming from. If it has a local origin, there are good chances that the veterinary chain has been involved at some point in the food you're having. So we expanded. We expanded the the target population for WAHIS. So now the information is easier to understand. There are no symbols or weird words like, as I said before, jargon to restrict the access to people. So pretty much anyone can take a look at WAHIS and find something for them. We were specifically targeting journalists because we understand animal health and overall global health. We understand that it's not always easy to understand. So the messages have to be very clear, very concise, and but you still get the chance for misinterpretations of information. So the idea behind WAHIS is to make information as clear as possible, as concise, and to raise the interest of the population, as I said before, pretty much of everyone.
Thank you, Doctor. I think you raised a very important point in that digital applications and digital health tools overall can really help disseminate information to the general public, which I think we know during the COVID-19 pandemic is one of the big issue in terms of how we tackle and react to the pandemic. So thank you for that. So I believe that it's one of the very important use cases of digital health applications in planetary health. So with regard to that, I would like to ask to Dr. Onyema about what factors are important to sustainably implement digital applications in health systems. I mean, we know now how important it is, and we know that they need, like mentioned by Dr. Ronald, that there is a need to be able to easily understand the platforms in order for it to work effectively and in accordance to what we are hoping for. So what key principles that are needed to sustainably implement digital applications in health systems? And does it differ between fields? For example, maybe it differs between human, animal, and environmental health.
This is a very good question, Adriana, and it's interesting because I like what Ronald was saying about information being more powerful than the device itself. And I recognize there's a plenary, a parallel session rather going on where they're talking more about data and I think information. But I think also you need the device and the applications to make sense of the information. So hopefully what we're talking about here is important. And I will be surprised if across the two sessions, we're saying very similar things at the end of the day. To answer your question, Adriana, I think there's some general principles for digital development that hold sway, whether you're in Microsoft or in some other field doing just building a random digital app, things like designing with the user, understanding the existing ecosystem, designing for scale, building for sustainability, ensuring that your technology is data-driven, using open standards and innovation, ability to reuse and improve your software, issues around privacy and security and collaborativeness. These will cut across, whether it's for One Health or Planetary Health or whatever technology you're talking about. But if we talk about One Health and Planetary Health, I started to think a little bit more because whilst they're principles, they also seem to be, I would say, sort of cornerstones of frameworks, if you would say. For instance, in health, we have in the past, I don't know, decade or couple more years, we've been talking about the person-centric and the human-centric. and people-centered. And everything we do right through the SDGs and even more recent policy approaches in the human health sector has been really focused on the human and the person. And I think that one of the principles that we can begin to think about to say, look, it's great, that it's all person-centered and we're the focus of everything, but we also are not, we don't live in separation from the animals around us, the viruses. We don't live on a random planet. We don't, the trees are not, they give us the oxygen and we give them back the CO2, right? So I think that one of the first things that we should begin to do from a policy standpoint is to shift from the person or human-centric to include animals, plants, and environments in that discourse. Now that's another ballgame together in terms of, how would that work? What does that look like? But I think that it is a consideration that we need to really take if we really want to be thinking about building devices or applications for planetary health. Another thing that needs to happen on a bigger scale is to move from siloed architectural systems through to integrated and exchanged enterprise architecture systems. So you mentioned at the opening that there are more than 350 to 400,000 applications. And you start asking yourself, how do these work? And a lot of them are personal, individual user apps. So it could be an app on my phone that monitors my heart rate, right? This is not connected to, it's just between the company who provides the app and myself, right? But for Planetary and One Health, we talked about at the beginning the level of complexity and how it interacts with systems. And you need devices, you need platforms, you need exchange systems that begin to, that you start having discuss around interpretability and exchange of networks to really facilitate some kind of real-time exchange of data. Now it's very complex to think about that and how that works. But I think that that's a second shift. And the third one that I wanted to talk about is the fact that this needs to be government-led and private sector-driven because of the complexity involved and the number of stakeholders. We need to be pulling, we need frameworks, we need legal background. So for instance, if we begin to have platforms whereby we're really exchanging data across sectors and animals and plants in real time, who holds the data? What are the issues around privacy and security? We need those kind of things to be established. But then again, we also know that if you think about the Facebooks, Googles of this world, they have and they drive the innovation that actually can allow us to break through and be useful with some of this information and everything. So there needs to be cooperation across governments and the private sector, and each one playing to their own strength and really, trying to work across this multi-sectorality that we've been talking about. So these are some of the few things that I can think about, and yeah, I'll stop here.
Thank you very much, Dr. Onyema. So to sum up, I think it is very important to shift the development from being human-centric to also include animal and environmental health sectors. And it is also very important to collaborate intersectorally, as well as to foster collaboration within government and private sector. And I have a follow-up question on that, and that is, do you have any example or success stories on the inclusion of digital application in a national health system? Is there any country in the world that has successfully done the 3 shifts that you mentioned? And if so, what can countries with less resources and additional barriers such as lower literacy and infrastructure learn from them, and also hopefully adopt digital health into their national health systems?
Yeah, thank you, Adriana. That's a really good question. There are some, yes, there are examples, and the first, the case that comes to mind is Estonia, and we all, if you work at all in digital health or you do related stuff, you would know very well about Estonia and how they are one of the most advanced governments in terms of how they've incorporated technology into their national frameworks, and their health sector is not left behind in this development. I was listening to one of the reps who was speaking on behalf of the Minister of Health at some point, and he was saying, you know, in Estonia, when you're born, before you have a name, you have a digital ID, right? And that digital ID is connected to everything, you know, your birth certificates, your vaccine records, your driver's license, and everything. And I think Estonia really it's a really good example, because the reason for their development was they realized that they didn't have the money to fund the bureaucracy that could have been maybe a paper system and stuff. So they recognized early, and they have been, in the last 20, 30 years, building all the infrastructure and putting in place the policies and human resource capacity that they have today. So for other countries or listeners who work in settings where we say, look, we just can't, we're just too far behind, I think that we can take lessons from history. Have a national plan, a strategy, have a district plan. If you work in a facility or something, have an institutional plan, then start small. You're not going to break through. Sorry, I forgot to put my phone as being interrupted by digital. So you're not going to have, you won't have all the resources at once. So start small. You can digitize a unit, you can scale this up to another unit, you can include institutions, you can include geographic areas. I think a third thing that I would say lower resource settings or settings that are behind can use is to leverage open source, right? So there's a lot of technology today that is open source, is available to use, and you can, there are no restrictions as far as you cite or as far as you inform the creators. Seek also twinning opportunities and partnerships, right? There's a lot of, we've seen a lot of, especially in the areas of learning and providing actually some of the infrastructure. we've seen Facebook or Google moving into lower resource settings, providing some free opportunities for learners. You can think about, I think I saw one time a program like, I don't know, the $10 laptop, something like this. And there are some initiatives that countries and settings can use to actually break this and try to bridge the gap whilst the being. Thank you.
Thank you very much. I really like the point about the fact that we can start small and that there are free opportunities that it is just one search away. And I think this is quite important, not only if we look from the government perspective, but also for youth, because, well, most of the participants here are youth, and many of us are interested in digital health innovations. And I think it is important to point out that opportunities are all, like I say, one search away. We just need to look more about it, and we can start small and help the government. And I also would like to reiterate the point that you mentioned about the importance of having a national plan and national structure in order to also implement digital health applications into health systems and the overall governance systems like Estonia, which I think is a very successful story, like you mentioned. And for that, I would like to ask Dr. Ronald Mora, which I believe that national plan is very important, but at the same time, it is important to also consider localization, such as their capacity, their infrastructure, as well as their needs of each country. So based on your experience with the WA and WAHIS, does localization help in terms of adoption of digital health services in different countries? Because I know, like you mentioned in the presentation, WAHIS is adopted globally. And so how did your organization overcome the infrastructure difference between the countries?
Thank you, Adriana. This is an interesting question, which allows me to better portray the status of the development of this application. WAHIS is a very complex system that allows for consultation of this array of elements of information. Our idea is to start working on the platform, the mobile platform, starting next year. It's very complex because simplifying is very complex. When you have all of this data in devices to target, like you well mentioned, this there's a plethora of options to paths to follow. So you really have to start by defining priorities and see where to go. Now, localization is interesting because we usually speak of globalization. And a few years ago, we only spoke of going global. Well, now we're global. And sometimes we turn back and we say, you know what? Sometimes we need to be local, you know? So we need to target people, to target regions, target countries and communities according to their needs. The WAHIS Alerts app is a good example because we have managed to make it so simple and to adapt it. But we will, I'm saying this, we don't have the app yet, but our plans is to adapt it because we acknowledge that although 90% of the population of the world right now has a smartphone probably in their hands at this very moment as we speak, we do know that there's an important gap in terms of access to the internet, speed of this connection, stability of this connection, but also on the power, the processing power of the actual device. And we acknowledge that we can put many beautiful things and graphics and, you know, nice looking things, but they're very resource demanding. So the challenge here is to come up with a solution that gives you the information in a very concise manner without overloading in terms of resources your device. And this has required a lot of discussion in terms of, again, what information do we really need? What do people really need to see? If they want to hold like all of the details, they can go to the website and consult all the information. It's there, everything's there. But the mobile app, in our case, should actually target these differences. You know, somebody having a coffee right now in San Francisco in the US has probably a very different reality than like a 10-year-old kid struggling to watch YouTube videos in a developing country. You know, it's a different reality we need to address. And this is a very complex arena. Developing apps is today it's easier than ever. Like all the young people that are looking at us and that will probably witness this this conference later when we post on YouTube will actually have the chance to acknowledge that the resources are there. They know they were born and with no previous knowledge, you can learn to code an app today. And this is amazing to me. Like I've been close to technology for too long, and I've witnessed this progress in technology, the availability of technology, and this is just impressive to me. It never stops surprising me. So I believe targeting people, communities, and countries, it's a must. You really have to think on the purpose of what you're doing and the conditions surrounding the information you want to provide, targeting to the reality of these people. And in our particular case, the devices they're using. Because if we don't do that, we'll probably end up by stratifying the access to the information again, and only few people will have the access to the information that you probably intended to provide globally.
Thank you. I think the points you raise are very important, and I can summarize some very important points for our hackathon participants, which I believe some of them are participating in this very webinar. So I think he raised a very important point that there needs to be a certain target while making such an intervention, and for that we need to assess based on localization, but at the same time, of course, we also need to consider globalization. I think I really like the exact wording of what you say, like globalization is needed, what we need to be local to. I think that is what should be beared in mind by youth when making an intervention, and if we want to advocate for more adoption for digital health in our health systems. So I also have a follow-up question for you, Dr. Ronald, and that is, based on your experience, how important is collaboration with other healthcare sectors? Maybe does WAHIS have any collaboration with, for example, medicine or environmental health?
Yeah, this is an amazing point. And it wouldn't have been fair to speak about all of this without targeting this particular element. When we work in no matter which solution, we just cannot do it alone. You know, I think the pandemic, the recent challenges of the world have set the stage to clearly see that isolating yourself and doing no matter what you do, in isolating yourself will have just one result. There's a bias. There's a big bias of life. You will think one way and you will do it that particular way. Now, bringing others into the game will not only allow you to see the big picture, but also give you tools to question what you're doing. And I think this is critical because, of course, we always speak about, you know, bringing people, stakeholders, and consulting people. This is important, but you really need to challenge yourself to defy what you have done and to improve it. And again, this probably implies there's a very complex thought process going on, but the more you are aware of it, the best you will deal with it. I guess the WISE mobile alert app will be a tool to have the immediate access to information, and this is really powerful. This is coming from a variety of sources. The information notified to the organization comes from members that actually notify through official means to the organization a situation, something going on with the animals in their countries, in particular disease events. But also we have strategically managed to create alliances with the other main players in terms of global health in the world. And of course, there's WHO, and we have FAO, which we can not leave aside in all of what concerns food and feed for animals and people. And then we have a new player that joined not so long ago, and it's the United Nations Environmental Program. It's the UNEP. And so that before we used to call this particular triad of players the tripartite, now we just turned it to quadripartite, because now we acknowledged, like officially acknowledged, that the environment has an important role to play. And while we consult and we interact with these players in many different fronts, their inputs are evidence in the mobile app as well.
Thank you very much. I think it's very interesting that you mentioned about the collaboration between not only UN bodies. I think you mentioned UNEP, FAO, WHO, and also WA. I would like to ask if you have an experience of also seeing that collaboration between sectors in either national programs or regional programs? And
Yes.
perhaps, is there any challenges while approaching that collaboration on digitalization?
So yeah, I guess there's a need to mention resources. We always think of money. When we have an idea in mind, we always think of materializing this idea, and this usually, most of the times, involve the need of resources. So I would say the challenge is not the lack of resources, because there are resources, and we all know that. The world has a very unequal distribution of the resources. And when I say resources, I don't only mean money. We have countries very rich in environmental health, while many rich countries that they just don't have enough biodiversity, for example. So it's a very complex scene to describe, but in terms of regional cooperation and the challenges they face, I think the main point to raise here would be that people usually don't understand very well the needs across a region. In we have seen this time and again. We have witnessed situations where funds have been granted, project has been started, and you see how the different players, when speaking of a regional context, the progress is not even, it's not equal. So the distribution of these resources is not equal. So many times organizations start making decisions, because based on this output, the progress of the outcome of the project you proposed and the resources available, you don't really get what you expected. And I think the origin of this lies all in the planning stage. So you plan and you foresee for things to happen that would probably not occur. And this is the problem. The less we know the vision, the less the realities applied to this particular vision of what you will get at the end of this particular intervention, the less successful it will be, for sure. So I guess one of the main challenges is acknowledging your peers, acknowledging their realities, your own challenges, and then of course there's a whole strategy to try to tackle those, to find the best way to target, and not to be very ambitious, just target specific points and follow through to get them done. But follow up is important as well, and the continuation of the intervention is important. So I guess this is part of the elements that in the context of regional intervention should be certainly taken into consideration.
Thank you. I think that in identifying resources, like you mentioned, it's very important, and also knowing what the region really needs. It's very important to recognize that there needs to be adequate education about it. From what I know, healthcare workers are all saying, like you mentioned, jargons like, okay, we need to revolutionize healthcare with digital health. But not all of us really know what digital health is and what should actually be considered in order to fully reap the potential for digital health. And so I would like to ask Dr. Onyema, so some of your research works focus on digital education for healthcare workers. Is there a one way fits all for digital health education globally? And I would also like to ask if there is a need for professional certification in digital health, and whether it should be mandatory for healthcare workers.
Thank you, Adriana. This is another very good question, and one is easy to answer, the other not so much. But if there were one way fits all, I don't think so. It's the way we're at the place now with technology and extending to digital health worker education, that you need to consider factors like the level of digital maturity of the setting, right? Many countries at various stages, and within countries you have also a variety of user profiles, if you allow me to describe the health workers like this, or even the educators, right? Because it's not just the health worker who needs to get familiar with the technology. The educator also needs to understand, right? And when we think about technology in WHO, we see technology and digital as an enabler, right? So it does not erode the core principles of education. It does not erode the tenets of health, access, quality, all these kind of things. Instead, we see it as a road run, as something on which you can build or you can facilitate, right? So within the level of digital maturity, we can also talk about the digital divide, right? Who has access to what bandwidth, when I was mentioning, the access to data, what capacity can your phone and your tool deal with? You need to talk about this. Also, something that we're now doing at WHO, which it is still, it's a black box in this field, is the evidence of what works or not. We are an evidence organization, and we're constantly looking for ways to optimize what each user, each setting, each country is able to do. Just because virtual reality works in Iceland or Oceania does not necessarily mean that the same thing will work in India or in Australia, right? You need to really, we as a research body and calling youth and everyone who's interested in the field needs to build the research around what works and for who. right? What's what impacts the most amount of learning, right? M-Health, E-Health, blah, 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 you can go on and on. So there is no, I mean, I didn't even talk about the gender and social cultural factors that you can find across settings. So basically, there's no one size fits all. Should professional certification be mandated? My quick short answer is yes, but then again, this is highly debatable, right? Because a lot of the time, health workers are resistant to, once you say mandatory anything, there's like always a kick or something. But if we realize that we're talking about health and wellness, right? We need to, thank you, sir. Around, yes, we need to certify. We need to certify our workers. We need to certify technology where we can. We need to check misinformation management, what we're taking in and what we're using, what our health workers have access to. Regulators need to get to grasp these things in countries. Thank you.
Thank you very much. So I think we're running over time a bit, so I apologize to the panelists for this. So before we end the session, I think we've learned a lot about what are required in order for digital health interventions to be applied to its fullest potential. But now we are, as youth, we are curious as to how we can contribute in digital health innovations, especially in terms of advancing planetary health. What skill sets do we need, and how can we better collaborate with each other? What skills that is required to collaborate? I think we can start with Dr. Ronald first.
Thank you, Joanna. Well, we all know technical skills are needed. I think this is the default thought. We always think we need to be smart. We need to have a lot of technical background, diplomas, and But frankly, if you see, the most successful people in the world never exceeded these expectations. Never. What they did is that they focused on an idea and they pursued this idea until the end. I think all of these skills that we think of, they're needed. They're important, I would say. I would encourage people to train as much as they can. But there's this skill set that you need to have, because being smart and being knowledgeable is not enough. You really need to be talented in other areas, such as all of the soft skills you really need to master. Like you want to sell your idea, you need to know how to sell yourself, how to be nice, how to transmit your idea in a clear way, how to network with other people, how to reach other people so that they can believe in what you're doing. So I think we have to think of this as skills you need for life. I would say there's a skill set that really goes beyond, and it's easy to recognize these people. These are exceptional people that are always put a smile on their face. You like being around these people. They're people nice to be with, and you don't really care if they're very well educated or not. These people just become nice naturally. Well, these are the skills that we need. We need to, in this modern world, in planetary health, it's not the exception. We need to reach out on the other human health need to reach out on animal health. Animal health need to reach out on environmental health, and all these elements need to be brought together, and it's people making the difference. So getting closer to others, I think reaching out on people, networking, as I said before, acknowledging the reality of other people, like trying to understand where they come from, what they do, showing some genuine interest in what they do. And I think patience, perseverance, and all of these skills that will actually make you have something concise to share of value, some meaningful things to share. I think this is what you need to pursue over the rest of the technical skills.
Thank you very much, Doctor. I think it's very nice that you are emphasizing on the soft skills, and I believe it's very important to network and collaborate with everyone else. So, Dr. Onyema, would you like to add something before we close the session?
Yeah, thank you. I would just say, I mean, for youths, the biggest thing you have is your mindset, right? You are the millennials generations, the so-called digital natives, and even the coming alpha generation. It's your mindset you're born into. You don't need to think of technology as something that is weak. This is something that is just around you. So take advantage of it. Take advantage of opportunities for interprofessional education and also multi-sectoral interaction. Although this is more for educators and policymakers, but many of you here are in leadership positions, and you can take this back to your dean. You can take this back to your member of parliament in the community to say, what are you doing about this? Strengthen your advocacy for these subjects, and then finally join the research bandwagon. Be deliberate in seeking out how some of these how technology can work across this complex layer of actors, people, and sectors. Crack the code and publish and share your findings. I think these are the words that I have for you as youths.
Thank you very much. I think it's very important that us as digital natives take advantage of it, like you mentioned. And hopefully we will be able to innovate not only in the field of digital health, but also in the overall field of planetary health and One Health with our unique mindset, like you mentioned. So thank you very much, Dr. Ronald Mora and Dr. Onyema Ajebor, for the opportunity to discuss about digital health applications and devices with you in this panel. I apologize once again for running over time to both you panelists and also the participants, but hopefully there are some values and points that can be taken and help participants embark in their journey in digital health. Thank you very much once again, and we look forward to collaborating with you again in the near future.
Thank you.
Thank you.
Thank you very much. So now we have finished our session for today, but please stay tuned because we're having the networking session after the supposedly 30 minutes, but now there's only 20 minutes break for that. So please stay tuned. Bear with us as we will be back with a very important and interesting networking session with people globally. See you, and once again, see you in 20 minutes.
Health and care workers. They protect us when we need it most. When our world shuts down, they go to work. They fight for the lives of our loved ones and comfort them when we can't. Day after day, often without proper protective equipment, despite fear and fatigue, and against overwhelming odds. They never asked to be heroes, but the efforts we applaud are heroic. Health and care workers have died by the thousands protecting us from COVID-19. So applause without action just isn't good enough anymore. Now, it's our turn to protect them. Too many are underpaid and overworked, without the resources to do their jobs safely. Too many face stress, trauma, and burnout without adequate mental health support. Most health and care workers are women, but few are in positions of leadership. All of this needs to change. Now, more than ever, we need to invest in skills, education, and decent jobs, in safe working conditions, and in policies that retain health workers, protect their rights, and support gender equality. This investment can heal our societies and rebuild our economies. But it's an investment that requires all of us, together, across sectors, professions, and politics. The time to act is now. Invest in health systems. But most of all, invest in the people who are the world's health and care workers.
does health mean to you? For many people, it is the foundation to do the things in life they love, to enjoy the company of others, to work, to play, to learn, to laugh. Health is life. So many people have lost their health in the past year, but they have lost so much more: their jobs, their ability to see their families, to travel, to live life. And more than 2.7 million of our sisters and brothers have lost their lives, and we have lost them. The hard truth is that some of those people died simply because they could not get the care they needed, because of where they live or how much they earn. Inequality is not a new problem, but COVID-19 has brought it into sharp focus. The pandemic has pushed an estimated 120 million people into extreme poverty. It has significantly increased gender inequalities, with more women than men leaving the labor force. And as we speak, rich countries are vaccinating their populations while the world's poor watch and wait. Health inequalities are not just unfair, they make the world less safe and less sustainable. So, as they build back from COVID-19, it's vital for all governments to invest in better health services and remove the barriers that prevent so many people from using them, so more people have the chance to live healthy lives. This World Health Day, we're calling on you to use your voice and your vote for a fairer, healthier world.
One year ago, world leaders launched a global solution to rapidly end the pandemic and equip countries to fight this devastating virus. The ACT Accelerator has secured more than 60 million COVID-19 tests, over $500 million worth of equipment to keep health workers safe, and nearly 3 million doses of the proven COVID-19 treatment, dexamethasone. COVAX has delivered more than 40 million vaccines to over 100 countries and economies, and ACT Accelerator-supported research continues to find the next generation of tools. But the pandemic isn't over. Societies and economies are still suffering. Our safety and security is still at risk. And history is still in the making. It's time to recommit to act together. Let's take research, production, and distribution up a gear to keep everyone, everywhere, safe from COVID-19.
Health workers. They're more powerful than you think. They're on the ground, on call, and on hand, behind curtains and inside labs, from the very start to the very end, preventing illness, defeating disease, and saving lives. Every second is spent fighting the unpredictable and defending against the unimaginable, wherever they are, from dawn till dawn. But their power doesn't stop there. They get people back on their feet and back to work. They keep businesses succeeding and economies growing. The health sector is the fastest growing source of jobs and will keep the world moving towards the Sustainable Development Goals. But to unlock their true power, we must act now. As populations grow and change, the world is facing a shortfall of 18 million health workers by 2030. In March 2016, the United Nations Secretary General appointed the High-Level Commission on health employment and economic growth to create a plan. We need to invest in education and jobs to tackle countries' changing needs. We need political support and bold policies with cooperation nationally and internationally. And we need to see health workers no longer as a cost, but as an investment in a healthier, fairer, and more prosperous future. It's time to transform the global health workforce by making greater investments to stimulate job creation, addressing gender inequality and maximizing the participation of women in healthcare, expanding and improving education and lifelong training by focusing on skills, pushing health services towards achieving universal health coverage by focusing on people, not diseases, integrating new technologies into the education and practice of health workers, equipping health workers to respond effectively to emergencies and ensuring their safety, raising adequate funding from multiple sources to build the health workforce, cooperating across countries and sectors to ensure the global supply of health workers grows sustainably, guaranteeing that when health workers migrate, it benefits the countries they come from and the ones they go to, and that their rights are protected. And collecting better data, measuring results, and making everybody accountable for action. Together, we can unleash the power of health workers. It's an opportunity we can't afford to miss.
In the darkness, I thought I would never see light again.
My heart stopped. A lifetime of risks that could have been avoided.
In my time, I have seen too much sadness. My mother, my brother, my son, one by one they fell sick, and they were all gone. But I am here. I have survived. I'm here to give people the best care that I can.
Today I get a second chance. Today is the day my life begins.
I will be there for this child and care for her as she grows.
I will do all within my powers to help my little girl make healthy choices.
I will join the fight. I will spread the word, making sure we are prepared and strong. I can see things starting to change. There are still many challenges, but I know I'm making a difference.
I will teach my daughter to treasure life. And I will be there.
Today, I have hope. There will be light again. I am 1 in a billion.
I am 1 in a billion.
I am 1 in a billion. Imagine a billion more.
health workers. They're more powerful than you think.
All right, thank you so much for your patience, everyone. And hello again to everybody who's attending our session, and welcome to our session on digital science in advancing public and planetary health. My name is Elaine, and I will be moderating this session today. In this session, we will discuss the application of data science in public and planetary health, current gaps, and future opportunities in data science. Data science or big data has become increasingly essential in public or planetary health because it provides valuable information based on large amount of complex data collection. And besides, this data are transformed into intelligence-driven information for action, particularly in public and planetary health data analysis and policy making. Most importantly, data science also helps us to better identify, respond, and recover from health emergencies. Today, in this session, we invited 3 amazing speakers with us. And first of all, we have Alia. And Alia is from Indonesia, and she's a faculty member in the Biomedical Engineering Department at Institute Technology, Bandung, Indonesia. She's the co-chair of IEEE site on e-health and telemedicine Indonesia. She has a multidisciplinary background as she obtained an undergraduate degree in electrical engineering, a double degree master's in biomedical engineering, and a PhD in strategic management from University Bocconi in Italy. Her current projects focus on community-based health for mother and child nutrition and assistive technologies. She also works on developing non-invasive measure devices for glucose and other blood chemical parameters. And with this, Alia, would you mind saying hello to everyone? Hello, everyone. Yeah, I can see you're very excited for our session, and me too. So without further ado, let me introduce our second speaker for the session, and he's Brian. Brian is the Scientific Community Manager for the International Digital Health and AI Research Collaborative. Besides, he's also the Regional Youth Champion for the Lancet and Financial Times Commission on Governing Health Futures 2030. Besides, he's also currently serving as the steering committees for the EU-PHA Digital Health Section and the WHO Youth Councils. He holds a bachelor degree in biomedical science at University of Ottawa, a master's degree in epidemiology from London School of Hygiene and Tropical Medicine, and currently he's pursuing a PhD in public health workforce development at Maastricht University. And Brian, would you say hello to everyone?
Everyone, great to be here.
Yes, cool. And thank you so much, Brian, for coming to the session. And we have a third speaker, and she's Robin. Robin is an assistant professor at University of Minnesota School of Nursing, where she directs the Center of Nursing Informatics and coordinates the NDP Informatics specialty. Dr. Austin has over 20 years of clinical healthcare experience and has translated this experience to focus on patient-centered research. Dr. Austin integrates also her clinical background with informatics and data science to represent the patient's perspective across the healthcare continuum. And her expertise now is in consumer and clinical informatics with large data sets and data science methods to examine social determinants of health and resilience. And welcome, Robin.
Hi, thank you. Glad to be here.
Yes, thank you so much. And after the introduction of the speakers, and today's flow will be the presentations from our speakers. Each of them will have a presentation of 5 to 10 minutes, and you will get to know what are the amazing work they are doing behind data science. And then we'll proceed to the panel discussion. Will last for around 20 minutes. And at any point that you want to raise any questions, you are free to send in your questions in the chat, and the speakers will answer them soon. And without further ado, let me introduce our presenter for this session, and we'll have Robin. And welcome.
Great, thank you. I will share my screen here.
Yeah, sure.
Great. Assuming everything's working okay. Thank you again for the invitation and the warm welcome. I'm really thrilled to be here and to be able to share our work, that what we've been doing over the last few years. And I think that this is an exact time frame where we're actually really starting to understand the value of public health and planetary health, and that the two shall not be separate anymore, so to speak. That really, how do we integrate these? Because you can't have one without the other, as we now know. So I'll get into sharing some of our work. And also, I think I also laid out some next steps that would be really, I think, helpful. And as we kind of think of how do we move forward with combining this work on a global scale. So this is just a slide to kind of ground us in kind of what we were talking about, or where my perspective really comes from as well. So I come from a background, I'm a nurse by background. So I kind of always have that nursing clinical lens on how do we care for patients, families, and communities better and make their lives healthier, and looking at preventative measures. But in addition to that, I've had a lot of training in health informatics. And so for me, how do we use technology to better and improve patients and families, and really also now moving to that community perspective. We've done a lot of community work. But in addition to, on top of that, even is really our environmental and population health data. So really, to me, all of that equals whole person health and what we're calling whole person health. So that includes the environmental factors, psychosocial, or our family connections, mental health, our physiological health, but also our health behaviors as well. So it's taking all of these pieces in addition to layering that with our environmental data, and really how do we then forecast or potentially look very, very upstream at really making sure our what we can do to mitigate some health challenges, but then also to look at predicting or preventing them as well. I'm also interested in using digital health tools such as mobile health apps, trackers, and sensors. I think are going to be becoming much, much more influenced in our healthcare environment. We've seen a huge increase because of COVID. But really, I think, how do we make that more seamless, and also where it's almost a passive kind of tracking, where we constantly have the data coming in, but it allows us to really capture data anywhere at any time. We've also realized that a lot of care, or what happens, or health-wise, happens outside of a clinical environment. And so how do we capture that kind of data and bring it into the clinical world to really have that whole person picture of the patient? And really, the last bullet point is really understanding that it's transdisciplinary data, and it's not just clinical data. It's not just environmental data or public health data, but really it's all of these disciplines really coming together to bring that whole person perspective to, again, improve the lives of families, patients, and our communities where we live. Okay, great. So our work that we've done is myself and my colleague, Dr. Karen Munson, in 2017 created an app that was what we call a consumer-facing app. So it's really for patients to really identify their own, what we're calling strengths, also their health challenges, but their health needs. And so it's an opportunity for, and we created this app in consumer-facing language, meaning it's at a readability level that's accessible for all. We wanted it to be around the 5th grade or grade 5 reading level, but really understanding individuals' perspectives of what they consider our health challenges, but also being able to identify their needs. And we really wanted to include that strengths perspective and kind of shifting that paradigm from disease and deficit perspective to really understanding that it is a strengths and resilience component that we have in health and healthcare as well. So we're using the data that we have that we've been collecting from this app called My Strengths, My Health, which is a whole person health perspective, using machine learning techniques now, and really looking at what are some of these data-driven whole person health insights that we can glean from this data that is, again, it's patient-generated or consumer-generated is what we're calling it, but it has that flair of that we do want to look at the strengths and resilience component, and how can we use that to leverage or maybe mitigate some health challenges that individuals have identified as well. This last slide is really, it's from the Center for Disease Control, and it's really looking at the impact of climate change on human health. And some of you may have seen this already, but it's just kind of this wheel of understanding of really what is happening when we talk about air pollution, the extreme heat here in the US right now. The western part of our nation is really experiencing some extreme heats. And really causing some serious havoc with our health-related illnesses, and also for kids in school right now, they're having to either cut their days short or cancel school altogether. But I kind of put these other buckets around this image just to look at what are some possibilities of maybe data insights that we could glean. So for example, the changes in vector ecology and looking at malaria and some other diseases. Lyme disease is very prevalent where I live in the northern part of the US, but really that we have the ability to have real-time tracking and reporting, and that sharing the data across the systems is really, I think, one of the bigger challenges that we do have. But then really looking at data science methods and how do we then predict future outbreaks and predict some outcomes around these. But then looking again at respiratory allergies, being able to have real-time environmental air quality data and maybe tracking the patients or tracking their daily inhaler use, really being able to understand trends in asthma symptoms for adults and kids, but then maybe having a dashboard. I know there are some cities working on a dashboard idea for being able to understand the air quality and maybe not going outside, or what are the peak times that you should exercise, or for elderly, maybe don't go outside at these specific times due to the air quality. Just trying to put, again, just some ideas of how do we then marry these other sets of data together to better improve and understand the impacts of these health, what's the climate on our health. I really wanted to spend some time on this last slide, is really understanding what our next steps are. And so currently right now, because we have so many varying sources of data, is that we need to have the ability to integrate this data, which making it shareable and comparable. And so we currently have varying sources of data that are not standardized. And so, for example, we use the Fahrenheit system, which is not consistent with other parts of the world. And so how do we standardize, for example, temperature readings? How do we standardize other air quality readings? Really to be able to have that data that is cross-disciplinary, but really able to be analyzed across different platforms and across health systems and across different segments of the industry. Also, I think looking at more of this work is what we're calling planetary health informatics, or data science and planetary health. We really need to have some guiding principles around this work because there are so many ethical and social challenges. So for example, data privacy is a huge concern, and who has access to that data? Are they sharing that data, and with whom? Right now, mobile health app data seems to be kind of very little standardization and very little principles, and that's a huge concern as developers may be sharing or selling third-party data. So that's just a big concern that we have. But also digital and health literacy is another concern, is that the health literacy and readability levels of some of these tools and technology may not be accessible for all. And so when we look at some of these social and ethical challenges, there is an equity aspect that we have to consider and really have as guiding principles for this work to make sure that we are, again, that this work is encompassing for all and not just a select few. Lastly, I think because this is a global concern, how do we have a unifying planetary health informatics agenda and also education to follow that as well? So for example, what is being educated in the US should be educated in the EU and across all countries, I believe, as well. So really, how do we generate this unifying agenda that we have a common set of goals that are sustainable and also acceptable for all, I think, as well. So those are my thinking of not only the work that we're doing, but how do we make this going forward where we really have that lens of equity, that it is informative and accessible for all, but really also sustainable. We've seen so many, I think, initiatives come and go, that this one really needs to have some thoughtful and intention behind it in order to really prove useful and I think successful for what we need, especially around global climate change and health. So with that, I think that was about what I had to say. I want to make sure we have enough time for everybody on our panels. Here's my email address, and I have a QR code if you're interested in learning more about My Strengths, My Health, and just a few examples of some of the publications that we've had regarding some of this work as well that you'd be able to find out on the internet. So I really appreciate your time, and I look forward to hearing from the other speakers and our panel discussion at the end. Thank you, I appreciate it.
Thank you so much, Robin. And it's inspiring to know, like, what is your work about data science? Next, we'll have Alia to share her presentation with us. And thank you so much. I hope, Alia, you will bring us amazing presentation. Thank you so much, Robin, again. Yes, Alia, please, the floor is yours.
Thank you, Elaine. Let me share my screen. Okay, can you see my screen?
Yes, yes,
is this okay?
I can.
Okay. Okay, thank you, Elaine. Thank you, everyone. Thank you for the opportunity to speak in this forum. I hope that my little corner of the world, that is my experience in the fast world of data science, would be useful for you all in advancing public and planetary health. So I've been listening in and out of the sessions earlier today, and I'm really inspired by the earnestness and effort and accomplishments that you all have shown. And so far, I hope to both learn as well as contribute a bit to you. So my name is Alia Kusuma. So I'm a biomedical engineer and management scholar by training, as Elaine has highlighted. Currently, I'm a faculty member in Institute Technology Bandung in the biomedical engineering. Yes?
I'm sorry to interrupt you, Alia, but the participants are saying the voice is not clear for them. Would you mind? Yeah.
One moment.
I'm sorry for everyone. Please give us a minute.
Is my voice clear now?
Yes, very clear.
Yes, very
clear. You can
Okay.
proceed. Thank you so much. Yes.
No worries. So yeah, I'm a biomedical engineer and management scholar by training, so I have a bit of both. And currently, I'm the faculty member in the biomedical engineering program in Institute of Technology Bandung. But I'm also a co-chair in the IEEE, which is the professional organization for electrical engineers. We have a special interest group on humanitarian technologies, and we focus on e-health and telemedicine. And I am also a member in the Indonesian e-health and telemedicine society. So you may be able to guess that my work centers on the intersection between digital technologies and health. Specifically, I work in e-health on mother and child health in Indonesia. This is still a very key health issues in Indonesia. So we still have a pretty high number of stunting in children, and also maternal health and chronically low energy. So we have still a lot of issues, even though we're working on it. And it's also an issue where data science can really play a role to transform the service and the health outcomes. So my first takeaway for anyone who's looking for a chance to contribute is find a health cause, find something important, something urgent, or something that's near and dear to you. And just start. And then you may wonder why there are a picture of two ladies here, not just one. So this is me and my mother. My mother is a medical doctor, and we do most of our work together. So my inspiration is my mom. So the second takeaway, do transdisciplinary work. I hear this echoed a lot earlier in the other sessions, but really get to know engineers, get to know data scientists, social scientists, meteorologists, environmental scientists, artists, get to know everyone, because everyone can play a role in public health, planetary health, and data science in it. So you can also learn a different field. At my school, we are currently preparing a program that integrates medical and engineering education. So together with our sister university, who is very strong in medical education, we're preparing both a master's program and as well as an undergraduate program that both engineers and medical doctors can work together. In fact, my mom got her master's and PhD in biomedical engineering after being a housewife for 20 years. So as youth, you can definitely learn data science. We work a lot also with primary healthcare providers and midwives and volunteer mothers who are really the spearhead of mother and child community healthcare in Indonesia. So the next takeaway here, as we work, we really realize that building both health and data or technology literacy in the healthcare community, as well as in the general community, so the patients, the community, is key for both buy-in and sustainable implementation. And also that the bottom-up approach is at least as important as the top-down approach. For example, integrating and standardizing data and everything can be useless or not sustainable if it's not supported from the ground up. This is sort of a portfolio of our group's work. So first on the left here, you can see the digital and data science innovations. So we have Sahabat Bundaku, which means my mom's best friend. We implement this in one of the cities in Indonesia, and it is a mobile app that connects mothers and midwives for recording and reporting, as well as early detection of stunting and low birth weight. And then we have an app that focuses on nutrition for children, as well as immunization. So these are integrated. But as we work, we also realize that digital solutions alone are not enough. So to integrate buy-in, we actually have many educational tools that are non-digital. So like board games, some with QR codes, some would not, but these integrated work together. In terms of data science, we are also starting to integrate non-invasive IoT measuring devices for parameters that are important for mother and child health. So for example, blood sugar monitoring, hemoglobin monitoring, as well as HbA1c. We are also starting to implement machine learning for stunting and low birth weight prediction. And we use very simple data because we implement it in free maternal health clinics. So it's not like a very advanced hospital, but it's free for people who cannot afford healthcare in Indonesia. So the final takeaway here, it's an ecosystem. Data science cannot stand on its own. I think Robin has highlighted this. It requires a strong infrastructure data that is usually still very difficult to obtain in sufficient quantity, quality, and importantly, interoperability. This is difficult for just health data, especially if you're thinking now of combining health data with other disciplinary data. So for example, weather data, other climate and observational data. So to close, what can us or you as youth do, especially on resource-limited settings? We know of at least these three problems. The first is data availability and standardization. Second, systems and infrastructure and regulation. And third, the people itself, the human resources. So among other things, youth can contribute first by educating and reskilling yourself. Even if it's not, for example, in your curriculum, there are now many online resources available. And you should be able to find maybe one or two, at least faculty members who are sympathetic to your cause. And they can help start by holding seminars or maybe summer schools or electives modules as a first step. Second, initiate interdisciplinary cooperations. Sometimes more senior doctors, engineers, or other actors are kind of already entrenched in the system. So it's difficult for them to change in some sense. It is, as youth, even if it's difficult, you can be the change makers. So avoid having entrenched silos. So start working with other people in other fields. Finally, get to know which issues you are most passionate with. So, and get involved. Okay, thank you. So this is my email. You can reach me in this email, and I'm really looking forward for the discussion today. Elaine, I'll leave it back to you. Thank you.
Thank you so much, Alia. And I really agree, like in advancing data science, like not just equip ourselves with like data science knowledge, but also to encourage intersectoral collaborations like between different backgrounds and different disciplines. And for now, we have a presentation from our third speaker today, and he's Brian. And Brian, the floor is yours. And Catherine, would you mind sharing slides for Brian? Thank you. So Brian, the floor is yours.
Great. Thanks, Elaine. Hopefully you can hear me okay. So
Yes.
Thanks to the speakers before me. I think you've had a great overview from Robin and Ali of data science and what youth, particularly in low and middle income countries, can do. I'd like to change gears a bit and look more high level at the international cooperation level. So I'll take the liberty to introduce our work as IDARE, the International Digital Health and AI Research Collaborative, speak a bit to how we're working towards more sustainable and inclusive future of public health to address these gaps, and particularly on the human resources and capacity building front, as Alia mentioned with. Next slide. So IDARE, we're a multi-stakeholder platform based in Geneva for enabling global research collaborations on digital health and convening stakeholders to develop global public goods, which are aimed at solving issues around the inclusive, equitable, and responsible deployment of data and AI for health. Our mission is to transform personal and public health through collaborative research and development of digital technologies. So we really strive to facilitate cutting-edge research on digital health and AI for health through the development of a distributed research infrastructure. We believe we meet this urgent need to level the playing field and take advantage of this digital revolution that we're in order to support the collaborative development of health solutions that benefit all communities and countries. So our work is really rooted in multilateralism, health, and science collaboration. You heard about transdisciplinarity earlier, and all in this belief that value derived from advancing technologies is greatest when they are inclusive. Next slide. So here's our team, and we're based all around the world, as you can see. Next slide. So we've identified a bunch of areas of scientific exploration, which we call pathfinders. And these have been chosen based on extensive consultations to prioritize to better support the digital transformation of health systems, to provide end-to-end enabling of digital health, as well as assist in developing policy responses to ensure equitable, impactful, and ethical use of new technologies, including data science. Next slide. So here's our network of hubs. As I mentioned, we work on a distributed structure, so kind of like CERN, but with hubs all around the world. We're currently established in Geneva, Johannesburg, Nairobi, New Delhi, Santiago de Chile, Singapore, and Tunisia. And we've got a bunch of other IDARE affiliated research centers with the hopes of other centers and locations to develop over time to create this expanded network of research and innovation centers. Next slide. So we've got an international network of 45 plus partners, and we really prioritize the involvement of the Global South in striving to foster access to cutting edge research on digital health and AI for health through that distributed infrastructure. And one of these partners is WHO, who we just signed an MOU with recently, and I'll speak a bit more to that collaboration. Next slide. So changing gears and more to the capacity development front, capacity development for digital health and AI has historically been really fragmented with piecemeal training focused on specific technology solutions or single topics without really integrating other necessary skills and knowledge. But we've seen momentum building for capacity for digital health in LMICs with the COVID-19 pandemic putting a really harsh spotlight on these gaps. And there's also increasing recognition of and demand for data analytics, AI, and governance. Yet training is at a really nascent stage, and of the options that are available, very few focus specifically on the health sector. Moreover, conventional training is insufficient. Adult professionals learn best with hands-on practical opportunities to cement their skills and access coaches, mentor, and peer networks as sources for reality checks, guidance, lessons from the real world, and personal and professional growth. So in this Pathfinder research area, we're really focusing on the capacity development for digital health and AI research and transformation for health. So in addition to researchers and innovators, the focus is on training needs of policy and decision makers who are responsible for digital health and AI for health programs and projects. So this effort is really strategically aligned with our work on accessible and low-cost digital infrastructure for clinical researchers interested in transitioning from classical methods to data science and AI use for health R&D. Our trusted research infrastructure and capacity development efforts really help to bridge the distance between the research and practice communities and are embedded within a longer-term transdisciplinary engagement ecosystem where learners not only receive this relevant training, but also have the chance to tinker and develop their own local solutions through our trusted research infrastructure, while also drawing inspiration from the global framework of pathfinders and our consortium of science partners. Next slide. So in line with our vision of this distributed CERN for data and AI, our aim is really to establish a global capacity development network for digital health and AI, which are comprised of the IDEAR hubs and key partners to leverage their faculty expertise, courses, and other educational offerings. So in our concept that target learners, which are researchers, developers, and policy and decision makers, will really be able to engage with any learning opportunity with any member of the consortium, regardless of their geographic location. So we really envision these learning cohorts that include members from different parts of the digital health and AI ecosystem, be it from governmental institutions, so health, ICT, education, finance, or social sector organizations, the private sector and academia, including those early on in their careers. So they'll have varied roles, whether it be developers, data scientists, researchers, managers, policymakers, health professionals, and these diverse cohorts will really be critical to bridge the health and digital communities and address power asymmetries and eventually assure that digital health and AI effectively and holistically empowers the health workforce, improves quality of care, and optimizes health system performance. Next slide. So as I mentioned, this was our target audience. Next slide again. And these are the nodes and partners where we hope to carry out our work. Next slide. So here's as I mentioned, here's our initial focus and scope. And next slide again. So we're going to carry out a phased approach to our target learners, and we're going to start with the in-service workforce because for us they're the low-hanging fruit, and then we'll move on towards phase 3, which is more formal curricula in medical, nursing, pharmacy, and public health and computer science and engineering schools, because that's a much longer road you need to develop, and it'll take longer because that's the end point. So this slide just provides some context on what we mean by a competency framework and kind of the different components required and competencies required. This explains how frameworks are used to help define what training and learning programs are needed when applied to the workforce. Formal education, self-directed. There's assessments, there's credentialing, and workforce development. Next slide. So these are just some draft digital health competency domains of digital health practice, which were developed by WHO Afro and inspired by these. Next slide. We're partnering with WHO to develop a competency framework. So this is our draft competency framework of domains and subdomains. And this is really foundational to our more holistic approach to capacity development, defining the range and depth of skills, knowledge, and attributes across multiple subjects or domains involved in successfully planning, implementing, and sustaining digital health and AI systems. So this will be jointly created and branded as a WHO product in response to WHO's Global Digital Health Strategy, which was released in 2020, and also builds upon the work begun by WHO Afro, as I showed you before. We plan to have a holistic curriculum, which is mapped to this competency framework, with the intent of it being modular and open to enable easier adaptation and adoption by countries and regions at varying levels of maturity. So we're gonna leverage these existing courses and programs, as well as go beyond traditional classroom learnings, and ultimately, next slide, we aim to award certifications and we'll coordinate with professional and accreditation bodies to grant these units recognized at national and global levels. So our hope is that the learning and community and cooperative relationships that are formed within this capacity development network will extend into the real world communities and collaborations and lead to more rapid and responsible digital health and AI transformation for universal health coverage. So I mean, linking back to the public health systems, I'm sure you can see that there's a clear link to public health and planetary health, as a lot of these are the building blocks. You know, this transdisciplinary approach, you know, collaborative working and creativity and practicality. So these are just some of our unique aspects of our approach, and we're currently in the middle of our first year. So we're going to be developing our curriculum and delivering on that next May. We're currently offering a course with tech change for some ministry, some staff in ministries around the world, and we'll keep you, of course, posted with how you can get involved. So I'll leave it at that. Thanks for your attention, and I'd be happy to answer any questions later.
Thank you so much, Brian. And I know, like, for now, we have more questions to come, especially from the youth regarding data science. And some of them, they should me some questions in the chat box already. So I'll be reading that later, but now let's proceed to the panel discussion. And based on the sharing that you have, and I think we have a discussion now about how to equip our healthcare workers right now in advancing the data science. So I have a questions for three of you. Is actually, what are some of the critical issues or gaps in implementing standardized digital education for healthcare workers? And how does this affect the scaling of such technologies? Maybe we can start with Alia. What is your take on this question?
Okay, thanks, Elaine. So I think a critical gap in many countries, at least including in Indonesia, is that it's not yet in the national curriculum. And there is usually a standardized curriculum across the country for medical doctors, for example. So because of this, also awareness in many countries are very low. And if you cannot understand it, then you cannot love it, right? If you don't understand what data science is, there might be resistance, for example, in health workers in implementing it. There might be less trust, or the opposite, blind trust, which is also dangerous. So, okay, the machine says that this is the risk, so I should do this, for example. So both ends of the spectrum is dangerous. So, but there are a lot of push for this. So many institutions are working on it. And the key is to stop working in silos. My own experience is that we are trying to develop exactly this kind of program to have what are the competencies that medical doctors need. We realized that after the pandemic, okay, a lot of the doctors do not understand the data, and a lot of the engineers do not understand the medical part. So we realized really, oh, we have to meet. So in this sense, the pandemic is a boon. So we need to work in silos and build interdisciplinary communities. So this is the other thing, right? There is the formal way, and then there is a lot of informal efforts or semi-formal efforts that are coming up, especially because of the pandemic. Now there are many communities, there are many organizations that go towards the push for having data science for health. So for example, IDAIR, and in my country, there are also many organizations with online workshop meetings. So you get to know not just the sort of hard science of it, but also what are the key issues that you can contribute in. So I think that is for me for now. Thank you.
Yeah, thank you so much, Alia, for mentioning about curriculum. And I think the next one, Robin, you can take the question also, because your experience is more clinical based, and maybe you have more to say about this. So.
Yeah, thank you, Elaine, and great talk for both of our presenters. So this is really a huge issue that's happening right now within, I'm going to go from nursing and nursing schools, so I teach in a school of nursing and I am a nurse. And so from one of our large accrediting bodies, we recently developed some new competency-based learning and objectives. And a big part of that is what they're calling informatics. And so nurses need to understand about informatics and data science. However, so that's great, but at the same time, it's not in every single school, and not every single school teaches it exactly the same way. So we're trying to figure out ways to somewhat have it consistent. So here's the foundational that everybody needs to know. So we're working towards that. It's a really difficult and challenging place to be, but I would agree it's all definitely siloed. Public health teaches it a different way, then nursing teaches it a different way, medical school teaches it, but we also have dental, pharmacy, allied health professions. They're all part of a healthcare team, and they all have to have data science skills, and especially in the environment that we're in today. And we're not going back, we're only going to go forward with our technology. So that's just, I think, trying to get our arms around how do we do this specifically in the School of Nursing and or nursing schools across the US. But then the other part that is a big gap is that we don't have a lot of faculty to teach this type of specialty. So not only, and I'll just say, for example, I know for us in nursing, there's a huge faculty shortage. In the US, there's a huge nursing shortage in general, but just faculty to teach, but then faculty to teach informatics or data science as well is a big issue. And so how do we fill these large gaps in schools that maybe don't have the expertise? And so that's just an ongoing problem. So again, I would agree with upskilling the current workforce, looking at the faculty that are coming on board. There's a lot of, I think, multi-facets that we're going to need to approach to kind of start to fill this gap. And also kind of in a hurry, like it feels like it's, time is of the essence, because these skills are coming fast and furious. And I think industry is moving really quickly ahead. And how do we keep up curriculum with that as well as we train our new workforce and also the current workforce as well. So I'll pause there. Thank you.
Elaine, I'll add a little bit, because one of the solutions for that in our country is that we're starting to work between engineering or data science schools and medical schools, so we both learn from each other. Thank you.
Great point. Yes, and we do have quite a few we're just calling non-nurses in our school as well to fill some of those gaps, public health, AI technology, some of those kinds of things as well. So I would agree with that we have to collaborate.
Okay, sure. Thank you so much, Robin and Alia. And Brian, what is your take on this question?
Yeah, so I'll preface this with 4 A's. So I think, as Alia mentioned, another A, the awareness at the national level and particularly in LMICs is really key to driving this forward. I think access is another one that we haven't really mentioned yet. Being able to have access to these sort of technologies and then the education will be really critical for driving this agenda. The third is accreditation, as Robin has mentioned, developing and standardizing these competency frameworks to then develop curricula, to then train and develop that health workforce, to then have that cyclical function, to then, where you have trainers who can train, the upcoming workforce. And finally is this approach. We need transdisciplinarity to avoid working in silos, particularly in public health. And I think that without these, it becomes really difficult to democratize and scale these technologies for health workers. So I'll leave it at that.
Yes, thank you so much, Brian. And discussing about this, like how can we also make this sustainable, and how can we complete the cycle and capacitate our healthcare worker with all this data science knowledge? And maybe I'll pass the next question to Robin. And it's how do we achieve a more sustainable, inclusive future, especially for public and planetary health using data science?
Yeah, that's a great question, a big one. But I think in order to make it sustainable, I think it has to be, as Brian had mentioned too, it's in part of our accreditation. We have to embed some of these things in a way that it's required, but yet we know it's a necessity. Otherwise, if you don't require it, or it won't get done. I mean, it's all good in theory. And so I think that's part of making it sustainable, is how do we integrate it in our systems where it's just a seamless part of it. It's not an add-on. It's not something over here as a nice to do, but it's just part of our philosophy now. So I think that's one key thing. And I think I can't remember the other part of the question. There's part 2, but I can't remember what it is. I was so focused on the if you could remind me.
Oh, yeah, sure. It's how can we use data science actually to make it more sustainable and more inclusive for, especially in public health and planetary health?
Yeah, so make it more inclusive, I think too, is really that, again, being able to collaborate and partner across disciplines, I think is one of the only ways to really make it inclusive, because you need multiple perspectives. Otherwise we certainly don't want to be tone deaf to when we're looking at some of developing these new technologies. and that it's accessible and inclusive for all, I think is going to be key. And that will be having everybody at the table and making sure that voices are heard, and that that's intentional that way as well. So that's just, I think that's, yeah, I'll stop there.
Yeah, thank you so much, Robin. When we talk about inclusive, and now there's a lot of focus on youth as well, like how can we include youth more? Because like we are the generation that we are using data and all this digitalized technologies like the most. And maybe the next question I pass it to Alia is like, how can we, the youth, actually get more involved and work together to alleviate like some of these problems, adapt to these changes, like for the Planetary.
Okay, thanks, Elaine. So I think first, like educating ourselves are very important. So both sort of formally and technically, but also on the issues that are available. So look for both local and international communities. So international communities like following things that Ida are doing, Brian are doing for learning from each other, so we don't reinvent the wheel and such, but also local communities. So you really look for what are the contextualized issues, how to be inclusive and sensitive to the issues locally and take action, because once you see the problem, then you can sort of like find out, these are the real problem, this is what we can do to start. Because otherwise you can sort of be trapped in like inaction. There is no curriculum, I can't do anything, no one is supporting me. So sometimes we have to help the start. And other than clinical work and maybe public work, I think we also need to think and look at the private sector, because one thing that I see, at least in Indonesia, is because of the pandemic, there is a very high growth of interest in the private sector for data science applications in health. And a lot of the actors are actually from the medical field. I really see sort of like doctors really learning from zero, sort of programming, data science, and I'm really impressed. And I think this is also another avenue that we can pursue. I'll stop this here. Thank you.
Thank you so much. And I have a very last question for this panel, and it's directed to Brian as well. And how is data science progressing towards 2030 universal health coverage goals? This is very much related to this.
Yeah, of course. So, I mean, I think we've seen how UHC really means making quality services available for all and ensuring that people aren't pushed into poverty by health costs, right? So, well, data science is one of these competencies that we're trying to address to kind of further this agenda. And we've seen how data science and big data analytics can really provide practical insights and aid in the decision making of strategic decisions where within the health system. So it helps to build a comprehensive view of patients, consumers, and clinicians, and data-driven decision making really opens up a lot of new possibilities to boost healthcare quality, equity, and ultimately to advance these UHC goals. Yeah, we'll stop there.
Yeah, sure. And this is the end of my questions from my side, but I received one question in chat. And I think we mentioned about, LMICs and resource limited settings. And I think one, he has I'm not sure he or she, but this question is like this. Is what kind of initiatives can students, especially for now, young youth, makes to contribute to digital science in countries with poor digital infrastructures and practices? And I think this question is directed to three of you, because like we are from different backgrounds and for sure you have different perspectives to us this question. And maybe I will invite Robin to answer this first, and then Brian, and then Alan.
Yeah, sure. So I think what we've kind of have alluded to is that there are resources out there that are potentially free. And I think just to, as informal education, if the digital infrastructure might not be there, I think there's ways to educate yourself on what some of these methods are, or just some of the initiatives that are happening. I know, for example, this youth organization, I think is a great way to start getting involved and just to find out more what's happening and how can you insert yourself and be partnering with others. I think, and again, looking for some of those resources that are potentially free, that are accessible, I think is another way to do that. But I think if you are identifying that it's something that's under-resourced, you're in a prime position to really help shape that. If you are the one educating yourself and saying, this is what we need and this is where I think we should be going, I think is a great, huge opportunity to be able to influence the direction of that. So I think there are resources that you can tap into, and also being a part of other professional organizations or youth groups such as this can lend a lot of support and mentorship.
Yeah, thank you so much, Robin, for that. And Brian?
Sorry, my Zoom cut out. Could you repeat the question?
Yeah, sure. I sent it in the chat. So the question is like, what kind of initiatives can students make to contribute to digital science in countries with poor digital infrastructures and practices?
I mean, advocate for the need, I think is the big one. I mean, I've seen a lot happen when students advocate for curricula changes and practices. I mean, IFMSA is one of them. You know, they've managed to integrate, you know, climate change into the curricula. We're on our way to looking at how we integrate digital health and digital skills. I think some schools are already integrating, you know, computer science training into medical training and stuff like that. So I think we're on our way, and definitely you know, advocate, you know, locally at your schools, and you know, just shout.
Yeah, sure. Thank you, Brian. And Alia?
Okay, thanks. I'll definitely echo both Robin and Brian in terms of finding youth groups and communities that you can join, as well as advocating in your school and other places. And I'll add to that to start your own, maybe small community initiatives, such as some kind of community service. Think about how you can use very simple data science for small scale improving health. For example, you can think of, okay, we want to showcase how measuring mother's blood pressure and mother's sort of like all the health parameters in under-resourced community, and then detecting potential low birth weight or potential stunting, and you can show it using data science, have some faculty speaking or maybe some community figures speaking, and that attracts attention, and that helps also with your advocacy and helps you get to know the issue. So I think other than sort of like doing it internally, start also doing it externally. And there are many resources and funding for that if you just search for it. Thank you.
Sorry for the interruption, but thank you so much, Alia, Robin, and Brian for your answers. And I think we have only like 4 minutes left for our session, and I think it's perfect for us to do a brief wrap up for the session. And I would love like if all the speakers like you have some final words to deliver to the youth today who are in our audience, and and also maybe you can mention about like how data science can actually maybe change our behaviors in youth and to advance public and planetary health. Maybe we can start with Brian for the final words.
Yeah, sure. I mean, I think so. We've seen how data science has really matured and become easier to use over the past years. You know, everyone has started to understand data science and digitalization more because of the pandemic. And we saw how in some societies this has led to positive behavioral changes. So I think, you know, data science that aims to better model and predict behavior and diseases can lead to these recommendations and lead to behavioral changes. And I think youth can be at the core of a lot of these. You know, we're the most digitally literate generation. We can drive a lot of these changes and you know, start, you know, pushing this agenda to advance public and planetary health in a manner that is sustainable. Thanks. Back to you, Elaine.
Yes, thank you so much, Brian. And Robin, any final words and message to the audience?
Yeah, thank you. I echo kind of what Brian said as well, is that I just think get involved as much as you can. I think the adage, and I hate to sound kind of cliche, but it's really that, you know, kind of act locally, but think globally perspective. And this is really, I'm so excited and thrilled to be here, and it's really inspiring. And I think this generation has the ability to really transform what we think about data science and how we do it intentionally and thoughtfully. So great. Thank you again.
Yes, thank you so much, Robin. And I'll leave the floor to Alia for the final words.
Thank you, everyone. So again, I'll echo everyone. I'm really inspired by all the work and the enthusiasm that you have here. And I think you all have the potential to together transform health, partially using data science, but also other things, but also to be mindful of the risks of using data science. So I think Robin has highlighted the potential issues for ethics, also for data science maybe has also the potential not to actually bridge equity, but actually make it more unequal. So we have really to be cognizant of that. But otherwise, it really has the potential to transform both in decision making, in making care more accessible, as well as changing behaviors, because you see, okay, now we have the data like this, and we can use this also for community education. So I think I'll close on that. Thank you, everyone, again, for the opportunity.
Yes, thank you so much for the wonderful discussion. Like, although there are small glitches just now, but I don't think like it affects our discussion at all. And thank you so much for our panelists for being with us today and sharing your experience and your stories with us. And they're inspiring. I hope like we all get inspired for that. And thank you so much for attending this. And I think this I will close this session. And thank you so much for joining. And see you next year. Bye.
Thank you. Bye-bye.
Thank you.
Bye.
Bye.
Thanks, everyone.